I grew up in Regula's district.
Who?
Ralph
Oh,
Regula.
he was a big, yes.
And we're good.
Ohio.
Good morning, Mr. Doctor.
Good morning.
Thank you for joining us. You sound good,
All's good?
looking clear, looking great. Thank you, sir.
Brian, show me some money, Brian.
What?
Okay, just
Your
remember this awareness.
your
Hi,
Buffalo.
Mr. Castro. Hi.
How are you?
Hi,
Your
good.
Buffalo
Yes,
team
there's
ain't
no
been.
Next year, Billy.
John, thanks for calling me back. I know you're very important. I got to get on a list, but I will.
We're, just for members awareness, we're getting ready to go live here in just a moment.
Billy, I know I'm on your list. I've been there for quite some time now.
Five,
Billy, I
four,
just want you to know I was
three,
at the podiatrist.
two,
It was nothing
one.
personal.
The Ways and Means Committee will now come to order. Today we are continue our consideration of legislation to confront the economic and health challenges posed by the COVID-19 pandemic. We are continuing today in a hybrid format in compliance with the rules and regulations for remote committee proceedings pursuant to House Resolution number 8. Thank you all for your patience yesterday and your cooperation as we tried to navigate this challenging format. I thought that we made a pretty good effort. Before we turn to our first order of business, I want to remind all of a few procedures. First, consistent with regulations, the committee will keep microphones muted to limit background noise. Members are responsible for unmuting themselves when they seek recognition or when recognized by the chair. Committee staff will mute members only in the event of inadvertent background noise. Second, when members are present in the proceeding, they must have their cameras on. If you need to step away to attend another proceeding, please turn your camera and audio off rather than logging out of the platform. Third, when a question is put before the committee, members who are present on the WebEx platform are reminded to unmute themselves for a voice vote. Finally, when there is a request for a record vote, we will pause proceedings to allow the clerk to have time to set up. All members who are present remotely should stay on the platform to vote. Please do not come to the hearing room if you are already present remotely. Once the clerk is ready, we will proceed through the roll until every member has had an opportunity to vote. Please remember to mute yourself until the clerk calls on you and to repeat your last name when voting. And with that, our first order of business is Subtitle E, Budget Reconciliation, Legislative Recommendations Relating to Support of Skilled Nursing Facilities in Response to COVID-19. I now recognize the gentleman from Wisconsin, Mr. Kind, for the purposes of offering an opening statement.
Well, thank you, Mr. Chairman. Mr. Chairman, hopefully Subtitle E will move along smoothly. It should be non-controversial based on bipartisan legislation that we've offered in the past. But first, Mr. Chairman, let me thank you again and members of this committee and staff for bringing this important COVID relief bill before us. A little over a year ago now, the coronavirus first landed on our shores and declared war against the American people. What it required at the time was a wartime response and wartime leadership. But unfortunately, President Trump decided not to do that. Instead of developing a national strategy which would form a strong partnership with our states and local communities, he decided to, in his own words, downplay this virus, downplay its seriousness, downplay the urgency of the situation. Perhaps he was afraid it might disrupt his precious stock market or have an adverse impact on the economy. The truth is that he was not convinced the American people could handle the truth, that they could be leveled with in their response and what it was required to truly combat this virus at a wartime scale. And in order to avoid personal responsibility, he pushed all that responsibility down to the state and local level. And while they battled this virus over the last year gallantly, we all knew that they lacked the technical expertise to address it, the lack of clear guidance, and the lack of resources. In fact, the president created a 50-state bidding war for precious limited supplies to deal with this virus, driving up the price and countless shortfalls throughout our country. It was a missed opportunity. But now, 1 year later, we're approaching close to 500,000 lost lives in our country, more than the lives we lost in the entire Second World War. And now more potent variants are landing on our shores to declare war against our citizens. So clearly, now is not the time to stop. Now is not the time to raise the surrender flag or to pretend the virus isn't that serious and to force people back to work or schools to open without clear guidance and without the resources to protect people. And that's really what this COVID package is all about before us. It's responding to the needs of today. And it's listening to the top economists throughout the country who say more help is needed. It's listening to the top healthcare experts and scientists who are telling us more help is needed. It's listening to our state and local communities, but most of all, it's about listening to our own constituents who are still suffering from this coronavirus, families who are struggling, small businesses and family farms who are having a difficult time, healthcare providers who are trying to get shots in the arm while still treating COVID patients, schools trying to reopen safely and get the kids into the classroom. And now is the time for us as Congress to react and to respond collectively and address the short-term need to buy some more time to give us a chance to inoculate enough people to develop herd immunity. And I can't think of another entity that's been more adversely impacted during this crisis than our nursing homes, our long-term care facilities. You know, since the early days of the pandemic, nursing homes have been infection hotspots, accounting for more than 1/3 of the COVID deaths in our country, while just representing 5% of the positive cases. 5% positive cases, 1/3 of the deaths. And when COVID-19 surged across my home state here in Wisconsin last fall, our nursing homes were plagued by workforce and personal protection equipment shortages. So to address the vital need for additional support for our nursing homes, this legislation, Subtitle E, is twofold. First, it provides $200 million to fund the quality improvement organizations to support infection control in nursing facilities and prevent the spread of the COVID virus. This provision stems from my bipartisan bill, the Infection Control, Training, and Support Act, which I introduced with my good friend and colleague on the committee, Dan Kildee, as well as our Republican colleagues, Mr. Upton and Mr. Burgess, on the Commerce Committee. Second, this legislation provides $250 million in funding for nursing home strike teams, which can be deployed to nursing homes to combat virus outbreaks. And I do want to thank our colleague, Representative Jimmy Panetta, for his leadership on this issue. This provision stems directly from legislation that he introduced the Sending Outside Support Act, or the SOS Act. So I encourage my colleagues to support these common sense proposals to protect our nursing home residents and the dedicated professionals that work here. I encourage my colleagues to support Subtitle E, but most of all, I hope we can come together and support this package at the end of the day, Mr. Chairman. It's needed, it's necessary, and the time has come. Thank you, and I yield back.
I thank the gentleman. Now let me recognize the gentleman from California, Mr. Nunez, for the purposes of opening statement.
Thank you, Mr. Chairman, and I'll be very, very brief. Good morning to everybody. As I said yesterday, we have a lot of concerns about the way this package is being put together. One, because we've had very bipartisan COVID bills that passed in the last Congress. We all take this seriously. And in particular, California has been very hard hit with nursing homes. So we really are concerned about this also, but it would be better to do it in a bipartisan way and not pushing this in an overall budget package for $1.9 trillion. So we will continue to oppose these measures until we can come together in a bipartisan way. But I look forward to the debate today, Mr. Chair, and I appreciate the time. I yield back.
I thank the gentleman. The committee will now proceed to the consideration of Subtitle E. Without objection, the measure will be considered as read and open for amendment at any time. At this time, I offer an amendment in the nature of a substitute, which was distributed in advance, along with a green sheet explaining it. Without objection, the amendment in the nature of a substitute will be considered as read, open for amendment at any point, and considered base text for the purpose of amendment. Now let me turn to Amy Hall, the Staff Director for the Subcommittee on Health, to provide the technical description of the amendment in the nature of a substitute with an emphasis on changes made since introduction. I ask that members hold their questions until after Amy finishes her presentation. Amy.
Thank you, Chairman Neal and Ranking Member Brady. The committee print Subtitle E, Support to Skilled Nursing Facilities in Response to COVID-19, includes two sections. The first section, 9401, amends Section 1862G of Title 18 of the Social Security Act. It adds a new paragraph 2 that provides $200 million available until expended to the Medicare Quality Improvement Organizations, or QIOs, for the development and dissemination of protocols related to the provision and mitigation of COVID-19 in skilled nursing facilities. As you are aware, the 14 quality improvement organizations in Medicare work with providers to assist in a variety of tasks addressing patient safety and overall improvement of care. The committee print specifically dedicates funding for the purposes of infection control in skilled nursing facilities. The second section, 9402, amends Section 1819 of Title 18 of the Social Security Act to provide $250 million available until expended for establishment of strike teams that would be deployed to skilled nursing facilities to help with clinical care, infection control, or staffing. Both of these provisions ensure flexibility to target resources to areas most in need. The amendment in the nature of a substitute would strike R and insert is on page 1, line 15, and page 2, line 10. That concludes my walkthrough. I would be happy to answer any questions. Thank you.
Thank you, Ms. Hall. Are there any questions about the amendment in the nature of a substitute? Hearing none, we will proceed to offering members an opportunity to strike the last word. Does anyone wish to strike the last word?
Mr. Chairman.
Mr. Thompson is recognized to strike the last word.
Thank you, Mr. Chairman. As many of my colleagues and I have pointed out, the COVID-19 pandemic is no longer just a healthcare crisis. It's an economic crisis, a crisis for our children, a mental health crisis. But it remains, first and foremost, a pandemic. We can't get back on track without first crushing this virus. And this bill makes important investments in our healthcare system, which, in tandem with other portions of President Biden's rescue plan, will help us do just that. This bill expands subsidies for those making under 400% of the poverty line to help them afford their premiums. And it's important to note that expanding these subsidies has multiple benefits. Not only does this help working folks get the coverage they need, but it will drive up enrollment and improve the risk pool, which helps drive premiums down overall. This bill also provides subsidies to those who have been laid off over the past year through no fault of their own. And that's done by expanding COBRA subsidies through September and specifies that unemployed individuals without coverage can sign up for the coverage that they need. Lastly, I'm pleased that this legislation offers much needed support to our nursing homes, where many of our worst and most tragic outbreaks, including in my district, have occurred. I strongly support this bill, and I yield back the balance of my time.
I thank the gentleman. The gentleman from Florida, Mr. Buchanan, is recognized to strike the last word.
Thank you, Mr. Chairman. I rise to strike the last word.
Gentleman is
I
recognized.
want to add something up front until I get in my other remarks. But listening to my friends, Mr. Kine and Mr. Thompson, let me just say we could talk about the presidency, and that's part of it, no question. But also states and governors have some responsibility in this process. As I look to Florida, I feel very confident. Someone said there's no light at the end of the tunnel. We got to get back on track. I feel like we're somewhat on track. We're managing the economy. A lot of states haven't. They haven't taken the risk, but that risk has worked out for us. They're open schools safely. They're fighting the virus. So there's a lot of positive things done in Florida. I'm very bullish on where we're at and where we're going. I think a lot of the resources we're talking about today will make a difference. But I think it's also overkill when you're talking about $2 trillion. We're going to be bailing out a lot of states that have mismanaged. You can't put it all on the administration. You've got to take some responsibility at the state and local level. We've done a great job, I think. There's more that needs to be done. We're not there yet. But clearly, a lot of businesses are doing very well. So let me get back to what I wanted to talk about originally. I was disappointed to see Dr. Ferguson's amendment was ruled out of order, but I want to take a moment to express my strong support for it anyway. His amendment would help ensure senior citizens in rural and underserved areas receive COVID-19 vaccines and dedicate new funding towards mental health programs. We need to boost the supply and distribution of the vaccine so that people who need it can get it quicker, and the sooner the better. I have one of the oldest districts in the entire House with more than 225,000 seniors who are most at risk from the coronavirus. They need the shots and need them now. I think 80% of the people that are dying or passing away are 65 and older. And that's one thing I can tell you that Florida's done a good job. The focus in Florida is on 65 and older. Not to say it's not maybe in other states, but we've really, really focused on that. Many across the countries, especially our seniors have suffered greatly from some of the virus crippling indirect impacts, such as loneliness and isolation. Dr. Ferguson's amendment would also dedicate important resources towards valuable mental health services. This should not be a partisan issue. It's much too important to everyone. Again, thank Dr. Ferguson for his amendment, and I yield back.
I thank the gentleman. Let me recognize the gentleman from Texas, Mr. Doggett, to strike the last word.
Thank you, Mr. Chairman. It was 1 year ago that the first major COVID outbreak occurred in a nursing home in Seattle. We had the earliest of warnings that these nursing homes were highly vulnerable and susceptible to this virus, yet President Trump took no meaningful action. We're a year later, and 152,000 deaths of nursing home residents, with all the data lapse from the administration and the lack of testing. The number is likely much greater than that. Representing less than 1% of the U.S. population, nursing home residents have accounted for over a third of all COVID deaths. And the numbers don't tell it all. because each of these individuals likely represents a loved one of some family. The suffering stretches across our entire country. Now, with a humane president, we can consider some meaningful response. This bill includes our committee's share of $500 million for strike teams, a surge capacity, bringing trained health and emergency professionals into nursing homes that are struggling with outbreaks to try to prevent more virus and death. We've seen such strike teams work on testing in Austin and San Antonio and elsewhere across the country. They've set up oxygen and IV drips and covered for facility staff who were sick themselves. With chronic understaffing of nursing homes causing so many of our problems, these additional personnel can make a real difference. And this bill contains $200 million for quality improvement organizations, longstanding groups that contain consumer representatives and health professionals to offer expert guidance and training to Medicare providers. The last year, after COVID hit, Trump offered inconsistent guidance, delayed shipments of PPE and tests, and slowly forwarded substandard and inadequate equipment. Garbage bags for gowns were actually sent, highly inaccurate tests, and not even enough of those to do weekly, much less the daily tests that were required of staff in some areas. Not surprising, his CMS administrator for nursing home oversight declined our invitation to come at any time of her choosing, in any method, even by Zoom from her desk, or to send a subordinate. She ignored our written request. She was unwilling to explain the failures of the administration and the rollback of oversight. Mr. Buchanan is absolutely right that some states played a key role in this. And in Texas, governed by a Trump acolyte, it shares the responsibility for this needless catastrophe. As exposed by able investigative reporting in Austin, Texas hid the identity of infected nursing homes and delayed testing and provision of PPE. Sometimes nursing homes were the culprits, and in other cases, they were themselves victims of indifference. I salute those homes and their staff that work so hard to try to protect their patients and staff, but many have not. This bill's modest provisions are the very least we can do to try to solve the problem. Long before COVID, in too many of these nursing homes, systemic understaffing and rampant infection control deficiencies created dangerous conditions that this virus just made worse. To truly protect nursing home residents, we need to do much more in this committee. That includes adoption of my Nursing Home Transparency and Oversight Act to create a task force to examine and report on available survey, staffing, and ownership data. Critically, back in 2016, the nursing home regulations advanced by President Obama were so important, but they were delayed or reversed under President Trump. They must be reinstated, and additional action is needed to assure that we have enough staff to assure quality care for residents. We should also take a closer look at the corporate ownership structure that often diverts public dollars to pad CEOs' pockets, like the CEO who got a $5.2 million retention bonus in October and another $1 million when he retired in January, despite some questions about care in those facilities. Instead of focusing on quality resident care and safe places with fair wages and benefits for workers that will assure professionalism, too many nursing homes have cut corners and patients have suffered the result. Today's provisions are a modest step forward. We must continue the work to give nursing home residents the protection and the care that they deserve and that their families deserve. And I yield back.
I thank the gentleman. Let me recognize the gentleman from Nebraska, Mr. Smith, to strike the last word.
Thank you, Mr. Chairman and colleagues. I do want to just briefly note that I think what we're doing here is premature at best. The fact that there are funds currently parked at HHS and CMS that were advanced not long ago, the fact that those have not even been spent yet is very disturbing to me. The fact of the matter is, as well, these issues we have worked in a bipartisan fashion numerous times, very effectively so, I might add, and I think it's tragic that that is not happening today. Thank you. I yield back.
Thank the gentleman. Let me recognize the gentleman from Oregon, Mr. Blumenauer, to strike the last word.
Thank you, Mr. Chairman. I deeply appreciate your leadership in this area of nursing home legislation. I appreciate what our colleague Ron Kind has done moving this forward. And in fact, this is an area of some deep bipartisan interest. But it seems to me that this is not overreach. It's not premature. We have seen much greater significance, particularly as it relates to nursing homes with this pandemic, in part because, as was referenced earlier, we have had a disjointed national approach, leaving individual states on their own. We've had misinformation about the COVID crisis, about what the appropriate protocols are. It leads to confusion. And of course, the whole atmosphere of suspicion, doubt, and anger created by Trump and his sad approach to politics has spilled over. We saw last weekend some of the same mob mentality that attacked the Capitol intervene to try and prevent an inoculation center for vaccinations in Los Angeles. This particular issue today is personal for us in Oregon. We've seen residents in congregate care who've been obviously the most vulnerable to the effects, accounting for over half the state's deaths. In my district, there was just one facility, healthcare at Foster Creek, an assisted living facility, was an early indication of the magnitude of the problem and what we need to do. It had 119 deaths, 19 cases, and 29 deaths early in this process. The state ordered the facility to be closed because it demonstrated a consistent inability to adhere to basic infection control standards. State officials released an inspection report of the facility, noting that employees were not washing their hands, failed to properly socially distance, and were not trained on how to slow the spread of the infection. The timeline leading up to this decision shows that despite state oversight, patient harms and deaths escalated at an alarming rate. It took a month and a half and 28 deaths at this one facility before the state closed it down. In November, Oregon's long-term care ombudsman said record case and death counts in nursing home facilities reflected a systematic failure in our state. Clearly, facilities need significantly more support in infectious disease control to prevent further devastating fatal consequences. I strongly support this legislation because it would provide direct support specifically targeted at improving infection control in nursing homes. My colleagues across the aisle can continue to argue that we're spending too much and too soon. Well, I think evidence is to the contrary. Even before the pandemic, the GAO released a study that found 82% of facilities, which number over 13,000 locations, were cited for at least one infection prevention and control deficiency over a 5-year period. About half of these homes had persistent problems and were cited multiple years. In the era of the COVID crisis, this is deadly. We cannot wait for more individuals to suffer and die. We have clear evidence that help is needed. My constituents sent me here to do it. And in this crisis mentality, the pressure on all the states, they need resources like this to be able to set the appropriate responses to be able to save lives. I urge all of my colleagues to support this important legislation, and I yield back.
I thank the gentleman. Let me recognize now the gentleman from South Carolina, Mr. Rice, to strike the last word.
I wasn't going to speak on this, but hearing some of this testimony, I couldn't hold back. Certainly there have been areas with 20/20 hindsight that we could have done better and areas that we could have done worse. The fact that tens of millions of people around the world are being vaccinated right now, and this process has been going on for 2 months, is an incredible testimony to the leadership of the Trump administration through Operation Warp Speed. And I actually had, to Mr. Doggett's point about CEO pay of nursing homes, that we should investigate that. What we should probably do, I suppose, in Mr. Doggett's view, is just take them over and let the government run them like they run the VA. I'm sure the people in the nursing homes would be a whole lot better off. With respect to Mr. Blumenauer's point that a lack of a national strategy had something to do with the deaths in nursing homes, the plain obvious fact is that people over 75 are by far the largest number of residents in nursing homes and also the most subject to death in this pandemic, and it has nothing to do with lack of national strategy for nursing homes. In fact, a lot of the deaths that we've incurred in nursing homes is because of places like New York, where the governor mandated that sick people with COVID, be put back in nursing homes in the middle of a very population that was very subject to this disease. I actually spoke day before yesterday to the head of the South Carolina Nursing Home Association and to the National Nursing Home Association. And they said that the rollout in South Carolina, particularly with CVS and Walgreens overseeing it, has gone exceptionally well, and that 70% of nursing home residents at this point have received at least one dose of their vaccination. So I was shocked to hear that the number was that high, and I would expect the resulting number of infections and the number of deaths will plummet within the next month if that continues apace, and I fully expect that it will. So this, with respect to this particular bill with the $200 million for strike teams and the $250 million for consultants, I hope that has some viability. I hope that it has some benefit. I will say that both the national head of the Nursing Home Association and the state that I was speaking to on the phone questioned whether or not it would have any real effect. And what they were more concerned about is making sure, because obviously their occupancy is way, way down because people are afraid of nursing homes, number one. But their occupancy is way down, but they need to survive. I mean, there's certainly a big need for elder care, and we don't need to undermine these folks. And they want to make sure that their provider fund is adequately, provider relief fund is adequately funded. So they didn't have any big problem with this $450 million, and certainly in the relative scheme of things, it's a fairly small amount of money. But they just questioned how much benefit that it would provide, and with that, I yield back.
Thank the gentleman. Let me recognize the gentleman from Illinois, Mr. Davis, to strike the last word.
Thank you, Mr. Chairman. I move to strike the last word.
The gentleman is recognized.
Mr. Chairman, before the COVID-19 pandemic, many nursing homes and long-term care facilities for years have faced challenges in providing appropriate and safe living conditions for seniors and disabled residents. In addition, shortages of various staffing levels, especially registered nurses, and infection control procedures were not adequate to prevent diseases. Research studies have shown that 1.6 to 3.8 million infections occur in long-term care facilities. Common infections include urinary tract, pneumonia, influenza, enteric illnesses, skin and soft tissue infections, as cited by some analysts as a growing problem in nursing homes, which result in high costs for treatment and hospitalizations. Accordingly, some of these infections decrease the quality of life, inflict pain, and cause death, which is estimated as high as 380,000 per year. Most of the residents living in long-term care facilities have chronic illnesses and conditions that make them vulnerable to infections. Since the corona pandemic, nursing homes and long-term care facilities have been major hotspots in the spread of this disease to a highly susceptible population. Center for Medicare and Medicaid has oversight for the certification process for nursing homes. This policy initiative that we are considering today would improve infection control in nursing home settings, lower the incident rates, and enhance the quality of care for Medicare beneficiaries. I support Subtitle E support to skilled nursing facilities in response to COVID-19 and the reconciliation package that provides the Department of Health and Human Services $200 million for assistance to skilled nursing facilities and $250 million to states, District of Columbia, and territories for deploying strike teams to skilled nursing facilities in response to the COVID-19 pandemic. I support this effort to reduce and control infections in nursing homes and yield back the balance of my time.
I thank the gentleman. Let me recognize the gentlelady from Alabama, Ms. Sewell, to strike the last word.
Thank you, Mr. Chairman. I support Subtitle E to provide additional resources to our nation's nursing homes. Even in typical times, nursing homes are hotspots for infection and disease. In the United States, 1 to 3 million serious infections occur in nursing homes each year, and more than 388,000 residents die due to these infections. And over 60% of the facilities have been cited for deficiency relating to infection control since the beginning of 2017. To no surprise, the COVID-19 pandemic has only exacerbated the threat to residents at long-term care facilities. Nursing homes represent an estimated 1/3 of the COVID-19 deaths across this nation, more than 50% in some states. And yet these facilities continue to have inadequate access to personal protective equipment, to testing, and still endure staffing challenges. Yet the survival rate are even worse at nursing homes with more non-white residents. The pandemic has laid bare the historic disinvestment that has been made in our healthcare systems for people of color. My constituency is painfully aware of the pervasive, systemic, and institutional influence that have contributed to these disparities. As we've seen in study after study, our nation's nursing homes are not immune to these trends. They are largely isolated, and they serve higher minority populations and are more likely to be overcrowded and to have lower quality ratings. A University of Chicago study found that nursing homes with more than 40% of the residents who were people of color were experiencing a death rate more than triple the rate of those nursing homes with majority white residents. In Alabama, AARP reported that there were 1 COVID-19 death per 100 nursing home residents, and that there were 5 confirmed cases per 100 nursing home residents in Alabama. After speaking with my nursing home administrators in my district, it is clear that too many of them have had to do more with less. They are struggling to make sure that they are providing the adequate care and, in addition, the superior care that we would expect to have with our elders who are in these long-term health facilities. The spread of the disease needs support. It needs direct assistance for sure to the provider relief fund, but it also needs supplemental support, which this bill will provide. This legislation will give additional support to nursing facilities struggling to contain outbreaks by providing critical funding for the deployment of strike teams and Medicare quality improvement organizations. Preliminary data shows that these on-the-ground resources are effective, with incidence rates being 30.7% lower in nursing homes after receiving the support from these quality improvement organization and strike teams. To be clear, so many of my nursing home administrators are every day doing their job, trying very hard to contain the outbreak and to make sure that our elders are cared for. What they need is not only more supplemental support, they clearly need more direct support. I am in favor of this this bill and this part of the bill, because I know that this will continue even in good times. We have to decrease the infection rates in our nursing homes. We must show them the leadership from the top that what they're doing is important for the families and the residents in long-term care facilities, and most importantly, that we see them, that we hear them, and that help is on the way. Thank you, Mr. Chairman. I yield back the balance of my time.
I thank the gentlelady. Let me recognize the gentleman from California, Mr. Panetta, to strike the last word.
Thank you, Mr. Chairman. I move to strike the last word.
Gentleman's recognized.
Thank you, Mr. Chairman. I want to thank you, and of course, I want to thank Representative Kind and the Ways and Means staff for their leadership, your leadership, the work, and the focus on the vulnerability of nursing homes, but also this type of solution for our nursing facilities. As we have seen throughout this pandemic, unfortunately, residents and workers at nursing homes are particularly susceptible to COVID-19. Now, although the nurses and staff at these facilities are doing what they can during this crisis, it's clear that some of these facilities need more support to properly care for their vulnerable inhabitants. That's why, with the help of committee staff, I introduced the Sending Outside Support Act, or the SOS Act, part of which is included in the package today. Now, Subtitle E will provide the funding necessary for clinical and non-clinical strike teams to actually go into those nursing homes in need and provide the necessary support to protect our loved ones who live and work in those facilities. More than 1/3 of the United States coronavirus deaths are linked to nursing homes. To date, over 136,000 residents and workers have died from COVID-19 at nursing homes and other long-term care facilities across our country. I believe that this can be remedied with this subtitle. Strike teams have already been used with great success in a number of states, including Maryland and Massachusetts, to ramp up care in these places that have seen the highest COVID-19 case counts. Again, we all know that nurses and staff in these facilities go to great lengths to keep those in care healthy and safe, in those care facilities healthy and safe. But the severity and intensity of this pandemic demands that this type of legislation to provide federal funding and additional and necessary comfort and care. And my dog agrees so also, as you can hear him in the background. I yield back, Mr. Chairman. Thank you.
I thank the gentleman. Let me now recognize the gentleman from Nevada, Mr. Horsford, to strike the last word.
Thank you, Mr. Chairman. I move to strike the last word.
Gentleman is recognized.
Thank you. And I appreciate you, Mr. Chairman, leading today's markup in support of funding to improve quality and infectious control measures of COVID-19 in skilled nursing facilities. COVID-19 is not only rampant in nearly every state, but also knocking on the door of nearly every nursing home. COVID-19 has killed more than 136,000 residents and staff of nursing homes and other long-term care facilities, representing about 40% of all coronavirus fatalities in the United States. Just between September and December of last year, COVID-19 deaths and cases in nursing homes increased fourfold. Between residents and staff, there were 20,000 COVID-19 deaths and more than 200,000 new confirmed COVID-19 cases in nursing homes in the 4 weeks ending December 2020. This is heartbreaking for so many reasons. I recall having a town hall with my constituents, a virtual town hall, and one constituent expressed the fact that she was unable to see her brother, who she cared for, and couldn't visit the nursing home because of the restrictions that were put on them, and how that affected her. As someone, I think I've shared this with the committee before, my grandmother lived in a nursing home for 27 years of her life after suffering a debilitating stroke. But for Medicaid and Social Security, I don't know that she would have had the quality of life that she did for all of those years. And so I want to again commend our first line healthcare responders, those who are working in these nursing home facilities, the nurses, the administrators, the maintenance workers, everyone, because you all are doing incredible work and you need more support. These numbers, though, are by far the highest numbers since the federal government began collecting and reporting these data in late May. The numbers are much higher due to a lack of sufficient reporting. In Nevada, it is estimated that 1/3 of nursing home residents who died after contracting COVID-19 had not been publicly reported. So we must do better by our seniors and by their loved ones. To combat these gaps in reporting, I plan to reintroduce the Nursing Facility Quality Reporting Act of 2020. My bill would require CMS to publicly report demographic information on COVID-19 infections and deaths and track the disproportionate impact of the coronavirus. I want to commend Representative Kind and all of those who have worked on this measure. I can only imagine for those families how terrifying it must be for residents and their families, and how heartbreaking it is to have so little information and lack the ability to see their loved ones, as I said. It is our job to ensure the quality care for residents through adequate staffing, oversight, and access to in-person formal advocates called long-term care ombudsmen. To improve outcomes for our nursing home seniors, we must provide direct support that targets infectious control and improves the overall quality and health for our seniors. Again, thank you, Mr. Chairman, for your leadership on this issue. Thank you to my colleagues. This is not a partisan issue. Let's get this done and help all of our nursing homes, all of our elders and their families. Thank you.
I thank the gentleman. Since there have been no more requests for striking the last word, we are now prepared to proceed with the amendments phase of this markup. Are there any amendments to the amendment in the nature of a substitute?
Mr. Chairman.
The gentleman from New York, Mr. Reed, is recognized. Before that,
An amendment at the desk, Mr. Chairman.
we'll allow you to pass that out now, Mr. Reed, and I want to recognize the gentleman from Virginia, Mr. Byer.
Thank you, Mr. Chairman. I reserve a point of order on the Reed amendment.
The gentleman from Virginia has reserved a point of order. We'll make sure that this amendment is passed out, and then we will have Mr. Reed offer up his amendment. gentleman from New York is recognized to speak on his amendment. Mr. Reed.
Thank you, Mr. Chairman. Mr. Chairman and my colleagues on this committee, as many of you, if not all of you know, we had a horrendous situation in our great state of New York with many of our parents and grandparents dying as a result of terrible policies directed by our governor, Governor Cuomo, when it comes to his nursing home directive that sent 15,000 of our residents to their death by way of an order that Mr. Rice just recognized in his commentary in the debate that he had here with our colleagues. Governor Cuomo issued an order that in March of 2020 that sent known COVID-19 positive patients to nursing homes where non-positive COVID-19 patient residents lived, and then housed those COVID-19 positive patients in that nursing home so that that virus could spread throughout those nursing homes and ended up killing 15,000 of our fellow New Yorkers. I have to tell you, that order was in effect for over 46 days. It has taken months to get to the bottom of that order. And I thank our Attorney General, who is a Democrat, who recently issued a report to come to the conclusion that our governor covered up that order and the decisions that related to that order. And finally, we have some justice appearing for those 15,000 souls. But I also have to indicate to my colleagues that it's not just in New York that this order was issued. This exact order back in March of 2020 was essentially copied for approximately 5 to 10 other states. They were all Democratic governors, is what my evidence shows me, where this edict was copied across the nation back in March 2020 and April 2020, where COVID-19 positive patients were sent into nursing homes where non-COVID-19 residents lived. So if 15,000 residents died in New York, if there's 10 states where this happened elsewhere, does that mean 150,000 of our American citizens died as a result of that order? Well, I just got to tell you, now that we have uncovered by our Attorney General's report what happened in regards to the situation in New York and justice needs to be done, I have offered an amendment today that essentially calls upon the governors of our states to certify, as they receive the funds under this bill, that all the information that they have to are obligated to deliver to CMS, to CDC, and our other national agencies, that when they report that data, when they report the data that's occurring within our nursing homes, that they have to certify that the data is accurate and that it's honest and that it is fully compliant with all laws that are submitted to those oversight agencies that make sure that our nursing homes are safe and secure for our senior citizens that we all love and care for so deeply. This amendment is essentially just a simple certification by our governors, to be honest, so that the Attorney General doesn't have to go through that investigation to uncover the truth, like she had to do in New York State. We have bipartisan support in New York with Senator Gillibrand joining with us for a full investigation to get to the bottom of this horrific situation for this nursing home scandal in New York. But we should be able to do this together here so that all states are getting the information to our oversight agencies here at the federal level, just to make sure that the data and what is occurring with COVID-19 is true and accurate. That's all I'm asking. That's all I'm asking. There's no delay in the funds. There's no delay or an additional bureaucracy that has to occur, just a signature. Just a signature to say that the data is accurate. And all I'm asking for you to do is support this amendment and include it in this legislation so that we can make sure that those 15,000 souls in New York at least have justice and know that they didn't die for nothing. and that we don't have to wait for additional deaths to occur. We can avoid that by learning from their deaths so that they never happen again. And so I encourage you to please support this amendment and include it in this legislation. And with that, I yield back.
Thank the gentleman. Does the gentleman from Virginia continue to reserve a point of order?
Mr. Chairman, I do not. I withdraw the point of order.
Point of order has been withdrawn, and let me now recognize another gentleman from New York. Let me recognize a gentleman from Wisconsin first, Mr. Kind, to speak on the amendment.
Thank you, Mr. Chairman. Mr. Chairman, I encourage my colleagues to reject this amendment. And to my good friend from New York, and he is a friend of mine, my suggestion is if you want a GAO report, well, just request a GAO report. You don't need an amendment in order to move forward on that basis. But part of the problem that you're addressing is real. And this does stem from the previous administration, I hate to see. It was because of a lack of national standards and guidance on reporting requirements and the shuffling of responsibility back at the state and local level that it was a wild, wild west situation when it came to the reporting of data and the important information that we needed, especially in the early stages of this pandemic. So we had a clear picture of what was going on out there. That now is being corrected in the current administration, long overdue. So work is being done now in order to ensure that there's
I'm tired of the blame.
Mr. Kind,
I haven't
Mr. Reed, Mr. Kind controls the time.
I'll let you disgrace 15,000 souls of my residents of New York with blaming someone. Justice has to be done.
Mr. Reed.
To you.
Regular order.
Thank you, Mr. Chairman.
Thank you.
Thank you, Mr. Chairman.
Mr. Kind controls the time.
Every governor wants accurate information being reported, but to have them certify based on third-party assurances, I don't think is the appropriate way to go. If there's investigations that need to occur, there are avenues of doing that. If a GAO report is necessary, you can request one, but we don't have to do it through this amendment process. And we ought to be working with the current administration to correct any deficiencies that existed in the past. I know in talking to my nursing homes, my long-term care facilities the past year, they were incredibly frustrated with the myriad of reporting options that they had, and coming from states, coming from various agencies, and they were just spinning out of control. So we do need clear guidance as we move forward. So, and if the gentleman wants a little bit of time, I'm happy to yield at this time.
Please. Because I would ask you to join in our Justice Department request. That would be a bipartisan request to this administration. That's already been already.
Mr. Reed, send it to my attention. I'd be happy to take a look at it. Thank you, Mr. Chairman.
Thank the gentleman. Let me recognize the gentleman, the new member of the committee, Mr. Smucker. Speak on the amendment.
Thank you, Mr. Chair. I'd just like to thank Mr. Reed for introducing this amendment. I'd like to speak in support of this amendment. We had a similar situation in Pennsylvania, where the governor in Pennsylvania and the Secretary of Health made the same decision and against CMS guidelines to require sick patients, those with COVID, to be transported and transferred to retirement facilities with healthy individuals. And not every state did this. This was one of only 5, is my understanding, where that decision was made and with disastrous consequences. And they knew what they were doing. In Pennsylvania, the Secretary of Health, Dr. Rachel Levine, at the same time that this order was in effect, took her aging mother out of a long-term care facility and put her in a hotel. So the order was good for others, but not for her and for her mother. It was disastrous, and it's an abomination that that was allowed to occur. Her reward for this, by the way, Dr. Levine, is she was nominated by the President to be an Assistant Secretary of Health. Not yet confirmed by the Senate, but has been nominated by the President after that kind of decision was made with those disastrous consequences in Pennsylvania. So I'd like to thank Mr. Reed for introducing this resolution, and I strongly support this. Yes.
Will the gentleman yield? Will the gentleman yield?
I will yield, yes.
Using the gentleman's time, this is exactly the point. This order was drafted by Governor Cuomo, copied by other governors across the nation that sentenced tens of thousands, if not hundreds of 100,000 of our fellow citizens to their deaths. And you guys are afraid to join with this certification just to make sure that no further deaths will occur because of this faulty decision making. They sent COVID-19 positive patients to nursing homes knowing they were COVID-19 positive, knowing that CMS said don't do this, and the governors did it anyway. And we want to get to the bottom of it. It took our Democratic Attorney General, a Democrat, to investigate this and hold our governor accountable. And I applaud my colleague from Pennsylvania for calling out the hypocrisy of his Department of Health director, who said, you know what, I'm going to send these COVID-19 positive patients into nursing homes, knowing they're positive, but I'm going to take my own mother out of that nursing home because I know that my mother potentially could be killed by that order. Doesn't that raise headlines for you? Doesn't that show you what's going on here? These people knew what they were doing, and they were under the orders of governors to do this. Why can't we get to the bottom of this and make sure no other fellow American dies as we deal with COVID-19 and try to put it into the history books? Why are you so afraid to accept this amendment? And so with that, I yield back to my good friend from Pennsylvania, and thank you for bringing this to the attention of the public and the press, that I hope, please, report on this. It's horrendous.
Mr. Smucker controls the time.
Just one additional. I'll never forget a conversation that I had with the administrators of nursing homes in my district during this time. And I could sense the frustration in their voices, where not only did they feel they weren't getting support, but they were being required to do this when they are much less equipped to handle infectious diseases than the hospitals, which, by the way, were mostly empty at this time. Mostly empty. The hospitals, who would have been prepared, better prepared, and are caring for COVID patients all the time, should have been the ones taking care of individuals who had already contracted COVID. So again, I'd like to thank Mr. Reed for introducing this amendment, and I urge the support of the committee for this amendment.
Thank the gentleman. Let me recognize the gentleman from New York, Mr. Higgins, to speak on the amendment.
Thank you, Mr. Chairman. I think what Mr. Reed brings up is, I wish to strike the last word in opposition to the amendment.
Gentleman is recognized.
This issue needs to be investigated, as does the larger problem, and that is the failed federal response to COVID-19. We have 5% of the world's population, and we have 25% of the COVID-19 deaths. 40% of the deaths nationally, 40% of the deaths nationally occurred in long-term facilities. The situation in Ohio is dire. The situation in Colorado is dire. The situation in Arkansas is dire. The situation in Minnesota is dire. And the situation in New York is dire. But as you know, a lot of the funding for nursing homes comes from the Medicaid program. And when there's a delay of almost 10 months in providing states assistance, this is disaster relief assistance, states that do most of the spending when it comes to Medicaid, and Medicaid is what finances long-term care facilities and nursing homes. This bill, the underlying bill, is a bill to address the things that should have been addressed 10 months ago. And if it had been done, I am convinced that the high number of deaths, 40% nationally, that have occurred in nursing home and long-term facilities would be much less, because the states would have had the resources to address things like staff shortages, to address things like personal protective equipment. It didn't. In times of national disaster, the federal government marshals its resources to ensure that the states and localities at the local level have the ability to respond on the ground. That didn't happen. So this is an important problem Mr. Reed has brought to the attention of a lot of people, supported by, as he mentioned, the Democratic Attorney General in the state of New York, but it's symptomatic of the larger problem. Americans are not allowed in Canada because of our failed government response, federal government response. Americans are not allowed in 27 European Union countries because of our failed federal government response. The new administration has put together a bill, $1.9 trillion, simple, fast, and big, to get real relief to people that need it now. That's the good thing. The bad thing is it's 10 months late, and these nursing home deaths, be they in New York, Ohio, Colorado, or Minnesota, or any other state, is a consequence of that failed federal government response. With that, I'll yield back.
I thank the gentleman. Let me recognize the gentleman from South Carolina, Mr. Rice, on the amendment.
You know, I just so tired of hearing about a lack of national response. It's complete garbage. In fact, CDC has been uniformly, through science, issuing guidelines throughout this entire process. And I just wonder if the Democrats had been in control of all three branches of government as they are right now, what the national response would look like. I suspect we would have shut down the entire country, and that there wouldn't have been a marked change in the infection rate, and that our economy would be on its knees, that we would have a 10 or 15% unemployment rate rather than half that we have right now. And in response to looking at the, and I don't know, I mean, you know, we had a Democrat in control in New Jersey and Pennsylvania and New York, and their response was to ship sick people into the most vulnerable population. Would Joe Biden have adopted that same national policy, and would we have had 50% more deaths than we do right now? I don't know. I can only suspect. But thank goodness we have a variety of states that tried a variety of things, and we're still learning, and we're getting more and more best practices as we go. And I use states like Texas and Florida and other places as models, and South Carolina, who South Carolina has right at the national average of COVID deaths per 100,000. And also Florida does too, and their economies are far, far better because they remained relatively open. Looking in response to what Mr. Higgins was just saying right now, that we are not allowed Americans aren't allowed to travel to a number of European countries. Well, in fact, our deaths per 100,000, they're not allowed to travel here either. And our deaths per 100,000 are less than Italy, the United Kingdom, Germany, Poland, France, Spain, Portugal. So these European countries that y'all like to hold up as a model, in fact, have had a worse experience than we have under our quote unquote lack of national response. It's complete garbage. CDC has issued guidelines throughout, and states are able to access those guidelines and to follow them as they deem appropriate. And also we have to recognize the success that we have had here with this. We're a year into this, 1 year into it. We have 2 vaccines online and 2 more getting ready to come online. 70% of the residents of nursing homes in South Carolina have been at least 1 vaccination in the last month. What a remarkable achievement. I mean, this is an achievement that is almost like the roll, or even better, probably more effective than the rollout of the polio vaccine. It's been done in record time. We're going to see deaths plummet. We're already seeing cases turn down dramatically. Cases after peaking in mid-December, are now back to the levels of early November and going and falling off a cliff, cases per day. And deaths per day they lag by weeks, and they're just starting to turn down. So the vaccine rollout is already having an effect. That effect is going to continue to accelerate. And so, my opinion is we should slow down and look at it. We just adopted $1 trillion package in December. I know y'all are in an awful rush to cram in as much as you can into a $2 trillion bill before this emergency goes away, so that you can justify sending a bunch of money to bail out states and to repeal the SALT deduction and all these other things that you want to do. But again, this entire hearing process is flawed. We should take our time, take a breath. We should analyze where we are, analyze how the money that we've already authorized is being spent, make sure it's being put in the best possible place, and then if we need to spend more money, we should better target those funds. I yield back.
I thank the gentleman. Let me recognize the gentleman from New York, Mr. Swazi, on the amendment.
Thank you, Mr. Chairman. I speak in opposition to this amendment, but before I address the amendment specifically, I want to just address some of the comments Mr. Rice made. It's hard for me to imagine that anybody could possibly say that the response to this pandemic has been successful. You think of the families in this country that have been affected so dramatically. It's just, I'm perplexed by the whole thing. Mr. Rice said he wondered what would happen if the Democrats were in control of the presidency, the Senate, and the House. What would they have done, or what would they do? They're going to do a $1.9 trillion package to comprehensively address this program the way it should have been done a long time ago. We're going to use the Defense Production Act to make sure we have enough vaccines and enough supplies to address this issue in a comprehensive way. We're going to look out for those families, those 25% of people that make under $40,000 a year that are still unemployed, that can't go back to work, even though they'd like to go back to work, because the industries they work in have been decimated. We're going to look out for people in all the different facets of our economy that are being ruined, whether it's the restaurants or the catering halls or the live entertainment venues or the mom and pop shops. We're going to look out for those people that are struggling to pay their most basic expenses. That's what's going to happen in this administration. We're going to try and get our economy moving again. We're going to try and put people back to work. That's what's going to happen under Democratic control. Now, regarding the amendment that Mr. Reed has suggested here, I don't think I have to remind everybody that my father-in-law died last year, early on in the pandemic. He was 92 years old. He was in an assisted living facility. He died very quickly, and he was transferred to a hospital. He died in the hospital. His death was recorded in the hospital and not in the assisted living facility, which is the source of a lot of the controversy that's happening in New York. Where were the deaths recorded? His death was recorded. It's in the statistics of New York State, but he was reported as dying in the hospital and not recorded as dying as coming from an assisted living facility. The funding that's being proposed in this legislation now is to help nursing homes improve infection control and give them the resources they need to respond to COVID. We owe it to the nursing homes to actually help them, to give them the help that they need to move forward. I'm not suggesting that Mr. Reed is trying to politicize this by talking about, the number of Democratic governors that did this, or that it's happening in Democratic states, or that it's a Democratic attorney general going after a Democratic governor. I don't think he's politicizing this. This is much too important a topic and much too sensitive a topic that has affected so many families in this nation that I know he wouldn't politicize this. But I don't think we should be trying to block any legislation to my state or any other state. We see that the Attorney General of New York State is looking at this. We see that people are going to debate this. We know that there's going to be studies, but let's remember that in March and April of last year, we had refrigerator trucks full of dead bodies in New York State.
Gentleman yield?
No, I will not yield at this time. We had refrigerator trucks full of dead bodies in our state, all throughout the state. People were overwhelmed by this. We were the first hit, the hardest hit, the epicenter of this problem in the nation. And now, 9 months later, 10 months later, the idea of holding up funding for nursing homes that are affected throughout the country, as Mr. Higgins pointed out, this is not a problem in one state. This is happening in every state. GAO report said that 80% of nursing homes nationwide have infection control issues. We know that a third of all the deaths in the country are from nursing homes, maybe more than that based upon the statistics that come out as time goes on. But we shouldn't in any way be holding up funding for nursing homes to try and address this problem in a serious way. And at this time, I yield back my time.
I thank the gentleman. Let me now recognize the gentleman from Georgia, Dr. Ferguson, to speak on the amendment.
Thank you, Mr. Chairman, and I'm going to make a couple of brief remarks, and then I'm going to like to yield some of my time to my colleague from New York, Mr. Reed, if he would so like to use it. So first of all, talking about the national response, I think it is a remarkable achievement of this country that we have almost vaccinated or will vaccinate almost 100 million Americans against a disease that we knew virtually nothing about a year ago. And from a scientific standpoint, to be able to harness American ingenuity and productivity and develop a public-private partnership called Operation Warp Speed so that we can deliver this life-saving vaccine is a pretty remarkable national response. And to my colleagues that say that the previous administration has failed, we are facing the single biggest threat to our economy and to our lives that we have known with this pandemic. And I think that there were a lot of successes. But the overreach that we're seeing right now is not what this country needs. Listen, look at what we have already debated the fact that while we all agree that certain Americans and certain industries need some targeted relief, the Democrats rejected a very common sense approach to a real problem, which is paying people more on unemployment than they make at their regular job. Listen, if you want to say we want to help those folks that can't go back to work because they want to, but they can't, well, let's pay them the same as what their normal paycheck is. Let's not pay them more. I think that's a common sense approach. And then to say that you want to address all of America, again, you rejected amendments yesterday that would have directed needed help and assistance to seniors in rural areas and address the mental health crisis that our youth are facing from not being in school. And then you go and you say, we want to increase funding for group daycare settings, yet we won't open schools because it's not safe. How are kids safe in group daycare settings, but not safe in schools? Science does not back that up. And now we want to provide liability protections for those frontline defenders, those people that are out there working. And again, liability reform for people that are doing things the right way, not those that are that have gross malpractice and negligence, and whether it's in the healthcare industry and their businesses. And you won't provide liability protection for that. But on this particular amendment, you won't shine the light on perhaps one of the most egregious problems of this whole deal, which is a governor sending 15,000 people to their death in nursing homes. Come on, let's get real with this. And with that, I will yield the balance of my time to my colleague, Mr. Reed.
I appreciate the gentleman yielding. And to my colleague from New York, Mr. Swazi, I'm not going to fall for your little political game of saying this isn't being politicized, because this is not being politicized. I will tell you exactly what this is. This is about 15,000 of our fellow New York residents who died because of the order that was signed by Governor Cuomo for 46 days, sending COVID-19 positive patients to their death to our nursing homes. And when you say that there wasn't a national response to this, and on this point alone, it was clear the federal government under the CMS guidelines had clearly said, don't do this. Do not send recommended to the states, do not send COVID-19 positive patients to nursing homes from the hospitals, knowing that their COVID-19 positive status into nursing homes where non-COVID-19 positive patients were living. And also, doesn't common sense dictate you shouldn't have done that? Doesn't common sense say don't put COVID-19 positive patients into a population of senior citizens who are most at risk of getting and dying from COVID-19? Why would you put COVID-19 positive patients into nursing homes filled with non-COVID-19 infected people? Why would you do that? That's the simple question we're trying to get to the bottom of to make sure this never happens again. And one of the things that you need in order to make sure you understand that decision, because for the life of me, I have no idea why Governor Cuomo and the other governors that signed this order that just cut and pasted this order across, because they're all talking to each other and they happen to be Democratic governors that just cut and pasted this order, for whatever reason, thought this was a good idea. It was not a good idea. It defied common sense. So what we're trying to do is get the data. Make sure all I'm talking about is the governor signing the piece of paper when it relays the data to the federal government, that when they receive this money, the data is accurate and honest. That's all I'm looking for. I know it, you know it, and others know it in New York, that the Governor Cuomo, when he did that, didn't sign accurate data. And with that, what I'm looking for is just hold accountability and make sure this never happens again. And the gentleman's time has expired, so my time has expired also.
Thank you, gentlemen. I believe Dr. Winstrup is the last speaker on this matter. The chair recognizes Dr. Winstrup on the amendment.
Well,
I'm
thank
sorry,
you, Mr.
I'm sorry,
Chairman.
Mr. Schweiker will be recognized in order too. Thank you. Dr. Winstrup.
Okay. Thank you, Mr. Chairman. And, you know, I do speak on behalf of this amendment, but I'd just like to point out some things. You know, when we're trying to solve problems, it doesn't do us any good to just continue to berate in a political manner. You know, I keep hearing from my colleagues across the aisle how the previous administration botched so many things. There were mistakes made. There were mistakes made in the scientific community. There were mistakes made. There were bad hypotheses made. You know, but when this whole thing first started, let's not forget what the gentleman who's now our president once said: you shouldn't restrict travel. Wrong answer. Nancy Pelosi said, belittled the president, President Trump. Everyone come to Chinatown. There's no problem here. You had scientists say, come summertime, this will probably go away like we usually see with other viruses like this. It didn't happen, did it? Along the way, we developed therapeutics and products that were able to treat patients. We found that we needed these ventilators, and we did, but at the same time, we found ways to treat people so they wouldn't need a ventilator. We saw Operation Warp Speed, which I can tell you this previous administration engaged the doctors in Congress on this every step of the way to assure Americans that this was being done right. And we developed a vaccine in less than a year, when previously we've never had a vaccine until the earliest was 4 years. And I tell you, the process was done right, just more efficiently, and actually expanded the number of people that got in trials. And I thank those Americans that got in these trials. And yet you saw candidate Biden, candidate Harris saying, don't take that vaccine, not if Donald Trump likes it. Well, Donald Trump doesn't decide whether it's good or not. It's Americans that have the knowledge, Republicans and Democrats that have the knowledge. So if you want to talk about who was putting roadblocks into this whole process, there's a lot of blame to go around. And I'm tired of the pious nature that we're hearing from people that aren't recognizing how far we actually did come and where we are today. Because the same people that were belittling the vaccine under the previous administration were probably some of the first in line to get it. And those are facts. You even have President Macron of France, hardly Trump's best friend, commenting on how well America did through all of this. We've got issues to deal with right here, right now. Let's do it. Let's be honest with one another. Let's cut the political garbage and work on behalf of people and save more lives going forward and get people back on their feet. With that, I yield any remaining time to the gentleman from New York, Mr. Reed, if he cares to have it.
Mr. Reed has been yielded the time.
I know exactly the amount of time, but I want to reiterate the points here. We know that in March of 2020, the federal government under CMS and President Trump said, do not send COVID-19 positive patients into nursing homes where there's non-infected senior citizens living. Governor Cuomo and other Democratic governors, because they're cutting and pasting these orders, did exactly that. In New York, 15,000 of our fellow New York residents died. They were sentenced to their death. It took an attorney general on the Democratic side of the aisle, because we have a Democratic attorney general, and I thank her for doing it, investigated what was hidden in the data, what was hidden by our governor, where he didn't come clean and show the truth in those numbers. And we finally got that attorney general report. And I thank her for doing that. So this is not politically motivated. Now, if the governor had provided honest and accurate numbers, like this amendment will do, so that when they receive these funds, there is certification and reports to make sure that the data is accurate, so we do not need additional attorney general investigations to get to the bottom of the data. That is what we're looking for, so that we don't have to have further deaths and further attorney general investigations to go into the data that's hidden, that is obstructed by governors who are trying to cover up their sins. The gentleman's time has expired. Maybe I can continue this.
Gentlemen, let me recognize the gentleman from Arizona, Mr. Schweikert, on the amendment.
Thank you, Mr. Chairman. And a little disappointed in some of the debate. I beg of everyone, could we leave our November talking back in November and start dealing with the reality of being intellectually credible on what we're up against? The Reid Amendment, actually, I will argue, is just the very beginning. And my data may be a little out of date, but a couple months ago, actually on the floor, we did a couple presentations of what we were seeing in some of the statistics. That on the mean, about 55% of the then reported deaths came from, we'll call them nursing homes, competent settings. Why did a state like Arizona, and remember, Maricopa County, the county I live in, is the fourth most populous county in the country, had substantially lower numbers. Other states had substantially higher numbers. Instead, the rhetorical talking points keep coming, well, the federal government should have done this or that. When are we going to do a deep dive and understand what worked, what didn't work? And one of the reasons the Reid Amendment is so important is in that investigation from the New York Attorney General, there was discussion that maybe 50% of those who perished, their statistics, their numbers, their lives were not being accounted for. So I understand the wanting to defend our sides politically, but we need to actually now step aside and actually start building the record, building an understanding, so if this ever happens again to future generations, we have accurate information. And with that, I'd like to yield to Mr. Reed to finish his comments from before.
I appreciate the gentleman yielding, and that's exactly the point. Our amendment simply requires that there be good data. And as my colleagues on the other side of the aisle said, we should make sure that the data is solid so that we make good, informed decisions. And that is what we're looking for. And as to working together to hold people accountable for this, to my colleagues from New York, both Mr. Higgins and Mr. Swazi, and as I offered to Mr. Kine from Wisconsin, we are asking the Department of Justice to look into this horrific situation that the Attorney General has called for or has uncovered and begun the process of justice for those 15,000 souls that have died. And I would ask you right now, you don't have to check with your staffers. You don't have to do a poll. You don't have to check with your political consultants and how this would put you in trouble in the Democratic Party and future political aspirations that you may have, to my colleagues, but just do the right thing. Would you join me? Would you join me in that letter that we have sent from our side to the Department of Justice of the Biden administration and join in that investigation to make sure that we get to the bottom of that call that was made by Governor Cuomo that sent those 15,000 people to their deaths in New York. I'm asking you that. I will yield you time to answer that question right now. Shouldn't it be that hard of an answer? Yes or
I
no?
will not join your letter, Mr. Reed, and I don't want you to politicize this any further. Don't push it.
I find that offensive. With that, I will claim time, Mr. Swazi. You just spat on the 15,000 people that died in New York, and it's shame on you, Mr. Higgins. I do the same to you. I'm not politicizing this. I'm not politicizing this. These people died, and you now have an attorney general that's holding for once and for all. In my time, I haven't yielded. For once and for all, the attorney general is holding the governor accountable. Someone's standing up to the governor in New York for his tactics of hiding this truth. And so I guess I saw that courage on display. And with that, and I take offense to what you're trying to say my motives are in regards to this matter. And on behalf of those 15,000 people who died in New York, Mr. Swazi, I say to you, this is not about politics. This is what's right for the deaths of those individuals. And I will continue in my quest to make sure that justice is done. And so with that, I yield back the balance of my time.
Thank the gentleman. The gentleman's time has expired. We are prepared to proceed on the amendment offered by the gentleman from New York. Members are reminded to unmute themselves for a voice vote. All those in favor of the gentleman's amendment signify by saying aye.
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 Those opposed, no.
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 In the opinion of the chair, the noes have it.
Mr. Chairman, I request a recorded vote.
Mr. Brady has requested a recorded vote. Members are reminded that your camera must be turned on in order to be recorded. Please mute yourself until the clerk calls on you and state your name when recording your vote. The clerk will call the roll.
Mr. Doggett.
No. Doggett votes no.
Mr. Doggett votes no. Mr. Thompson.
Thompson votes no.
Mr. Thompson votes no. Mr. Larson.
Larson votes no.
Mr. Larson votes no. Mr. Blumenauer.
Blumenauer votes no.
Mr. Blumenauer votes no. Mr. Kine.
Kine votes no.
Mr. Kine votes no. Mr. Pasquale.
Pasquale votes no.
Mr. Pasquale votes no. Mr. Davis. Mr. Davis. Ms. Sanchez.
Sanchez votes no.
Ms. Sanchez votes no. Mr. Higgins.
Higgins votes no.
Mr. Higgins votes no. Ms. Sewell.
Sewell votes no.
Ms. Sewell votes no. Ms. Delbene.
Delbene votes no.
Ms. Delbene votes no. Ms. Chu.
Chu votes no.
Ms. Chu votes no. Ms. Moore.
Moore votes no.
Ms. Moore votes no. Mr. Kildee.
Kildee votes no.
Mr. Kildee votes no. Mr. Boyle.
Boyle votes no.
Mr. Boyle votes no. Mr. Byer.
Byer votes no.
Mr. Byer votes no. Mr. Evans.
Evans votes no.
Mr. Evans votes no. Mr. Schneider.
Mr. Schneider votes no.
Mr. Schneider votes no. Mr. Swazi.
Swazi, no.
Mr. Swazi votes no. Mr. Panetta.
Panetta, no.
Mr. Panetta votes no. Ms. Murphy.
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez.
Gomez votes no.
Mr. Gomez votes no. Mr. Horsford.
Horsford votes no.
Mr. Horsford votes no. Ms. Plaskett. Mr. Brady.
Mr. Brady votes aye.
Mr. Brady votes aye. Mr. Nunez.
Nunes votes yes.
Mr. Nunez votes yes. Mr. Buchanan.
Buchanan votes aye.
Mr. Buchanan votes aye. Mr. Smith of Nebraska.
Smith of Nebraska votes aye.
Mr. Smith of Nebraska votes aye. Mr. Reed.
Reed votes aye.
Mr. Reed votes aye. Mr. Kelly.
Kelly votes aye.
Mr. Kelly votes aye. Mr. Smith of Missouri.
Smith of Missouri votes aye.
Mr. Smith of Missouri votes aye. Mr. Rice.
Mr. Rice votes aye.
Mr. Rice votes aye. Mr. Schweikert.
Schweikert, yes.
Mr. Schweikert votes yes. Ms. Walorski.
Walorski, yes.
Ms. Walorski votes yes. Mr. LaHood.
LaHood, yes.
Mr. LaHood votes yes. Dr. Wenstrup.
Dr. Wenstrup votes yes.
Dr. Wenstrup votes yes. Mr. Arrington.
Arrington, absolutely yes.
Mr. Arrington votes yes. Dr. Ferguson. Dr. Ferguson. Mr. Estes.
Estes votes yes.
Mr. Estes votes yes. Mr. Smucker.
Smucker, aye.
Mr. Smucker votes aye. Mr. Hearn.
Hearn, yes.
Mr. Hearn votes yes. Mrs. Miller.
Miller votes aye.
Mrs. Miller votes aye. Mr. Davis. Mr. Davis.
Davis votes no.
Mr. Davis votes no. Dr. Ferguson.
Mr. Ferguson, would you unmute, please?
Ferguson votes yes.
Mr. Ferguson votes yes. Mr. Chairman.
Chairman votes no.
Chairman votes no.
The clerk will report the tally.
Mr. Chairman, I have 24 noes, 18 yeas.
There being 24 noes and 18 ayes, the amendment is not agreed to. Are there additional amendments to the amendment in the nature of a substitute? Jason Smith? The gentleman from Missouri, Mr. Smith, is recognized to speak on his amendment. Does the gentleman from Virginia wish to be recognized?
Yes, Mr. Chairman, I wish to reserve a point of order.
The gentleman from Virginia reserves a point of order. We'll give a moment while the amendment is passed on to members. On those, I have a hearing problem. So when I look at you, it's not like I'm confounded. Yeah. So just shout it out. Okay.
Mr. Chairman.
Gentleman from Virginia is recognized.
Mr. Chairman, I made a point of order that under Clause 7,
Excuse me. Yes. Let me recognize Mr. Smith on his amendment. Mr.
Thank
Smith?
you, Mr. Chairman. Thank you, Mr. Chairman. Before this process began, Republicans have shown we want to work together, as we've had 5 bipartisan COVID bills that passed through the House of Representatives and through Congress. Over the past year, we have passed almost $4 trillion in COVID relief funds, each one by a bipartisan vote. We passed a bill containing $900 billion in response funding less than 2 months ago. Why abandon bipartisanship now? President Biden began his presidency by pledging to work with Republicans, yet here we are less than 1 month since he took office, and he's already showing us that he has no interest in Republicans' input. He's chosen to use a partisan process to jam through a $1.9 trillion progressive wish list. Democrat donors and radical activists are the ones who truly hold power in the White House, as we've seen, and they clearly have no interest in bipartisanship. As lawmakers, we know that every decision has consequences, and this decision to forego regular order and abandon the bipartisan legislative process will have direct consequences on the very frontline providers, the heroes Democrats have used to justify this bill and who they claim it helps. Because this process is being done through budget reconciliation, Democrats will not be able to exempt this additional spending from pay-go, triggering a subsequent increase in the sequestration of mandatory spending. For healthcare providers, this will result in an annual cut of up to $30 billion in Medicare payments starting next year. If Democrats insist on moving forward with this partisan process, the least we can do for our healthcare providers that are already struggling is warn them the payments cut from this bill are coming. This amendment would hold implementation of the underlying bill until the Secretary of HHS is able to formally notify healthcare providers of how much of a payment cut that they should expect as a result of this very legislation. Healthcare providers, especially those in rural areas, have faced an exceptionally challenging year. Abandoning bipartisanship will result in pay cuts for doctors and nurses, and at a minimum, Democrats should be transparent and let them know these payment cuts are coming. When they do, they will know who to blame. If the majority wanted, they could ensure transparency to the American people that the care provided to our seniors is seriously threatened by this bill's devastating cuts to Medicare. I will say it again. This bill could cut up to $30 billion, with a B, $30 billion from Medicare. Instead, the majority is using its heavy hand to block this transparency on a technicality. It's unconscionable that the majority would try to hide these cuts when we know what a terrible impact they will have on our senior citizens. We know who controls this committee. We know that you can decide whether something is germane or not. We know that this amendment is germane, but yet we are the minority and you all will speak differently and disenfranchise the transparency for all Americans to see that your piece of legislation here is going to cut up to $30 billion from Medicare. I yield back.
I thank the gentleman. Let me recognize the gentleman from Virginia.
Thank you, Mr. Chairman. I make a point of order that under Clause 7 of Rule 16, the amendment is not germane because it deals with a different subject matter and purpose and would broaden the underlying bill beyond its current scope.
The gentleman from Virginia makes a point of order that the amendment proposed in this section is not germane. Clause 7 of House Rule 16 provides that no proposition on the subject matter and purpose that would broaden the scope of the underlying bill should be admitted under the color of this amendment.
Mr. Chairman,
Yes, sir. Yes, Mr. Smith.
can I just withdraw the amendment?
Yes, you can.
Is that?
Yes.
All right.
The
I'll
gentleman
just
has withdrawn his
withdraw the
amendment. Appreciate that.
Thank you, Mr.
Are there
Chairman.
any additional amendments to the amendment in the nature of a substitute?
Mr. Chairman,
The gentleman from Kansas, Mr. Estes, is recognized. Does the gentleman from
Thank you, Mr.
Virginia-
Chairman.
Let me
I
just
have
recognize the
amendment to
gentleman
pass.
from Virginia.
Mr. Chairman, I reserve a point of order on the gentleman from Kansas' amendment.
Gentleman from Virginia has reserved a point of order. The gentleman from Kansas is recognized to speak at his amendment as soon as it is passed out.
thank you, Mr. Chairman.
Okay, good, okay. So let me now recognize the gentleman from Kansas to speak on his amendment. Mr. Estes.
Thank you, Mr. Chairman. Mr. Chairman, as we consider Subtitle E, I'm alarmed at how partisan this reconciliation process has become. Over the past year, we've seen that the most effective relief measures are those that have bipartisan support, like the Provider Relief Act. Working together over this past year, we, Republicans and Democrats, have been able to put over $4 trillion to work defeating this virus that a year ago we knew very little about. Now we're able to effectively have a vaccine that nobody thought would be possible a year ago, and it's now being put into millions and millions of Americans' arms. We all want to ensure that healthcare providers and nursing facilities have the resources they need to keep their patients safe and defeat this virus. That's why we're supporting nursing homes and strike teams in a bipartisan basis in the CARES Act. Yet now we're moving in a rushed, partisan manner using a legislative shortcut without any analysis from the CBO or the Medicare trustees. Today, I'm proposing this amendment to ensure that Subtitle E will not be implemented until trustees certify that the Medicare Hospital Insurance Trust Fund and the rural healthcare providers it supports will not be worse off as a result of this legislation. Millions of seniors are covered by the Hospital Insurance, or HI Trust Fund, which pays for critical services under the Medicare program, including inpatient hospital stays, post-acute care, and hospice. This committee has sole responsibility for the HI Trust Fund at the House of Representatives. Alarmingly, the Medicare trustees' reports from April of 2020 states that the HI Trust Fund will become insolvent in 2026, and CBO projects it will be insolvent in 2024, just 3 short years from now. We must ensure that healthcare providers and their beneficiaries can continue to be covered without accelerating the anticipated insolvency of the HI Trust Fund. To be clear, this will not withhold funds from nursing home strike forces. They are continuing to receive funding as recently as December. And right now, every dollar counts with the HI Trust Fund solvency in question. This is simply a pause to acknowledge the dire straits Medicare is in and protect the program that so many seniors rely on. My state of Kansas is full of rural hospitals that serve the critical needs of Kansans in small towns and communities that draw funding from the HI Trust Fund. They have already faced challenges during this pandemic as shutting down our country took a toll on the rural hospitals in my district in Kansas. I've personally visited some of these small hospitals, like Sedan City Hospital, which is nearly 2 hours away from a major city. Hospitals like these serve a vital role in making sure our rural communities have access to the care they need. My amendment makes sure that we don't inflict unintended consequences on our rural hospitals, some of which have incurred drastic losses due to COVID-19. This is a common sense amendment that protects the individuals living in rural parts of Kansas and throughout the country. We cannot continue to play politics with the health care of hard-working Americans. The HI Trust Fund has been in need of reform for years, and we cannot afford to jeopardize its solvency during a public health crisis. With that, I urge adoption of my amendment, and I yield back.
Thank the gentleman. Let me recognize the gentleman from Illinois, Mr. Schneider, to speak on the amendment.
Thank you, Mr. Chairman, and I want to speak in opposition to this amendment. It is critical that we get our support to our providers. The legislation we're talking about today is going to help our nursing homes. As has already been pointed out, nursing homes represent 5% of the cases, but more than a third of the deaths. We need to get this support, and with this legislation we were talking about today, gets this support immediately to the nursing homes without delay. What this amendment would do would further delay the support for nursing homes to address infection. Infection challenges within nursing homes are not new. They preceded the COVID pandemic, but with COVID, the stakes are just too high to wait. I would love to include more provider relief. I want to double down on the support for hospitals, rural hospitals, suburban hospitals, hospitals in their inner city. For us, it's Northwestern, Rush, Advocate of Aurora. I want to help the nurses and the doctors who are working tirelessly, putting their health on the line, oftentimes staying away from their families to keep their families healthy. Right? I am very proud of the funding we've gotten for PPE, and I'm proud of the support we are working here to provide for our caregivers. This can't wait. And so I oppose this amendment. I think it's critical that we continue to push forward with this legislation, getting help to our nursing homes, getting help to those who are protecting the patients, and making sure the families of the patients know that their loved ones are being cared for. With that, I yield back.
Mr. Chairman.
Let me recognize the gentleman from Virginia, Mr. Byer.
Thank you, Mr. Chairman. While this amendment would delay the effective date of the needed
Captain,
assistance based on unrelated
I want to
matters.
speak on this amendment. I'll only speak about a minute, but I want to speak on it. Will you indicate? Bye.
I concede that the thoughtful drafting does comply with the rules of the House, and I withdraw my point of order.
Mr. Doggett is Mr. Byer has withdrawn his point of order, and I believe Mr. Doggett would like to be recognized on the amendment.
Thank you, Mr. Chairman. The gentleman has raised a serious matter. It is important that we address Medicare solvency. I plan to introduce legislation this year to do just that, and I welcome him joining me in a bipartisan effort to assure that Medicare is there not only beyond 2024, but for our grandchildren as well as for any people who need it in the near term. But this amendment is not the way to do it. Let's get the relief that Americans so desperately need, particularly in our nursing homes, and then address in a thoughtful and bipartisan way, assuring that Medicare will be there without cutting benefits to those who rely on it. And I yield back.
I thank the gentleman. There being no further requests for time, the question is on the gentleman from Kansas amendment. All those in favor signify by saying aye.
Aye.
All those opposed, nay.
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 Is there a request?
Request for ayes and nays.
Mr. Brady has made a request for yeas and nays. A record vote has been requested. Members are reminded that your camera must be turned on in order to be recorded. Please mute yourself until the clerk calls on you and state your name when recording your vote. The clerk will proceed to call the roll.
Mr. Doggett.
Doggett votes no.
Mr. Doggett votes no. Mr. Thompson.
Thompson votes no.
Mr. Thompson votes no. Mr. Larson.
Larson votes no.
Mr. Larson votes no. Mr. Blumenauer.
Blumenauer votes no.
Mr. Blumenauer votes no. Mr. Kine.
Kine, no.
Mr. Kine votes no. Mr. Pascrell.
Pascal votes no.
Mr. Pascrell votes no. Mr. Davis.
Davis votes no.
Mr. Davis votes no. Ms. Sanchez.
Sanchez votes no.
Ms. Sanchez votes no. Mr. Higgins.
Higgins votes no.
Mr. Higgins votes no. Ms. Sewell.
Sewell votes no.
Ms. Sewell votes no. Ms. Dalbene.
Dalbene votes no.
Ms. Dalbene votes no. Ms. Chu.
Chu votes no.
Ms. Chu votes no. Ms. Moore.
Moore votes no.
Ms. Moore votes no. Mr. Kildee.
Kildee votes no.
Mr. Kildee votes no. Mr. Boyle.
Boyle votes no.
Mr. Boyle votes no. Mr. Byer.
Byer votes no.
Mr. Byer votes no. Mr. Evans.
Evans votes no.
Mr. Evans votes no. Mr. Schneider.
Mr. Schneider votes no.
Mr. Schneider votes no. Mr. Swazi.
Swazi, no.
Mr. Swazi votes no. Mr. Panetta.
Panetta, no.
Mr. Panetta votes no. Ms. Murphy.
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez.
Gomez votes no.
Mr. Gomez votes no. Mr. Horsford.
Horsford votes no.
Mr. Horsford votes no. Ms. Plaskett. Mr. Brady.
Mr. Brady votes aye.
Mr. Brady votes aye. Mr. Nunez.
Notice votes aye.
Mr. Nunez votes aye. Mr. Buchanan.
Buchanan votes aye.
Mr. Buchanan votes aye. Mr. Smith of Nebraska.
Smith of Nebraska votes aye.
Mr. Smith of Nebraska votes aye. Mr. Reed.
Reed, yes.
Mr. Reed votes yes. Mr. Kelly.
Kelly, yes.
Mr. Kelly votes yes. Mr. Smith of Missouri.
Smith of Missouri votes aye.
Mr. Smith of Missouri votes aye. Mr. Rice.
Rice votes aye.
Mr. Rice votes aye. Mr. Schweikert. Mr. Schweikert. Ms. Walorski.
Walorski votes yes.
Ms. Walorski votes yes. Mr. LaHood.
LaHood, yes.
Mr. LaHood votes yes. Dr. Wenstrup.
Winstrup, yes.
Dr. Winstrup votes yes. Mr. Arrington.
Arrington's a yes.
Mr. Arrington votes yes. Dr. Ferguson.
Ferguson is a yes.
Dr. Ferguson votes yes. Mr. Estes.
Estes votes yes.
Mr. Estes votes yes. Mr. Smucker.
Smucker, aye.
Mr. Smucker votes aye. Mr. Hearn.
Hearn votes yes.
Mr. Hearn votes yes. Mrs. Miller.
Miller votes aye.
Mrs. Miller votes aye. Ms. Plaskett. Mr. Schweikert. Mr. Chairman.
Chairman votes no.
Mr. Chairman votes no.
The clerk will report the tally.
Mr. Chairman, how am I recorded?
Is that Mr. Schweiker?
Mr. Schweikert, you're not recorded.
Schweikert votes yes.
Gentleman votes yes.
Mr. Schweikert votes yes.
I think we made everybody, yeah. The clerk will report the tally.
Mr. Chairman, the results are 24 noes, 18 yeas.
24 noes and 18 ayes. The amendment fails. Are there additional amendments to the amendment in the nature of a substitute? If there are no further amendments, the question is on the adoption of the amendment in the nature of a substitute as amended. All those in favor signify by saying aye.
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 Do this
Aye.
after.
Aye.
All those opposed signify by saying no.
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 And on that, Mr. Chairman, I request recorded vote.
In the opinion of the chair, the ayes have it. The amendment in the nature of a substitute is agreed to. I'll recognize Mr. Byer, and then I will recognize Mr. Brady.
Mr. Chairman, I move that the committee do now favorably transmit to the House Committee on the Budget, Subtitle E, Budget Reconciliation and Legislative Recommendations related to support to skilled nursing facilities in response to as amended.
The question is on transmitting Subtitle E as amended to the House Committee on the Budget. Members are reminded to unmute themselves for a voice vote. All those in favor again signify by saying aye.
Aye.
Aye. Signify by saying no.
No.
In the opinion of the chair, the ayes have it. The motion is agreed to, and Subtitle E as amended is ordered transmitted to the House Committee on the Budget.
Thank you, Mr. Chairman. I
Mr.
request
Brady.
recorded vote.
Mr. Brady has requested a recorded vote. The clerk will call the roll. Members are reminded that their cameras must be on. Please mute yourself until the clerk calls your name.
Mr. Doggett.
Doggett votes aye.
Mr. Doggett votes aye. Mr. Thompson.
Thompson votes aye.
Mr. Thompson votes aye. Mr. Larson.
Larson votes yes.
Mr. Larson votes yes. Mr. Blumenauer.
Blumenauer votes aye.
Mr. Blumenauer votes aye. Mr. Kind.
Kind, yes.
Mr. Kind votes yes. Mr. Pasquale.
Pascal votes yes.
Mr. Pasquale votes yes. Mr. Davis.
Davis votes yes.
Mr. Davis votes yes. Ms. Sanchez.
Sanchez votes yes.
Ms. Sanchez votes yes. Mr. Higgins.
Higgins, yes.
Mr. Higgins votes yes. Ms. Sewell.
Sewell votes yes.
Ms. Sewell votes yes. Ms. Dalbene.
Dalbene votes yes.
Ms. Dalbene votes yes. Ms. Chu.
Chu votes aye.
Ms. Chu votes aye. Ms. Moore.
Moore votes aye.
Ms. Moore votes aye. Mr. Kildee.
Kildee votes aye.
Mr. Kildee votes aye. Mr. Boyle.
Boyle votes aye.
Mr. Boyle votes aye. Mr. Byer.
Byer votes aye.
Mr. Byer votes aye. Mr. Evans.
Evans votes aye.
Mr. Evans votes aye. Mr. Schneider.
Mr. Schneider votes aye.
Mr. Schneider votes aye. Mr. Swazi. Mr. Swazi. Mr. Panetta. Mr. Panetta. Ms. Murphy.
Murphy votes aye.
Ms. Murphy votes aye. Mr. Gomez.
Gomez votes aye.
Mr. Gomez votes aye. Mr. Horsford.
Horsford votes aye.
Mr. Horsford votes aye. Ms. Plaskett. Mr. Brady.
Mr. Brady votes no.
Mr. Brady votes no. Mr. Nunez.
Nunes votes no.
Mr. Nunez votes no. Mr. Buchanan.
Buchanan votes no.
Sorry, hold on a second.
Mr. Buchanan votes no. Mr. Smith of Nebraska.
Smith of Nebraska votes no.
Mr. Smith of Nebraska votes no. Mr. Reed.
Reed, no.
Mr. Reed votes no. Mr. Kelly.
Kelly votes no.
Mr. Kelly votes no. Mr. Smith of Missouri.
Smith of Missouri votes no.
Mr. Smith of Missouri votes no. Mr. Rice.
Rice votes no.
Mr. Rice votes no. Mr. Schweikert.
Schweikert, no.
Mr. Schweikert votes no. Ms. Walorski.
Walorski votes no.
Ms. Walorski votes no. Mr. LaHood.
LaHood, no.
Mr. LaHood votes no. Dr. Wenstrup.
Wenstrup votes no.
Dr. Wenstrup votes no. Mr. Arrington.
Arrington's a no.
Mr. Arrington votes no. Dr. Ferguson.
Ferguson is a no.
Dr. Ferguson votes no. Mr. Estes.
Estes votes no.
Mr. Estes votes no. Mr. Smucker.
Smucker, no.
Mr. Smucker votes no. Mr. Hearn.
Hearn votes no.
Mr. Hearn votes no. Mrs. Miller.
Miller votes no.
Mrs. Miller votes no. Mr. Swazi.
Above and beyond what's being allocated for the rest of our county that allows us to reach even more.
Mr. Swazi. Mr. Panetta.
Yes.
Mr. Panetta votes yes. Ms. Plaskett. Mr. Chairman.
Chairman votes yes.
Mr. Chairman votes yes.
How is Mr. Swazi recorded?
Swazi, yes.
Mr. Swazi is now recorded as yes.
Mr. Swazi votes yes.
The clerk will report the tally.
Mr. Chairman, I have 24 yeas, 18 noes.
The vote being 24 ayes, 18 noes. The motion is agreed to. Subtitle E as amended is ordered transmitted to the House Committee on the Budget. Without objection, staff are authorized to make technical and conforming changes to the committee print, and members have 2 additional days to file with the committee clerk supplemental, additional, dissenting, or minority views. Our next order of business is Subtitle F, Budget Reconciliation and Legislative Recommendations relating to the continuation of job-based coverage. I now recognize the gentlelady from California, Ms. Sanchez, for an opening statement.
Thank you, Mr. Chairman. I'm very pleased to see this package include help for those who are unemployed to regain their job-based insurance. This is a solid bill that came from ongoing work I was proud to be a part of last year. We know that no worker wants to find themselves on COBRA, but it serves an important purpose. It's a matter of life and death for individuals and families to keep their health insurance during a pandemic. Specifically, this bill would provide an 85% tax credit for those who have lost employment but could continue their previous health care coverage through COBRA. It would also subsidize COBRA coverage through September of this year for any individual who is currently COBRA eligible. Millions of Americans have lost their job-based health coverage during the pandemic. Supporting this bill would allow workers to keep their current doctors. We are essentially helping individuals avoid disruption in their health care during a public health crisis. We are helping individuals remain with doctors and healthcare systems that they already are familiar with how to navigate. We are helping people stay with the doctors that they know and that they trust. Preserving all of this is particularly important for people who will need treatment for COVID-19 or who will need continued care for their chronic conditions. Likewise, for many workers, continuing existing coverage means not facing new deductibles. This bill helps to reduce yet another hardship on those who have just had the rug pulled out from under them. Almost 30 million adults reported in late December that their households sometimes or often didn't get enough to eat. Nearly 14 million renters reported that they were behind on rent, 1/3 of whom said they expected to be evicted in the next 2 months. I cannot continue to emphasize enough why we must provide support for health insurance coverage. Mr. Chairman, at this time, I would ask unanimous consent to insert a statement for the record from 30 organizations that represent millions of patients and consumers from across the country.
Without objection.
Mr. Chairman. Thank you. These 30 organizations are in support of the very work we are doing to help people maintain their health coverage. They also know that Americans are dealing with so much. Our country is resilient, but we need basic necessities like health care in order to endure this public health and economic crisis and come out the other side. I urge my colleagues to support this initiative. Families deserve every bit of peace of mind that we can give them during this heartbreaking, damaging, and dangerous time. The least that we can do for our constituents across the country is to help them maintain their health insurance during a time of income instability. With that, I thank the chairman and I yield back.
Thank you, Ms. Sanchez. I now recognize the gentleman from California, Mr. Nunez, for purposes of an opening statement.
Thank you, Mr. Chair. As I've reiterated before, I'll do it again. I don't think we should be spending taxpayer dollars on COBRA. We should focus on getting folks back to work. We should work on a shared goal on a bipartisan basis rather than continue to pursue legislative shortcuts through this budget process. I'd like to yield the remainder of my time to Mr. Smith of Missouri.
I want to thank the gentleman from California for yielding. Mr. Chairman, whether it's in the Budget Committee where I have the honor of serving as a Republican leader or here on the Ways and Means Committee, we have to follow the data and the evidence when we are making public policy decisions. Our Democrat colleagues are not doing that with this piece of legislation. Just as they have ignored the scientists when it comes to reopening our schools, they are ignoring the facts when asking working class Americans to foot the bill for an additional $2 trillion in bailout spending. The Congressional Budget Office just earlier this month confirmed that the U.S. economy will continue to grow and prosper even without further stimulus. According to CBO, economic growth will be the strongest it has been in over 15 years, and unemployment is expected to continue to decline, reaching 5.3% this year and 4.0% by 2025, far below the average of the last 20 years. Even President Obama's former economic advisor, Larry Summers, has expressed concern, saying that, quote, the stimulus proposed in the Biden plan is at least 3 times the size of the output shortfall, close quote. This suggests that another $2 trillion is not what our economy needs. It is certainly not a bill that American taxpayers need. Just like they've ignored the science when it comes to our kids in schools, they are ignoring the facts when it comes to our economy. Also, so much of the spending in the Biden bailout plan has nothing to do with responding to the pandemic. Of the $1.9 trillion, less than 9% Less than 9% actually goes to combating the virus through public health spendings, such as a national vaccination program, tracking, and more testing. Much of this bill consists of rewards to the Democrat majority's political allies and their donors. These policies are not about combating the pandemic, but about bailing out their friends. Finally, and what I think is most disturbing about the entire process, is that this bailout, which Democrats claim will help Americans, does the exact opposite by setting up the process to put at serious risk fundamental programs on which our seniors rely, including Medicare. Due to a 2010 law passed by the Democrats, this bill will undoubtedly trigger massive cuts to the Medicare programs beginning in January 2022. Let me repeat that this will cause severe cuts to Medicare, up to $30 billion by the actions of passing this legislation. I truly hope my colleagues on the other side of the aisle have a plan to ensure these Medicare cuts do not go into effect. So far, I've heard crickets. The hypocrisy is real. I hope America's seniors are listening. I hope America's working class is listening. With that, I yield the balance of my time.
Mr. Nunez still continues to manage the time. Mr. Nunez wish to yield back? Okay, great. The committee will now proceed to consideration of Subtitle F. Without objection, the measure will be considered as read and open for amendment at any point. And at this time, on behalf of the chairman, I offer an amendment in the nature of a substitute, which was distributed in advance, along with a green sheet explaining it. Without objection, the amendment in the nature of a substitute shall be considered as read, open for amendment at any point, and considered base text for purposes of amendment. We now turn to Tom Barthold, Chief of Staff from the Joint Committee on Tax, to provide a technical description of the amendment in the nature of a substitute with an emphasis on the changes made since introduction. I ask the members hold their questions until after his presentation.
Thank you, Mr. Chairman and members of the committee. The members of the committee have available two joint committee documents, JCX2 and JCX6, which describe the underlying provisions and the chairman's amendment in the nature of a substitute. Also have available JCX9, which provides the staff's estimated budgetary effects of the provision. The chairman's amendment in the nature of a substitute makes generally clerical changes. Let me take just a brief moment to summarize what the provision at hand is. Under present law, the COBRA rules require other than small employers to make available continued health care coverage in the event of termination of job, loss of hours, certain other qualifying events. What the proposal before the committee today does is it models after a provision that was enacted as part of the American Recovery and Reinvestment Act over a decade ago, and it would provide that from the date of enactment of this proposed law through September 30th of this year, that the premium assistance of 85% of the amount of the COBRA premium would be made available for qualifying individuals. This assistance would be excluded from gross income of the individual. The proposal also extends the benefit of this 85% premium assistance to state governments. The credit at the employer side is provided against the HI portion of the payroll tax. That concludes my brief description of the provision. Be happy to answer any questions that the members might have.
Thank you, Mr. Barthold. Are there any questions about the amendment in the nature of the substitute for Mr. Barthold? Okay. Yeah. If there are no questions, we now recognize members for each side to strike the last word. Now I recognize the gentleman from New Jersey, Mr. Pascrell, to strike the last word.
Thank you, Mr. Chairman.
Mr. Pascrell
I
has the
want
floor.
to strike, if I may,
want to strike the last word, Mr. Chairman.
The gentleman is recognized.
Since its passage over a decade ago, Republican leaders have treated destruction of the Affordable Care Act like Captain Ahab chased the white whale. Today, like yesterday and tomorrow, we will not entertain any GOP efforts to steal Americans' health care during a pandemic. During the first 6 months of the pandemic, almost 3 million lost employment-based health insurance. Millions more remain uninsured. This matters because there is a direct link between health insurance coverage and COVID-19 deaths. According to a recent Oxford academic study, COVID-19 cases rise 70%, deaths increase 48% for each additional 10% of county residents who are not insured. The bill before us today takes steps to further protect the Affordable Care Act from sabotage. It makes the subsidies more generous, it fills gaps in coverage, and enhances coverage for Americans who need it most right now. I decry the continued attempts to gut the Affordable Care Act. What is wrong about helping people stay alive? Haven't we learned that particularly over the last year, Mr. Chairman? And I yield back.
Thank you, Mr. Pascrell. Chair now recognizes the gentleman from Kansas, Mr. Estes, to strike the last word.
Thank you, Mr. Chairman. I move to strike last word.
The gentleman is recognized.
Thank you. In the early days of the pandemic, I remember my colleagues on both sides of the aisle discussing ways to provide timely, targeted, and temporary relief to Americans and to focus our efforts on testing and vaccine development. But as the days and months have passed, I've been disheartened by the attempts of many of my Democrat colleagues to use the pandemic as a means to inflict long-lasting policy changes to our nation, even when they don't help defeat the virus or reopen the economy. Today, we're looking at another one of those attempts to grow the federal government in the name of coronavirus relief. The COBRA subsidies in this legislation are a further expansion of government-run health care, and they don't encourage Americans to return to work safely. Instead, the data tells us that going this route is unproductive. A study from the Galen Institute notes that the temporary subsidies of COBRA coverage in 2009 appears to have had little effect on health insurance coverage among unemployment recipients. Furthermore, they highlighted last year during the height of unemployment that just 2% of unemployed workers who had employee-based health coverage became uninsured. So while my friends on the other side of the aisle may try to claim this is a victory for unemployed Americans, common sense tells us that this is a wasteful spending on a fabricated issue that impacts a very small number of Americans and doesn't move our country forward. Simply put, this is a costly, ineffective, and unnecessary mechanism that doesn't provide the targeted and temporary relief needed at this time. Instead, we should focus on effective ways to reopen our country and return to normalcy, something my constituents repeatedly expressed to me. I don't want to implement policies that hold back workers and families. I want to pursue policies that crush the virus and get people back to work. The best way to make sure that Kansans in my home state have access to health care is to get back to the booming economy we had before the pandemic. Pro-growth policies will do just that. But spending more money on COBRA subsidies and discouraging employment won't move us towards a fully opening economy. With that, I yield back.
Thank you. The chair recognizes the gentleman from Nevada, Mr. Horsford.
Thank you, Mr. Speaker. I move to strike the last word.
The gentleman is recognized.
Continuation of coverage through COBRA is essential to help workers maintain their job-based health insurance in response to an unprecedented wave of layoffs and furloughs as a result of COVID-19. The first time Congress provided a subsidy for unemployed workers for COBRA was in the American Recovery and Reinvestment Act in 2009. And that subsidy was only 65%. And while this measure includes an 85% subsidy and it's an improvement, I support helping people keep their coverage, I do worry about how many workers for whom the 15% might be too much. So, Mr. Chairman, I do want to work to see if at the end of this process we can provide a subsidy of 100%, like what was proposed in the HEROES bill, which included my measure, the Worker Health Coverage Protection Act. Last September, my constituent, Mario Sandoval, who is a food server at Binion Steakhouse in downtown Las Vegas, testified before the Select Revenue Measures Subcommittee hearing about the uncertainties that he faced as a restaurant worker. One thing that Mario reinforced was the need to have 100% of COBRA costs covered for laid off or furloughed workers. Like Mario and so many other Nevadans and people across the country with union negotiated health care plans, we must make sure that they are whole by having full COBRA coverage during this health pandemic. So I look forward to building on these efforts. I believe it is our job to help workers maintain their existing coverage. These are plans that they have worked to secure over years. They should not be forced to leave their provider networks, restart annual deductibles, or face a potential coverage gap. I'd also like to enter into the record a letter by the director for the AFL-CIO regarding the COBRA measure that we're considering today, Mr. Chairman, without objection.
It will be entered in the record without objection.
Thank you. And also, just in closing, Mr. Chairman, and a couple of my colleagues have indicated this measure was something that the Republicans on the other side supported in the last Congress. In fact, the U.S. Chamber of Commerce and a number of business groups support this as well because it's about stabilizing our health insurance marketplace and ensuring that, again, in the middle of a health crisis, a pandemic, that we're not forcing people to lose their health insurance. And so, again, the American Rescue Plan is about helping to crush the virus. My colleague from Missouri has talked about the need to do that. My colleague from Kansas has also talked about the need to help our economy. Well, the way we do that is crushing the virus, and you cannot have people losing their health insurance at a time that they need to have access to it. And finally, let me say that in addition to the issues around COVID-19, there are people with underlying health issues: cancer, heart disease, diabetes. They have to continue to receive care for those health conditions. So in addition to crushing the virus, we need to make sure that people can continue to receive the care that they have with the doctor and under the insurance plan that they have. So I would urge my colleagues to support this underlying subtitle measure and support the American Rescue Plan. Thank you, and I yield back.
Thank you, Mr. Horsford. Is there any other member who wishes to strike the last word? If not, we will move to amendments to the amendment in the nature of a substitute.
Mr. Chairman, I have an amendment at the desk.
The gentlelady from Indiana is recognized. And let me first recognize the gentleman from Pennsylvania, Mr. Evans.
Mr. Chairman, reserve a point of order.
The gentleman reserves a point of order. We'll pause for a moment while the amendments are passed out. Thanks. The chair recognizes the gentlelady from Indiana for purposes of offering her amendment.
Thank you, Mr. Chairman. I believe every human life is precious and absolutely should not be taxpayers should not be forced to pay for the destruction of life. That's why House Republicans have been united in our efforts to protect the unborn and prevent taxpayer funding for abortion. A majority of Americans, nearly 60%, agree that tax dollars should not be used to fund elective abortions. The Hyde Amendment has been in place for nearly half a century with bipartisan agreement, saving the lives of more than 2 million innocent babies and protecting Americans' conscious rights. My amendment will preserve this important pro-life safeguard by adding long-standing Hyde protections to this subtitle. This will make clear that a taxpayer-subsidized COBRA plan won't be used to pay for elective abortions. It would also give issuers the chance to instead provide COBRA-eligible plan options that comply with the Hyde Amendment. We should acknowledge the reality that there is a broad consensus that taxpayer dollars should not fund abortion. I urge my colleagues to join me in protecting innocent life by supporting my amendment. With that, Mr. Chairman, I yield back the balance of my time.
Thank you, Ms. Milorski. Does the gentleman from Pennsylvania wish to continue to reserve his point of order?
No, Mr. Chairman.
Point of order has been withdrawn. The chair recognizes the gentlelady from California, Ms. Chu.
Okay. Mr. Chair, I move to strike the last word.
Gentlelady is recognized.
I strongly oppose any effort to utilize a pandemic relief bill to further an anti-choice agenda that would add abortion restrictions to COBRA coverage. It would go beyond what is current law. This would dramatically expand abortion restrictions to private insurance coverage, which the federal government has never done. Rather than enhancing this proposal, this amendment will result in fewer Americans being able to access health insurance. A restriction like this would make it more difficult and in some states impossible to administer. In practice, this amendment would deny millions of former and furloughed employees access to the federal subsidies to purchase COBRA coverage because their former employer-sponsored plans include abortion coverage. COBRA is supposed to provide employees access to the same exact employer-sponsored plan as when they were employed. Abortion is healthcare, and excluding abortion from COBRA coverage makes as little sense as excluding cancer coverage. And additional administrative burdens of implementing this policy would further delay when a laid off or furloughed employee could use the subsidies to purchase the COBRA coverage. We are in the middle of a raging pandemic for a disease that is infectious and could result in hospitalization. This amendment is so harmful because it would push insurance coverage further away from millions of unemployed workers looking to protect themselves and their families in order to further a radical anti-choice agenda. What's even more, even the Trump administration delayed its attempt to restrict abortion coverage in private plans because, as the administration note, and listen to this quote, they, quote, believe it is imprudent to require health plans to devote resources to timely compliance with a separate billing policy when these resources can instead be directed towards addressing the immediate needs associated with COVID-19 public health emergency, unquote. And just this month, a district court blocked the Trump administration's final rule, recognizing that the rule is at odds with the ACA's purpose to increase the number of Americans covered by health insurance and decrease the cost of healthcare, and that it would create an unreasonable barrier for patients seeking care. So let me say again, even the Trump administration believed that enforcing abortion restrictions in private plans during a pandemic was bad policy. Well, you know what? I believe we should trust women. Any attempt to create new restrictions on abortion coverage distracts from what people need right now, which is fair wages, paid sick leave to care for themselves and our loved ones, and a health system that works for everybody. If my Republican colleagues would like to join me in ensuring that women have the ability to decide when they are ready to be a parent, I would welcome their support in our efforts to expand access to comprehensive contraceptive coverage and sexual and reproductive health education for everyone. Those are the proven ways to empower women and to ensure that they are making the choices that are best for them, their families, and their futures. I encourage my colleagues to reject this amendment and respect choices of women across the country. I yield back.
Thank you, Ms. Chu. The chair recognizes the ranking member of the Ways and Means Committee, the gentleman from Texas, Mr. Brady.
Thank you, sir. I am strongly pro-life, and I support Ms. Walorski's amendment. You know, for more than half a century, while abortion has been controversial, we as a country have found common ground. That common ground was that if a baby can live outside the womb, it was no longer a choice, that it was the right of that unborn baby to live. And we also agreed now for the past half a century that given how controversial it is, your federal tax dollars would not be used to fund abortions. This Hyde language, these pro-life provisions, have survived in a bipartisan way since 1976, 50 years. Congress has included these protections when we spend federal tax dollars. No president in American history has ever vetoed an appropriations bill due to its inclusion of the Hyde Amendment. Moreover, President Obama maintained the Hyde Amendment in each of his budget proposals. As recent as June of 2019, former Vice President Joe Biden supported the Hyde Amendment and acknowledged, despite what you just heard, our president today acknowledged it works harmoniously with federal funding for women's health care. Let me say it again, Joe Biden supported the Hyde Amendment just a year and a half ago, acknowledged it works harmoniously with federal funding for women's health care. Years of public polling indicate that repealing the Hyde Amendment or keeping it off is opposed by most of the American public. The Hyde Amendment, I should tell you, has saved the lives of over 2 million innocent unborn and continues to protect the conscience rights of a vast majority of Americans who are opposed to publicly funded abortion. In COBRA provisions, Hyde dollars haven't been included because of the business and the individual spending. But now, where this partisan, divided package seeks to block to use federal funding for this, it is both consensus, it is tradition, and is the right thing to include these consensus Hyde provisions in this markup. With that, I yield back.
Thank you, Mr. Brady. The chair recognizes the gentlelady from Washington State, Ms. Del Bene.
Thank you, Mr. Chairman. Attaching any abortion-related restrictions on private insurance has never been done before and would subvert the very purpose of COBRA, which is to keep the insurance you have. Millions of struggling employees would be denied access to their health insurance during a public health emergency. And in my state, every health insurance plan is required to fully cover women's reproductive health, including abortion. So this ideological amendment would prevent anyone from my state and several other states from accessing COBRA during a time when unemployment and the demand for COBRA remain high. It's foolish to take away someone's health insurance when they could possibly be hospitalized for weeks if they are unfortunate enough to have a severe COVID case. Any ideological changes to COBRA could delay implementation of this critical provision, and I urge my colleagues to defeat this amendment, and I yield back.
Thank you, Ms. Del Bene. The chair now recognizes the gentleman from Ohio, Dr. Wenstrup.
Well, thank you, Mr. Chairman. Mr. Chairman, I'm pro-life as well. I have a adopted daughter, and her birth mother chose life, and we love her birth mother as well. The Hyde Amendment represents a long-standing bipartisan consensus that taxpayer funds should not support abortions. Every member of this committee has voted for appropriation legislation that contains the Hyde Amendment. As my colleague, Ms. Walorski, noted, a majority of Americans agree that taxpayer funds should not fund elective abortions. When insurance is paid for in part by federal dollars, then that is using taxpayer funds. This amendment would simply ensure that these common sense, life-affirming protections are included with respect to this bill's subsidies for COBRA continuation coverage. Something you've all voted for. We should come together, support this amendment, continue the bipartisan tradition of protecting both the lives of the unborn children and the conscience of Americans who do not wish to fund abortion coverage with their taxpayer dollars. I urge the adoption of my colleague's amendment, and I yield back.
Thank you, Dr. Wenstrup. The chair recognizes the gentlelady from Wisconsin, Ms. Moore.
Move to strike the last word, sir, Mr. Chairman.
The gentlelady is recognized.
Thank you so much. In the interest of time, I want to associate myself with the comments of Representative Sanchez and Ms. Chu and Ms. Delbaney with regards to the benefit of this provision. I mean, they named COBRA after a snake for a reason. It just will choke out all of your other financial ability to take care of your life. So we should put poison pills in to hinder this provision. I just want to say to Ms. Walorski and to the ranking member that I have great, profound respect for people's religious beliefs, profound respect for ideology. But I just want to remind us that we bring different beliefs to the table, and we all took an oath to the Constitution of the United States of America. And the last thing that we want to do under that oath is to impose federal restrictions on people's ability to get health care, to force private employers to deny health care to people. That, the notion, and it's not in the Constitution, that there ought to be a separation of church and state, was, our basic principle is that we shouldn't have the federal government imposing stuff on us. And this would be that kind of imposition. There are plenty of chances to join, left-wing folk like me, liberals like me, on preserving the life of children. I'm the co-author now of parts of the Momnibus. It's a bill that would provide more health care workers for perinatal health care. Again, African-American, brown children, they are dying 3 to 5 times these mothers in childbirth. We have childbirth outcomes that resemble that of so-called third world countries among people of color because of lack of health care. So don't make us get on the floor and beg for WIC and beg for food stamps and beg like we have to do all the time. If you want to help, care something about the children after they're born. Not, Johnny, we care about you as long as you're in the womb. But as the minute we cut that umbilical cord, you're on your own. And with that, I would yield back.
I thank the gentlelady. There being no further requests, I believe, for time on this. The question is on agreeing to the amendment offered by the gentlelady, Ms. Walorski from Indiana. Members are reminded to unmute themselves for this voice vote. All those in favor signify by saying aye.
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 Aye. All those opposed, no.
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 And on that, Mr.
In
Chairman,
the opinion
I
of the
ask for a
chair,
recorded vote.
the noes have it. A record vote, Mr. Brady?
Yes, sir.
Mr. Brady has requested a record vote. Members are reminded that your camera must be turned on in order to be recorded. Please mute yourself until the clerk calls on you and state your name when recording your vote. The clerk will call the roll.
Mr. Doggett. Mr. Doggett. Mr. Thompson.
Thompson votes no.
Mr. Thompson votes no. Mr. Larson.
Larson votes no.
Mr. Larson votes no. Mr. Blumenauer.
Blumenauer votes no.
Mr. Blumenauer votes no. Mr. Kine.
Kine, no.
Mr. Kine votes no. Mr. Pascal.
No.
Mr. Pascal votes no.
No.
Mr. Davis.
Davis votes no.
Mr. Davis votes no. Sanchez.
Sanchez votes no.
Ms. Sanchez votes no. Mr. Higgins.
Higgins, no.
Mr. Higgins votes no. Ms. Sewell.
Ms. Sewell votes no.
Ms. Sewell votes no. Ms. Dalbene.
Dalbene votes no.
Ms. Dalbene votes no. Ms. Chu.
Chu votes no.
Ms. Chu votes no. Ms. Moore.
No.
Ms. Moore votes no. Mr. Kilby.
Kildee votes no.
Mr. Kilby votes no. Mr. Boyle.
Boyle votes no.
Mr. Boyle votes no. Mr. Byer.
Byer votes no.
Mr. Byer votes no. Mr. Evans.
Evans votes no.
Mr. Evans votes no. Mr. Schneider.
Mr. Schneider votes no.
Mr. Schneider votes no. Mr. Swazi.
Swazi, no.
Mr. Swazi votes no. Mr. Panetta.
Panetta, no.
Mr. Panetta votes no. Ms. Murphy.
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez.
Gomez, no.
Mr. Gomez votes no. Mr. Horsford.
Horsford votes no.
Mr. Horsford votes no. Ms. Plaskett. Mr. Brady.
Mr. Brady votes aye.
Mr. Brady votes aye. Mr. Nunez.
Nunes votes aye.
Mr. Nunez votes aye. Mr. Buchanan.
Buchanan votes aye.
Mr. Buchanan votes aye. Mr. Smith of Nebraska.
Smith of Nebraska votes aye.
Mr. Smith of Nebraska votes aye. Mr. Reed.
Reed is aye.
Mr. Reed votes aye. Mr. Kelly.
Kelly is aye.
Mr. Kelly votes aye. Mr. Smith of Missouri.
Smith of Missouri votes aye.
Mr. Smith of Missouri votes aye. Mr. Rice.
Aye. Mr. Rice votes aye.
Mr. Rice votes aye. Mr. Schweikert.
Schweikert, yes.
Mr. Schweikert votes yes. Ms. Walorski.
Walorski votes yes.
Ms. Walorski votes yes. Mr. LaHood.
LaHood, yes.
Mr. LaHood votes yes. Dr. Wenstrup.
Wenstrup, yes.
Dr. Wenstrup votes yes. Mr. Arrington.
Arrington's a yes.
Mr. Arrington votes yes. Dr. Ferguson.
Ferguson is a yes.
Dr. Ferguson votes yes. Mr. Estes.
Estes votes yes.
Mr. Estes votes yes. Mr. Smucker.
Smucker, aye.
Mr. Smucker votes aye. Mr. Hearn.
Hearn votes yes.
Mr. Hearn votes yes. Mrs. Miller.
Miller votes aye.
Mrs. Miller votes aye. Mr. Doggett.
I vote no.
Mr. Doggett votes no. Mr. Plaskett. Mr. Chairman.
Chairman votes no.
Chairman votes no.
Is the clerk prepared to report the tally?
Mr. Chairman, I have 24 noes, 18 yeas.
There being 24 noes and 18 ayes, the amendment fails. Are there additional amendments to the amendment in the nature of a substitute?
Mr. Chairman, Jody Arrington here. I have an amendment at the desk.
Mr. Arrington, you'll be recognized in one moment. Mr. Byer?
Mr. Chairman, I reserve a point of order on Mr. Arrington's amendment.
Gentleman from Virginia reserves a point of order. And Mr. Arrington, we'll just give the staff time to get the amendment out, and we will let you proceed with the amendment. The gentleman from Texas, Mr. Arrington, is recognized to speak in support of his amendment.
Thank you, Mr. Chairman. Let me commend my colleague, Ms. Leworski, for her compassionate and common sense amendment to simply defend the God-given, constitutionally protected right of all Americans, born or unborn. And I think about the various common sense and basic suggestions in the form of amendments to improve this legislation that we didn't have much time to review, and we've had zero input considered legitimately. Look, I get it. This has happened on both sides, so I will refrain from a process lecture. But, you know, I know the nature of my colleagues, for the most part, are at I think at their core, want to work together to make this country better, move us forward, solve problems. But that's just not the case today. So let's just get it out there. Again, this is a futile exercise. This is perfunctory. It's fixed. And it's baked in. But you can prove me wrong, colleagues. You can prove me wrong by considering this amendment. I'm trying to call good, bad, and ugly here because that's my job. Whether you include me or not, that's my job for the American people, for the people of West Texas, to call out the bad policies, the barriers to recovery, but also recognize where there's a good faith attempt to do some good things. I think actually, and apart from some of my colleagues' sort of philosophical view of this, but I think that there's some benefit to this, providing this assistance through COBRA for those who are in a bad way and who need this. And we know the expense is tremendous in terms of health care. And so I think it's wise, and I tip my hand to my colleagues, to recognize that private insurance and employer-based insurance is important for Americans to choose what's best for their families, and providing that continuity and having an 85-15 sort of shared risk and responsibility is actually, I think, good policies. I mean, we don't want to drive people to a healthcare plan that was designed under the guise of affordable care, that doubled the cost of healthcare and had people, literally millions, paying the fine to get out from under this government designed and controlled healthcare plan. They said you can keep doctors, plans, and all that. So I think this is a recognition, at least in my humble opinion, that the private health insurance is superior in the sense that it offers the greatest choice and opportunity for our families. On January 20th, something happened similar to what's happening with this COVID stuff. There were people that were completely caught unaware, by no fault of their own. Their lives were upended. On January 20th, the first action taken by President Joe Biden, the great unifier, the one who's going to usher in the era of bipartisanship, with the stroke of a pen, Mr. Chairman, and my colleagues, with the stroke of a pen, he ruined the lives of thousands. Okay, I think millions long term. If you had climate, Paris Climate Accord and no development on public lands, but I'm going to focus on the XL pipeline. These working people, these God-fearing, patriotic working people, they went to bed the night before after a long, hard day's work, playing by the rules, providing for their families. They woke up the next day to a unilateral action by this president. You're fired. Now, forget the fact that his climate czar, John Kerry, who may be a good man, I don't know him, but his response to that was, don't worry, we'll have you making solar panels in no time. They're still waiting on that, by the way, and I know that some of my colleagues believe that government creates jobs. We don't create jobs. It's the most inefficient way to deploy capital, but nonetheless, I think, Mr. Chairman, we ought to extend the same COBRA supplement, the same assistance for these folks whose jobs were taken from them, whose livelihoods were crushed along with their hopes and dreams. Who knows the disaster and the devastation and the emotions that are being experienced by these good, hardworking Americans. So I think we should include these folks in this. And I think it's the right thing to do. I heard my colleague talk about stealing health insurance from Americans. I'm going to ask him respectfully and challenge him and my colleagues, do you want to steal health insurance from these folks? Because they didn't do anything wrong. They didn't do anything wrong. Let me read this to you, Mr. Chairman. I hope I have time. Am I hearing the tap of my time's out?
It is.
Okay, maybe I'll get an opportunity to say a few more things. But with that, I yield back and I appreciate the opportunity.
Thank the gentleman. Let me recognize the gentleman from Oregon, Mr. Blumenauer, to speak on the amendment. I believe Mr. Schneider might be prepared as we await Mr. Blumenauer getting in. Mr. Schneider, you recognized to speak on the amendment.
Thank you, Mr. Chairman, and I wish to speak against this amendment. I speak from experience, understanding how important COBRA is. It is critical when someone is in a situation of job loss, job transition, to be able to have that insurance. I keep on my bookshelf a copy of the Sears catalog. This is the final Sears catalog. I worked there in 1993, and they shut down the catalog 6 weeks before my son was born. I was so grateful to have that COBRA insurance to get through. And we're at a point in this pandemic that is a health and economic crisis that has put so many people into a similar situation I was 28 years ago, of not knowing where my next job would be, but having the ability to continue the health insurance so important to my family. What possible reason could we possibly think of to limit access to that insurance to just a small subset of people? This is critical that we provide this extension of COBRA, access to COBRA, to people during this health crisis, economic crisis. And that's one reason that I oppose this amendment. I also want to touch on the idea of protecting our environment and addressing climate change. There is no question climate change is an existential crisis to our way of life, to our planet. And that's why it's so important. And I support President Biden deciding to bring the United States back into the Paris Accord, working with every nation in this country, every nation in the world. Furthermore, the idea of providing our children a legacy, a natural legacy, protecting not just the climate, but our environment. I support the decision to protect the African Nature Wildlife Reserve. We should all support that decision because this is the legacy we're leaving our children. So I'm going to support anything that will help address the challenge we face with climate change, that will protect our environmental legacy, while at the same time protecting people's health care. That's why I oppose this amendment and will continue to work to get health care to all Americans. With that, I yield back.
Thank the gentleman. With that, let me recognize the gentleman from Nebraska, Mr. Smith, to speak on the amendment.
Thank you, Mr. Chairman and colleagues. I find this topic to be rather interesting because when we look at restrictions and requirements and just various burdens to health care, it's the federal restrictions that have driven up the cost of premiums, taken away choices from the American people, and has forced us into a COBRA situation that I think is not, certainly not what it would be like if consumers had more choices, more affordable choices, and we could avoid even needing to address things like this. But I think we've got a lot of work to do in that arena, and I would yield the balance of my time to Mr. Arrington.
Mr. Arrington.
I thank my colleague for yielding. Mr. Chairman, Gaylord Lincoln, he represents working people in the oil patch in rural America, like the folks that have given me their voice to represent them in Washington. And I think he captures the sentiment of many, if not all, of these folks. He was a mechanic in South Dakota, working on the pipeline. He said, "Come down here, see the destruction you caused, see the pain of job loss. You took our chance to have a decent life with a stroke of a pen. It's all BS in Washington. They are playing with their lives. That's exactly what's happened. This guy gets it. I mean, this is just placating the left, the environmental extremists, the climate religious zealots. This is not balanced. We flew on airplanes to get to Washington. We wear clothes that are based on petrochemicals, just like plastics and medical devices, purified and manufactured drugs. The list is too long. The lights are on and we're having this meeting because some old boy just punched a hole in the ground and took out that freedom molecule, and he's made America great, energy independent, and an economy that's the envy of the world. And we want to insult them, and we want to create this undue and unjust harm to these families. I urge my colleagues, do the right thing here. Let's give these guys a break as they transition, I don't know, to the John Kerry Green New Jobs program of making solar panels. Whatever it is, they need help. I want you to extend the same common decency and the same compassion that I've heard for the last 24 hours or so, okay? Thank you all. God bless, and I yield back, Mr. Chairman.
Thank the gentleman. Is Mr. Blumenauer prepared to be recognized?
Yeah, yes, Mr. Chairman.
Let me acknowledge Mr. Blumenauer to speak on the amendment.
Thank you. And I strongly urge rejection of this amendment. We're mixing apples and oranges, to say the very least. President Biden is moving forward on a comprehensive effort to try and restore the economy, investing in infrastructure. An important part of what they're doing with Secretary Kerry deals with climate issues. It is ultimately, we know, the source of actually more jobs. Already we have more jobs dealing with alternative energy than we have in more traditional sources. But that's irrelevant here. We're talking about COBRA benefits, which are an important element. We want to make them more affordable. We shouldn't be picking losers and winners in terms of extending this benefit. We feel strongly that it is important to have this as part of the menu to deal with the healthcare challenges of Americans. People can battle as they will on terms of some of the other issues. We're going to have lots of choices coming forward where there will be policy disagreements and advantages. But we don't need to wrap it up into the COBRA discussion and be able to complicate what should be a very simple, straightforward effort on behalf of the committee to extend the COBRA benefits and make them more affordable. And so I would strongly urge the rejection of this amendment.
Would the gentleman yield respectfully? Would the gentleman yield respectfully? Mr. Blumenauer?
I yield.
Thank you. I will withdraw this on the consideration or concerns of germaneness, and I think it's a fair point. I'd ask if you would work with me to help these poor souls because they are similarly situated, right? They didn't.
Mr. Arrington, if you would suspend for a moment, your amendment is germane.
But if he was, yeah.
Well, while reclaiming my time, I'm happy to have him withdraw the amendment and have a discussion later in terms of how we make sure that people in this country who need health care, looking at the range of options we have, I'm happy to discuss it with him. He's just down the hall from me in terms of socially distant conversation. But we don't need this amendment, and I strongly oppose it. And I yield back my time.
Mr. Schneider, can you yield, Mr. Blumenauer?
I will yield to Mr. Schneider.
Thank you. And Mr. Arrington, let me raise my hand to work with you on this as well. This is not to exclude anybody. I mentioned I have benefited from COBRA, and I understand it. I also grew up in the oil patch in Colorado and understand the challenges workers face in the cycle of boom and bust and the challenges as we move into a new environment economy, a new energy economy. We need to be helping all these people, and I am totally committed to working with you to make sure that we're getting assistance to everyone who's struggling, independent of where they live or the work that they do.
And briefly reclaiming my time, I would just say that I come from the Pacific Northwest, where the impact of climate change has been devastating with wildfires that have taken out whole communities. So we have a range of issues facing it, not the least of which, if we don't deal with this climate crisis, we're going to be in a world of hurt in ways that we've already seen. I'll yield back.
Thank the gentleman. So are we led to believe that the gentleman is prepared to withdraw his amendment? I would also allow Mr. Hearn, if he would like to speak on the amendment, even if Mr. Arrington decides he wants to withdraw it.
I'm going to keep it in there, Mr. Chairman, and
keep it in.
continue with it.
So then let me recognize, just before we proceed to Mr. Hearn, let me recognize the gentleman from Virginia.
Mr. Chairman, I withdraw the point of order, but do want to clarify that what the gentleman's intent is that the people from ANWR and Keystone Pipeline would be included in the COBRA coverage, because as we read the amendment right now, and staff also, it suggests that only those will be entitled to this COBRA benefit, therefore eliminating all of his constituents in Texas and my constituents in Virginia and yours in Massachusetts.
Okay. So the chair then would recognize Mr. Hearn.
Thank you, Mr. Chairman. I support this amendment from Mr. Arrington, which provides the same health care relief to those losing their jobs in the energy industry because of the president's executive orders. You know, if we go back and look at the last 3 weeks, President Joe Biden has issued over 40 executive actions. And after dodging many questions and even contradicting himself and never giving a clear energy policy platform on the campaign trail, he made it remarkably clear on day one that he is no friend to my Oklahoma families who need affordable and reliable energy, or whose livelihoods depend on providing energy to our nation. On his very first day in office, President Joe Biden took aim at Oklahoma's top industry, the energy sector, which employs thousands of Oklahoma and is the single largest contributor to our public education system and to our overall state revenues. Over 97,000 Oklahomans work in this traditional energy sector. Those jobs are in danger thanks to the president's policies. In addition to those jobs, tens of thousands more Oklahomans work in these jobs tangentially to energy. President Biden's decision to suspend the development of Keystone XL pipeline hurts our domestic oil supply. And in 2020, America was a net exporter of crude for the first time ever. This was a direct result of an aggressive agenda to support and expand domestic oil supplies. The Keystone Pipeline played an important role in that effort. Hindering the growth of American energy hurts us in the long run, especially in Oklahoma. If Democrats are going to propose lavish health care benefits for people losing their job, they should offer these same benefits to these Americans through no fault of their own who are in the energy industry or who are suffering under these presidential policies and what they're going to see in the Green New Deal energy policies. That I would ask that we would give them the same consideration. And Mr. Chairman, I reserve the balance of my time.
Thank the gentleman. Let me recognize Mr. Horsford, who I believe will yield to Mr. Byer. Mr. Horsford.
Thank you, Mr. Chairman. I just wanted to say briefly that we talked about giving the new president an opportunity to actually govern and work. Literally, he is in the White House meeting with Republicans on infrastructure today. And yet you all are somehow indicating that he is unwilling to reach across the aisle to get our economy back on track. It's unacceptable, and it's why the American people want us to work together to get things done. And I yield my time now to Mr. Byer.
Thank you, Mr. Horsford, very much. I just want to clarify before we vote on this amendment that the way the amendment is written, it will restrict this 85% COBRA benefit to those people who have lost their jobs from either of these two executive orders from President Biden, which means that all the other people who have lost their jobs through the COVID thing will not qualify for this 85%. And we're eliminating the coverage for those people in Oklahoma, Nevada, Virginia, and elsewhere who we are trying to help with this title. And with that, Mr. Chairman, I yield back.
Having no further requests for time, the question comes on the amendment from the gentleman from Texas, Mr. Arrington. Members are reminded to unmute themselves for the voice vote. All those in favor signify by saying aye.
Aye.
Those opposed, no.
No.
In the opinion of the chair, the noes have it.
On that, request recorded
Mr.
vote.
Brady has requested a recorded vote. Members are reminded that your camera must be turned on in order to be recorded. Please mute yourself until the clerk calls on you and state your name when recording your vote. The clerk will call the roll.
Mr. Doggett.
Doggett votes no.
Mr. Doggett votes no. Mr. Thompson.
Thompson votes no.
Mr. Thompson votes no. Mr. Larson.
Larson votes no.
Mr. Larson votes no. Mr. Blumenauer.
Blumenauer votes no.
Mr. Blumenauer votes no. Mr. Kind.
Kind, no.
Mr. Kind votes no. Mr. Pascal.
Pascal votes no.
Mr. Pascal votes no. Mr. Davis.
Davis votes no.
Mr. Davis votes no. Ms. Sanchez.
Sanchez votes no.
Ms. Sanchez votes no. Mr. Higgins.
Higgins, no.
Mr. Higgins votes no. Ms. Sewell.
Sewell votes no.
Ms. Sewell votes no. Ms. Delbene.
Delbene votes no.
Ms. Delbene votes no. Ms. Chu.
Chu votes no.
Ms. Chu votes no. Ms. Moore.
Moore votes no.
Ms. Moore votes no. Mr. Kilby.
Kilby votes no.
Mr. Kilby votes no. Mr. Boyle.
Boyle votes no.
Mr. Boyle votes no. Mr. Byer.
Byer votes no.
Mr. Byer votes no. Mr. Evans.
Evans votes no.
Mr. Evans votes no. Mr. Schneider.
Mr. Schneider votes no.
Mr. Schneider votes no. Mr. Swazi.
Swazi, no.
Mr. Swazi votes no. Mr. Panetta.
Panetta, no.
Mr. Panetta votes no. Ms. Murphy.
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez.
Gomez, no.
Mr. Gomez votes no. Mr. Horsford.
Horsford votes no.
Mr. Horsford votes no. Ms. Plaskett. Mr. Brady.
Mr. Brady votes aye.
Mr. Brady votes aye. Mr. Nunez.
Nunes votes aye.
Mr. Nunez votes aye. Mr. Buchanan.
Buchanan votes aye.
Mr. Buchanan votes aye. Mr. Smith of Nebraska.
Smith of Nebraska votes aye.
Mr. Smith of Nebraska votes aye. Mr. Reed.
Reed votes aye.
Mr. Reed votes aye. Mr. Kelly.
Kelly votes aye.
Mr. Kelly votes aye. Mr. Smith of Missouri.
Smith of Missouri votes aye.
Mr. Smith of Missouri votes aye. Mr. Rice.
Rice votes aye.
Mr. Rice votes aye. Mr. Schweikert.
Schweikert, yes.
Schweikert votes yes. Ms. Walorski.
Walorski votes yes.
Ms. Walorski votes yes. Mr. LaHood.
LaHood, yes.
Mr. LaHood votes yes. Dr. Wenstrup.
Wenstrup, yes.
Dr. Wenstrup votes yes. Mr. Arrington.
Arrington's a yes.
Mr. Arrington votes yes. Dr. Ferguson.
Ferguson is a yes.
Dr. Ferguson votes yes. Mr. Estes.
Estes votes yes.
Mr. Estes votes yes. Mr. Smucker.
Smucker, aye.
Mr. Smucker votes aye. Mr. Hearn.
Hearn votes yes.
Mr. Hearn votes yes. Ms. Miller. Mrs. Miller.
Miller votes aye.
Mrs. Miller votes aye. Ms. Plaskett. Mr. Chairman.
The chairman votes no.
Mr. Chairman votes no.
The clerk will report the tally.
Mr. Chairman, I have 24 noes, 18 yeas.
There being 24 noes and 18 ayes, the amendment fails. Are there additional amendments to the amendment in the nature of a substitute?
Mr. Chairman, this is Mr. Hearn. I have a amendment at the desk.
Mr. Hearn will be recognized in one moment. Let me just call on Mr. Byer.
Mr. Chairman, I reserve a point of order on Mr. Hearn's amendment.
The gentleman from Virginia has reserved a point of order, and as the gentleman's amendment is dispersed, we will then call upon him. Thanks. Mr. Hearn is recognized to speak on his amendment.
Thank you, Mr. Chairman, and to all my colleagues. There is no doubt our nation is facing unprecedented challenges right now. Congress came together 5 separate times over the past year. We've heard this talked about time and time again to pass trillions of dollars of economic aid, most of it in the form of deficit spending. The national debt continues to rise, but we Republicans do recognize the need to act boldly. We've been talking about that yesterday and today. Again, that's why we've repeatedly worked in a bipartisan way to pass trillions of dollars in relief for the American people. However, the urgency of the moment does not mean that we should abandon all sense of stewardship over public programs. Earlier this week, the Senate passed a very simple bipartisan amendment. Ensure anyone who receives economic impact payments, the stimulus check, is here in this country legally. House Democrats seem to agree since they've included the same policy in the legislation before us today. With this amendment, I'm simply asking to apply the same standard to the multi-billion-dollar subsidies for continuing coverage included in this bill as we consider how we allocate American taxpayer dollars to those who need it the most. Let's ensure that these subsidies, just like the stimulus checks, are going to the American people and to those who are here through the legal process. This amendment shouldn't be controversial since these subsidies will cover former employees who should have Social Security numbers if they're working. If they don't, this amendment protects hard-earned taxpayer dollars from being used to cover those costs. I urge my colleagues to adopt this amendment. Mr. Chairman, I reserve the balance of my time.
Thank the gentleman. The gentlelady from California. I'm sorry, let me go back to Mr. Byer.
Mr. Chairman, I withdraw my point of order.
The gentleman has withdrawn his point of order, and the chair would recognize Ms. Sanchez to speak on the amendment.
Thank you, Mr. Chairman. I move to strike the last word in opposition to this amendment.
The gentlelady is recognized.
You know, Mr. Chairman, I'm not surprised that my Republican colleagues are once again using these talking points against immigrants, their families, and the communities in which they work and live and contribute every day. Don't be fooled by this amendment. This amendment would impose harmful restrictions on individuals in need of financial assistance to keep health coverage during a global pandemic. Let me repeat that again. To keep their health coverage during a global pandemic. A global pandemic in which one person's health or sickness impacts so many in their communities. Individuals without Social Security numbers are hurting from the pandemic recession just as much as others are. All individuals who live and work in the United States have an obligation to pay taxes in the United States, regardless of whether or not they have a Social Security number. There is no reason, absolutely no reason, to treat these taxpayers any differently than other taxpayers when it comes to having access to subsidies for COBRA coverage. This is not a true attempt at compliance for these benefits. It's a continuation of our Republican colleagues' attack on lower income households and immigrants, their favorite whipping boys. This amendment places unprecedented restrictions on COBRA that will do serious damage to public health and to our hospitals. Our systems are already struggling. Why in God's name would you want to make it harder during a pandemic that has killed over 460,000 people in this country? Why would you want to make it harder for people to have health coverage? And in case it's failed to escape your notice, immigrants are serving on the front line of our pandemic. They're helping communities not only weather this crisis, but eventually recover from it. Because of immigration status, the public health and economic crisis has left many in vulnerable situations. Leaving people out slows and jeopardizes the effectiveness of our public health response. According to the Kaiser Family Foundation, undocumented individuals are 5 times as likely to be uninsured. Lack of health coverage forces patients to delay or skip the care they need. We know that this in turn exacerbates the spread of COVID-19. It places further strain on our doctors and hospitals who are already reeling from the pandemic. That is why it is especially important that we make healthcare coverage available to as many people as we can. And mind you, these are workers who want to continue their COBRA coverage after they've been let go or laid off. These are not people who are not working and not contributing. This amendment is not only counterproductive, it's a cruel effort to score cheap political points at the expense of everybody in this country's health. I urge my colleagues to oppose this amendment, and I yield back the balance of my time.
I thank the gentlelady. Let me recognize the gentleman from South Carolina, Mr. Rice, on the amendment.
The gentlelady uses the term immigrant and as a universal term and fails to recognize the distinction between legal immigration and illegal immigration. The amendment has nothing to do with legal immigrants, and the American people do not want the limited tax dollars that we have to respond to this emergency or anything else to be directed away from Americans and to people who break our laws and come here illegally. It is a very, very simple proposition. Illegal, we allow 1.1 million legal immigrants here every single year, twice as much as the next highest country. And illegal immigration on top of that creates many, many problems. It holds wages down for the people at the low end of the scale. People like the people from Marion County in my district, whose wages are 30% below the national average. And when we have illegal immigrants pouring in here who are willing to work for nothing, then it holds down wages for the people on the low end. It also takes very limited tax dollars that we have that we want to go to our American citizens to protect them in the time of this pandemic, and it takes it away and uses it for people who break the laws and come here illegally. It encourages illegal immigration. If we start offering benefits to people who come here illegally, then more people are going to come here illegally, and that creates other problems besides lower wages. It also creates problems with drugs, it creates problems with crime, it creates problems across the board. So I think that the overwhelming majority of the American people would support this amendment. They do not want to see our limited American taxpayer dollars being diverted to criminals who come across our border and break our laws and come here illegally. And with that, I yield back.
Thank the gentleman. Let me recognize the gentlelady from California, Ms. Chu, on the amendment.
I urge a strong vote of no on this amendment, which would actually deny health care for immigrants for the ability to get treatment for COVID, endangering themselves as well as the entire communities that they live in. The coronavirus does not discriminate based on immigration status, so it makes no sense from a public health perspective for our laws to do so. Doctors should decide what healthcare people need, not politicians. We all get sick regardless of where we are born, and it's not right for some people to get medical care while others are not. Immigrants are already heavily restricted from accessing public benefits, and we've seen the impact this has had on the pandemic, especially given the fact that immigrants are disproportionately represented as essential workers in this pandemic. And as a result, immigrants are already disproportionately uninsured. This amendment would make this situation even worse. And in addition to undermining testing and treatment, exclusionary policies like this now undermine COVID-19 vaccination efforts, prolonging the health and economic threat that's facing us all. It's amply clear that policies denying people the basics we all need to thrive based only on immigration status are reckless and dangerous. We must ensure that every person has access to medical care and economic supports without discrimination if we are to end the pandemic and recession. We can't adopt a mindset of pitting communities against each other for resources. This amendment would harm not just the health and well-being of immigrant families across the country, but the whole communities that they live in. And for that reason, I urge a no vote, and I yield back.
Thank the gentlelady. Let me recognize the gentleman from Nebraska, Mr. Smith, on the amendment.
Thank you, Mr. Chairman. I yield my time to Mr. Hearn of Oklahoma.
I'd like to thank my colleague. Again, I just remind everybody about what the amendment is for. And as soon as we pass this bill, subtitle F, we're going to go into subtitle G. And on the second page, I'm simply using the Democrat bill definition of who should receive stimulus payments and applying it equally throughout all the bills that we were voting on today. So this isn't something that I made up. This is something that the Democrat sponsored bills that have come to us in a committee to look at have put in there. So unless my Democrat colleagues are going to offer an amendment to their own bill to retract what they've already put in there, then I'm at a loss of why we wouldn't want consistency. And as regards to getting COVID treatments, we've passed a number of pieces of legislation in the last year to give COVID treatment to those who need it, regardless of their insurance status. So I just want to make sure I cleared that up, that I'm simply using your words in the upcoming bill to apply them equally in this bill as well. So with that, I yield back.
Thank the gentleman. Let me recognize the gentleman from California, Mr. Gomez, on the amendment.
Thank you, Mr. Chairman. As sure as the sun rises in the east and sets in the west, we can always count on my colleagues on the other side of the aisle to introduce some legislation to marginalize and scapegoat the immigrant community in this country. And so for me, this is not surprising. It's just it's another day, another amendment that we have to swat down and vote against. But one of the things I want to make clear is that this virus hasn't discriminated against different communities. And in fact, it does feel that it's disproportionately impacting the immigrant community and the Latino community more so than a lot of other communities across the country. And that's based on a number of factors, right? Everything from not having access to healthcare to being multi-generations in one household, you name it, and being essential workers on the front lines consistently during this pandemic. So this is something that is just another attack on the immigrant community. Listen, I get it. You don't think that immigrants should get it. I get it. But these are taxpayers. They are paying taxes. It's not something that they're not doing. It's something that they do consistently. Probably more so than even some people that used to also be in the executive branch until recently. So I just want to say that this is an important issue that we've got to keep fighting back against. And listen, regarding the stimulus checks payments, I would fight for more checks for I-10 holders as well. However, we don't always get everything that we want. It's something that I fought for. But I want to make it clear, during the CARES Act, the Republicans who passed the CARES Act, they included a provision that you basically blocked stimulus checks to U.S.-born children and U.S. citizens because they were of a mixed status in their family. And that was shameful back then. So we're fixing it. We're moving forward. But I think that we need to stop with the scapegoating that is very prevalent within my colleagues on the other side of the aisle. With that, I yield back.
The question is on the amendment offered by the gentleman from Oklahoma, Mr. Hearn. Members are reminded to unmute themselves for a voice vote. All those in favor signify by saying aye.
Aye.
Those opposed, no.
No.
In the opinion of the chair, the noes have it.
I request recorded vote.
Mr. Brady has requested a recorded vote. Members are reminded that your camera must be turned on in order to be recorded. Please mute yourself until the clerk calls on you and your name when recording your vote. Please call the roll.
Mr. Doggett.
Doggett votes no.
Mr. Doggett votes no. Mr. Thompson.
Thompson votes no.
Mr. Thompson votes no. Mr. Larson.
Larson votes no.
Mr. Larson votes no. Mr. Blumenauer.
Blumenauer votes no.
Mr. Blumenauer votes no. Mr. Kine.
Kine, no.
Mr. Kine votes no. Mr. Pascal.
Congressman Pascal votes absolutely no.
Mr. Pascal votes no. Mr. Davis.
Davis votes no.
Mr. Davis votes no. Ms. Sanchez.
Sanchez votes no.
Ms. Sanchez votes no. Mr. Higgins.
Higgins, no.
Mr. Higgins votes no. Ms. Sewell.
Sewell votes no.
Ms. Sewell votes no. Ms. Dalbene.
Dalbene votes no.
Ms. Dalbene votes no. Ms. Chu.
And the rest Ryan who showed up.
Ms. Chu. Ms. Moore.
Chu votes no.
Ms. Chu votes no. Ms. Moore.
Moore votes no.
Ms. Moore votes no. Mr. Kildee.
Kildee votes no.
Mr. Kildee votes no. Mr. Boyle.
Boyle votes no.
Mr. Boyle votes no. Mr. Byer.
Byer votes no.
Mr. Byer votes no. Mr. Evans.
Evans votes no.
Mr. Evans votes no. Mr. Schneider.
Schneider votes no.
Mr. Schneider votes no. Mr. Swazi.
Swazi, no.
Mr. Swazi votes no. Mr. Panetta.
Panetta, no.
Mr. Panetta votes no. Ms. Murphy.
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez.
Gomez, no.
Mr. Gomez votes no. Mr. Horsford.
Horsford votes no.
Mr. Horsford votes no. Ms. Plaskett. Mr. Brady.
Aye. Brady votes
Mr. Brady
aye.
votes. Mr. Brady votes aye. Mr. Nunez.
This votes aye.
Mr. Nunez votes aye. Mr. Buchanan.
Buchanan votes aye.
Mr. Buchanan votes aye. Mr. Smith of Nebraska.
Smith of Nebraska votes aye.
Mr. Smith of Nebraska votes aye. Mr. Reed.
Reed votes aye.
Mr. Reed votes aye. Mr. Kelly.
Kelly votes aye.
Mr. Kelly votes aye. Mr. Smith of Missouri.
Smith of Missouri votes aye.
Mr. Smith of Missouri votes aye. Mr. Rice.
Rice votes aye.
Mr. Rice votes aye. Mr. Schweikert.
Schweikert, yes.
Mr. Schweikert votes yes. Ms. Walorski.
Walorski's a yes.
Ms. Walorski votes yes. Mr. LaHood.
LaHood, yes.
Mr. LaHood votes yes. Dr. Wenstrup.
Wenstrup, yes.
Dr. Wenstrup votes yes. Mr. Arrington.
Arrington's a yes.
Mr. Arrington votes yes. Dr. Ferguson.
Ferguson is a yes.
Dr. Ferguson votes yes. Mr. Estes.
Estes votes yes.
Mr. Estes votes yes. Mr. Smucker.
Smucker, aye.
Mr. Smucker votes aye. Mr. Hearn.
Hearn votes yes.
Mr. Hearn votes yes. Mrs. Miller.
Miller votes aye.
Mrs. Miller votes aye. Ms. Plaskett. Mr. Chairman.
Chairman votes no.
Chairman votes no.
The clerk will report the tally.
Mr. Chairman, I have 24 noes, 18 yeas.
There being 24 noes and 18 yeas, the amendment fails. Are there any other amendments to the amendment in the nature of a substitute? Hearing none, if there are no further amendments, the question is on adoption of the amendment in the nature of a substitute. All those in favor signify by saying aye.
Aye.
Aye. Aye. Aye. Aye.
Those opposed, no.
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 In the opinion of the chair, the noes have it. I'm sorry, the ayes have it. I will
You
now.
were right the first time, Mr. Chairman.
Let me now recognize, this does wear on you, this process. I now recognize Mr. Byer for the purpose of offering a motion.
Mr. Chairman, I move that the committee do now favorably transmit to the House Committee on the Budget, Subtitle F, Budget Reconciliation and Legislative Recommendations relating to continuation of job-based coverage as amended.
The question is on transmitting the bill Subtitle F as amended to the House Committee on the Budget. Members are reminded to unmute themselves for the voice vote. All of those in favor signify by saying aye.
Aye.
Aye. Aye.
Those opposed signify by saying no.
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 The chair would acknowledge there's a bit of an interesting interaction of the chorus. In the opinion of the chair, the ayes have it. The motion is agreed to, and Subtitle F as amended is ordered, transmitted to the House Committee on the Budget.
Mr. Chairman, on this, I request a recorded vote.
Mr. Brady has requested a recording vote, and the clerk will call the roll. Members are reminded their cameras must be on. Please mute yourself until the clerk calls your name.
Mr. Doggett.
Doggett votes aye.
Mr. Doggett votes aye. Mr. Thompson.
Thompson votes aye.
Mr. Thompson votes aye. Mr. Larson.
Mr. Larson votes yes.
Mr. Larson votes yes. Mr. Blumenauer.
Blumenauer votes aye.
Mr. Blumenauer votes aye. Mr. Kine.
Kine votes yes.
Mr. Kine votes yes. Mr. Pasquarello.
Pascal votes yes.
Mr. Pasquarello votes yes. Mr. Davis.
Davis votes aye.
Mr. Davis votes aye. Ms. Sanchez.
Sanchez votes aye.
Ms. Sanchez votes aye. Mr. Higgins.
Higgins, yes.
Mr. Higgins votes yes. Ms. Sewell.
Sewell votes yes.
Ms. Sewell votes yes. Ms. Dalbene.
Dalbene votes yes.
Ms. Dalbene votes yes. Ms. Chu.
Chu votes aye.
Ms. Chu votes aye. Ms. Moore.
Moore votes aye.
Ms. Moore votes aye. Mr. Kilby.
Kilby votes aye.
Mr. Kilby votes aye. Mr. Boyle.
Boyle votes aye.
Mr. Boyle votes aye. Mr. Byer.
Byer votes aye.
Mr. Byer votes aye. Mr. Evans.
Evans votes aye.
Mr. Evans votes aye. Mr. Schneider.
Schneider votes yes.
Mr. Schneider votes yes. Mr. Swazi.
Swazi yes.
Mr. Swazi votes yes. Mr. Panetta.
Panetta, no.
Mr. Panetta votes no. Ms. Murphy.
Belay my last.
Murphy.
Belay my last. Panetta votes yes. I apologize.
Mr. Panetta votes yes. Ms. Murphy.
Murphy votes yes.
Ms. Murphy votes yes. Mr. Gomez.
Gomez, aye.
Mr. Gomez votes aye. Mr. Horsford.
Horsford votes aye.
Mr. Horsford votes aye. Ms. Plaskett.
Plaskett votes aye.
Ms. Plaskett votes aye. Mr. Brady.
Mr. Brady votes no.
Mr. Brady votes no. Mr. Nunez.
Nunes votes yes. Or no. Nunes votes no.
Mr. Nunez votes no. Mr. Buchanan.
Buchanan votes no.
Mr. Buchanan votes no. Mr. Smith of Nebraska.
Smith of Nebraska votes no.
Mr. Smith of Nebraska votes no. Mr. Reed.
Reed, no.
Mr. Reed votes no. Mr. Kelly.
Kelly is no.
Mr. Kelly votes no. Mr. Smith of Missouri.
Smith of Missouri votes no.
Mr. Smith of Missouri votes no. Mr. Rice.
Rice, no.
Mr. Rice votes no. Mr. Schweikert.
Schweikert, no.
Mr. Schweikert votes no. Ms. Walorski.
Walorski votes no.
Ms. Walorski votes no. Mr. LaHood.
LaHood, no.
Mr. LaHood votes no. Dr. Wenstrup.
Wenstrup, no.
Dr. Wenstrup votes no. Mr. Arrington. Mr. Arrington. Dr. Ferguson.
Ferguson is yes.
Dr. Ferguson votes yes. Mr. Estes.
Estes votes no.
Can I change the vote?
Yes, sir. Dr. Ferguson. Dr. Ferguson votes no.
Okay, let me run.
Mr. Estes.
Estes votes no.
Mr. Estes votes no. Mr. Smucker.
Smucker, no.
Mr. Smucker.
Smucker, no.
Ms. Smucker votes no. Mr. Hearn.
Hearn, no.
Mr. Hearn votes no. Mrs. Miller.
Miller votes no.
Mrs. Miller votes no. Mr. Arrington.
Arrington's a no.
Mr. Arrington votes no. Mr. Chairman.
Chairman is an aye.
Mr. Chairman votes aye.
Can I ask, is Ferguson recorded as a no?
Dr. Ferguson, you're recorded as no.
Thank you.
Yes, sir.
Is there anybody else who wishes to change and/or cast a vote? Hearing none, the clerk will report the tally.
Mr. Chairman, I have 25 yeas, 18 noes.
25 ayes, 18 noes.
Clerk will suspend.
Clerk will suspend. Plaskett voted. Okay. So the motion is agreed to. Subtitle F as amended is ordered transmitted to the House Committee on the Budget. And without objection, staff are authorized to make technical conforming changes to the committee print, and members have 2 additional days to file with the committee clerk supplemental, additional dissenting, or minority views. Our next order of business is Subtitle G, Budget Reconciliation Legislative Recommendations related to promoting economic security. I now recognize the gentlelady from Washington State, Ms. Del Bene, for the purpose of offering an opening statement.
Thank you, Mr. Chairman. The committee now will continue our work on the American Rescue Plan with a focus on the tax code. This subtitle that we will consider is key to helping the American people and the economy recover from the coronavirus pandemic by making sure that struggling families have the resources that they need. The pandemic has caused millions of Americans economic hardship and uncertainty. Columbia University estimates that 8 million people have fallen into poverty because of the COVID-19 pandemic. And this burden has disproportionately fallen on communities of color. For example, 1 in 7 families are currently struggling to secure the food they need. For Black and Hispanic families, it's more than 1 in 5. The American Rescue Plan will deliver critical relief to help families weather this crisis. This is particularly important for communities like mine in Washington's 1st District, where the first known cases of coronavirus were detected in the United States. Our district has been struggling with this public health and economic crisis for over a year now. It's time to deliver the relief our communities desperately need. The $600 rebates that Congress approved in December didn't do enough to bridge the gap that is faced by families in need. That's why the House passed the Cash Act, which would have increased the payments from $600 per person to $2,000 and made sure that families receive the payments for all of their dependents, not just for qualifying children. Unfortunately, the Senate didn't take up our bill. So we're taking an important step today by sending families the additional rebate of $1,400 per family member. This subtitle also provides much needed relief to struggling families by making improvements to the child tax credit, the earned income tax credit, and the child and dependent care tax credit. For decades, workers' paychecks have been flat or growing very slowly. And today we see income inequality rising at an alarming pace. Even before the pandemic swept across the country, the cost of a middle-class life has become increasingly out of reach for too many. Now, many families are nearing their breaking point, and so we have to act now. To provide families with children the necessary resources during this crisis, this subtitle increases the child tax credit substantially, raising the credit from $2,000 to $3,000 annually with an additional $600 credit for children under 6. This subtitle also makes the child tax credit and child and dependent care credit fully refundable, allowing families that are currently left out of these credits because they make too little to access the full benefit. In addition, it expands the earned income tax credit for childless workers and extends federal funding for all 3 credits to Americans who live in the territories, and it ensures that families living in Puerto Rico benefit from the same child tax credit as Americans living on the mainland. I made it a priority to include the expansion of the child tax credit in this bill, which will deliver benefits to American families who need it the most. This would not have been possible without the support and tireless efforts of Chairman Neal, Congresswoman DeLauro, and many of my colleagues who have fought to strengthen this benefit. The expansions in this bill are estimated to cut child poverty in half, but we need to go further and make this credit permanent to help us build the middle class back better than ever before. This subtitle also builds on the success of the bipartisan Families First Coronavirus Response Act and the CARES Act by further extending and expanding the paid leave credits and the employee retention tax credit. Although I fully support those who are working to reinstate the leave requirement for employers, I believe that our expansions are a positive step forward that will ease the worries of many workers during this public health crisis. The employee retention tax credit is a particularly important tool because it helps keep workers connected to their jobs, connected to their benefits, and off the overburdened unemployment system. Thanks to the employee retention tax credit, or ERTC, our small businesses will be able to maintain their workforces so that they're better prepared to come back from the coronavirus pandemic. This subtitle also builds on the special enrollment period that the Biden administration just announced, first enhancing the amount of the ACA marketplace premium tax credits, thereby lowering families' out-of-pocket costs. Second, it helps unemployed workers afford their health insurance through ACA premium subsidies. This provision will help us better support Americans who typically aren't offered health insurance through their employer and thus would not benefit from support for COBRA coverage. With that, I want to thank the members of this committee who worked so hard on this subtitle, Today's Work Response to the Coronavirus Pandemic, while positioning families and workers for a post-pandemic future. And with that, I yield back.
I thank the gentlelady. Now let me recognize the gentleman from Nebraska, Mr. Smith, for the purpose of offering an opening statement. Mr. Smith.
Thank you, Mr. Chairman. I appreciate the time. Earlier in this markup, I expressed disappointment that the majority did not even try to work with us on issues like McVee, where we have a long-standing track record of bipartisan support. Likewise, we don't oppose every single provision here. Extending the temporary paid leave credit we enacted last year and extending it to cover time off for vaccinations could have been bipartisan. We would have been happy to work with you on proposals to extend the employee retention credit and to ensure idle loans remain untaxed as well. I'm disappointed no one asked us. It seems like an odd way to implement President Biden's stated goal of bringing our nation together. I do have concerns about the bulk of this title, though. The $1,400 checks to individuals are expensive and not at all targeted. In previous COVID bills, we have already targeted more than $20,000 per person in specific benefits to those who are unemployed and need the most help. We are happy to discuss targeted options to help the jobless. This certainly is not the answer. I'm also disappointed in how much of this title seems to use COVID-19 as an excuse to enact a wish list of Democratic priorities which predate the pandemic entirely. While there are some tweaks from previous proposals, the child tax credit expansion here was considered in this committee in 2019 and is not targeted at COVID. Unlike the earned income tax credit, this refundable credit does nothing to encourage Americans to advance in the workforce. The majority is also proposing to implement this change in a way which makes it far more complicated for IRS to implement. The taxpayer advocate has said it would take 18 months to implement this proposal. The majority proposes to attempt to do this in 18 weeks with an administrative cost of around $400 million. We support a strong child tax credit. In TCJA, we doubled the child tax credit in a way that rewards the working people who need it most. The earned income tax credit and dependent care credit expansions, like the child credit expansion, is not targeted to addressing COVID and are proposals Democrats were pushing long before the pandemic. There's also a proposal shoehorned in at the end of this title relating to how businesses allocate their interest expense under international tax reforms we enacted as part of the Tax Cuts and Jobs Act. I'm happy to have a conversation about how to further reform the international sections of our tax code, but this has nothing to do with COVID. Mr. Chairman, we stand ready to address serious COVID relief proposals which would utilize the tax code to reopen businesses, reconnect workers, and get us back to the strong pre-COVID economy. Economists tell us this title is currently structured will not accomplish that. I look forward to a thoughtful debate, and I yield back.
Thank you, Mr. Smith. The committee will now proceed to consideration of Subtitle G. Without objection, the measure will be considered as read and open for amendment at any point. At this time, I offer an amendment in the nature of a substitute, which was distributed in advance along with the green sheet explaining it. Without objection, the amendment in the nature of a substitute shall be considered as read, open for amendment at any point, and considered base text for the purpose of amendment. Let me now turn to Tom Barthol, Chief of Staff at the Joint Tax Committee, to provide technical descriptions of the amendment in the nature of a substitute, with emphasis on changes made since introduction. I ask that members hold their questions until after Mr. Barthol's presentation. Mr. Barthol.
Thank you, Mr. Chairman. The members of the committee have before them 3 joint committee documents, JCX3, which describes the underlying legislation, and JCX7, which describes your amendment in the nature of a substitute. JCX9 provides the staff's estimated budgetary effects of the proposals contained in the proposed legislation. Let me briefly run through the provisions, and I'll emphasize the substantive change made in your amendment in the nature of a substitute. Just to review, the proposal provides for another round of recovery rebates. It's basically the same thresholds for qualification as under the CARES Act, different requirements for Social Security. Dependents can be beneficiaries, broadened from just qualifying children. The child tax credit, as was noted by Ms. Del Bene, would be increased to $3,000 generally and $3,600 for children under age 6. This is a proposal that is applicable only for tax year 2021. It further would change the age of a qualifying child to under age 18, and it would be fully refundable, as was noted. The earned income tax credit has 2 types of changes. One, temporary, just for tax year 2021, would change rules applicable to those who could be eligible for the childless tax credit. It would reduce the age at which a qualifying taxpayer could qualify to age 19 and would eliminate the restriction for those above age 65. It would also increase the percentage and phase-out percentages and increase the maximum credit relative to present law. On a permanent basis, it would make some other substantive changes. It would allow claims of the childless credit if one has a child who did not satisfy certain taxpayer identification and other ID requirements. It would allow certain separated spouses, those with qualifying children, to be eligible to claim on a separate return the childless EITC. And it would change generally for the EITC the disqualified income limitation. The child and dependent care credits, as Ms. Del Bene noted, would be made permanent. They would also be increased. The current law rate of 35% and 20% would be increased to a 50% rate with a phase-out rate beginning at adjusted gross income of $125,000. The employment and dependent care credit would have a comparable increase, again for 2021 only, increasing the employer-provided dependent care exclusion from $5,000 to $10,500. The credits for employers who provide paid sick leave and paid family leave enacted under the Families First Coronavirus Relief Act would be extended through September 30th of this year, and state and local government employers would now be made eligible to claim that credit. The employee retention tax credit enacted as part of CARES and modified as part of the Consolidated Appropriations Act of 2021 would be extended through the end of the calendar year. The premium access tax credit would be increased by reducing the required household share relative to income also provides that there be no recapture related to 2020 and provides special rules for the measurement of qualifying income to unemployment insurance recipients for tax year 2021. The present law present law rules permitting worldwide allocation and apportionment of interest expense would be repealed. The substantive change of note in the chairman's amendment in the nature of a substitute relates to the treatment of certain territories for the permanent changes in the earned income tax credit, and it allows for 100% of the cost of mirror code territories and American Samoa to be repaid to those for their earned income tax credit expense to be repaid by the Treasury. Mr. Chairman, that concludes my brief walkthrough of the provisions before the committee. I'd be happy to answer any questions that the members might have.
Thank you, Mr. Barthwold. And there is an opportunity here to ask questions, or we can proceed to striking the last word. So with that, I will proceed in the order of recognition to recognize Mr. Doggett to strike the last word.
Thank you very much, Mr. Chairman. The widening income gap and racial disparities in our country have only been magnified by this pandemic. As families have struggled to keep food on the table after losing jobs through no fault of their own, we've seen our Republican colleagues object time and again to additional relief payments and to extending unemployment. They said it wasn't necessary, but they did have bigger hearts to support relief for a small number of very fortunate Americans. Senate Republicans embraced a special tax expenditure that gave 82% of its benefits to those with annual incomes of over $1 million, each of whom got an average benefit of $1.6 million. This net operating losses provision offers retroactive tax breaks for losses incurred 2 years before anyone had ever heard of COVID-19, nor can it be justified based on economic recovery. Mark Zandi, chief economist at Moody's, found that this type of provision of the 20 that he studied was the least likely to benefit the economy, generating only about 27 cents for every dollar that was invested there. The hedge fund managers and the real estate speculators did very well with this provision, but plumbers and bus drivers, nurses and teachers got nothing. And Republicans cared so much for those at the top that they were so generous with this relief that it cost more at the time that infections were soaring than all of the money in the same bill that was allocated to all of the hospitals in all of America. To be honest, such a huge tax giveaway would never have occurred without the acquiescence of some Democrats to a provision buried in a 300-plus page bill. Since last summer, a number of us, most recently 120 members of the House and Senate, have sought repeal of this egregious provision and using the money to invest in those with genuine need. It's more than troubling that today's bill inexplicably does nothing about this wrong. Fortunately, what the bill does contain offers significant benefits to many Americans who face day-to-day struggle to provide for their families. In the face of the Trump-provoked anti-immigrant hysteria of last year, thousands of American citizens and families with American citizen children were denied any relief because one of their family members paid their taxes using, instead of a Social Security number, an I-10, an individual taxpayer identification number. And these children will also no longer be excluded from other benefits in this bill, and injustice is corrected. Additionally, the new relief payments will be available to others who've been unfairly excluded, like dependents of all ages, as students and the disabled. And with the unceasing advocacy of our colleague Rosa DeLauro, joined in the committee by our colleague Ms. Delbeni, this bill includes the first year of what many experts have said is a generational change in child poverty.
It assures the full benefit of a refundable child tax credit, which for the first time will be delivered in monthly payments. It assures that this full benefit will be extended to families that were just too poor to get help in the past. This expansion is expected to lift 4 million children out of poverty. For many, it means food and shelter and hope. And some poorer families will also benefit from our making the child independent care credit fully refundable, so they can obtain access to child care. With the leadership of Chairman Neal, this bill expands the Earned Income Tax Credit, one of our most effective ways of fighting poverty, to over 17 million childless workers to help them work themselves out of poverty. Recognizing that so many struggling families and our economy just cannot wait any longer, I support this legislation today for what it does, not for what it doesn't. And I yield back.
Thank the gentleman. With that, let me recognize the gentleman from South Carolina, Mr. Rice, to strike the last word.
Thank you, Mr. Chairman. I just want to remind the committee that the provision that Mr. Doggett was decrying, the net operating loss carryback provision, was one provision in a much larger bill, the Tax Cuts and Jobs Act that was adopted at the end of 2017, that kickstarted the American economy, and that within 2 years, the result was that unemployment was at historic lows, 3.5% or so nationwide, record employment for African Americans, women, Hispanics, and people of every stripe. And for the first time in decades, wages were growing over 3%. The middle class was being restored. The middle class was growing. So we can sit here and pick at individual portions of the Tax Cuts and Jobs Act, but to say that anyone was left behind by that bill is an absolute misstatement. There was prosperity and prosperity for all. Unfortunately, we were hit with COVID, and our economy has performed exceedingly well. It is still remarkable in the world that it has performed as well as it has through COVID. We've got a ways to go to recover, but as long as we leave those pro-growth policies in place, you can bet that our recovery will happen quickly.
Will the gentleman yield?
Not quite yet. As opposed to the Obama and Biden response to our last economic crisis that stagnated, that smothered our economy, and that took, as a result, 8 years, 8 years, and our economy still hadn't recovered. It took the pro-growth policies of Donald Trump and a Republican Congress to put in place to finally get unemployment at record lows, to lift people in every corner of the country, and to restore our middle class. And with that, I yield back.
Mr. Rice, this is Congressman Brady. Would the gentleman yield for just 30 seconds?
Oh, yes.
So I'll be very quick, Mr. Chairman. So first, let me fact check Mr. Doggett's claim about 83% of the tax breaks in the Tax Cuts and Jobs Act. The top 1%, factcheck.org, calls this claim misleading. If we're on Twitter, I'm sure it would be censored. As to the net operating losses, thank goodness we had that provision. These are the workers at companies that didn't get a PPP, didn't get help from Main Street lending. Frankly, those dollars were left in those businesses to help minimize layoffs rather than send it to Washington. The NOL provision, as he claims, is not a tax cut, it's a loan on these operating losses. With that, I yield back to Mr. Rice.
Will the gentleman from South Carolina yield?
I don't think I have any time left to yield, but
I would grant a minute on this only because the clock went awry.
Okay, I'll be very brief
It's
with
like
the gentleman.
resetting the clock in the NFL games. So
let me just ask the gentleman, I think he's speaking of a different bill than I'm speaking of. I have plenty of criticism of your 2017 bill, but in fact, what I'm advocating is a provision that you voted for in it that has a limitation on people not getting more than $500,000, $500,000 in benefits. The measure I'm referring to is the one that was approved last spring that allowed people to go back and claim losses before the pandemic even occurred. So we
Will
can
the
debate
gentleman yield?
the merits of your 2017 bill later.
That is exactly
but
the
that's
bill
not
I'm
the basis
referring
of
to,
my
Mr.
concern.
Doggett.
All right. So let's proceed. The chair now would recognize Mr. Thompson for the purpose of striking the last word.
Mr. Chairman, thank you very much. I appreciate the opportunity to speak briefly on this important piece of the American Rescue Plan. During this markup, my colleagues and I have all spoken many times on the urgent need to provide relief to families and businesses. We all know the statistics and we've all heard the stories. A quarter of U.S. adults say someone in their household was laid off or lost their job because of coronavirus. 1 in 5 renters are behind on their rent payments. Families with children are more likely than others to report that they sometimes or often hadn't had enough to eat during the previous week. In fact, 48% of Africans say that the pandemic has had a major impact on their ability to afford housing, food, and/or utilities. These aren't just numbers. They're not just numbers. They represent the struggles of neighbors, colleagues, families, and kids who deserve more help. As you said, Mr. Chairman, we're taking an important step towards providing that help with these tax provisions. First and foremost, we're spending an additional $1,400, sending an additional $1,400 for taxpayers and their dependents. These funds will provide an immediate lifeline to workers and to families. The funds will also generate more economic activity for hard-hit businesses in my district and in everybody's district on this panel. I'm also a strong supporter of the expansion of the child tax credit, earned income tax credit, and child and dependent care tax credit, all included in this package. These long overdue changes will help lift many households out of poverty, especially families with young children. I urge my colleagues to support these and the other critical tax provisions in this bill. Mr. Chairman, thank you, and thank you to the staff for all the great work that's been done, and I yield back the balance of my time.
Chair would now recognize the gentleman from Illinois to strike the last word, Mr. Davis.
Thank you, Mr. Chairman. I move to strike the last word.
Gentleman is recognized.
Suffering is great and widespread during this public health crisis. I applaud you, Mr. Chairman, and my colleagues for this bill that makes a historic reduction in child poverty. A recent study by the National Academy of Sciences makes it clear that a robust child and dependent care tax credit, a $3,000 child allowance via the child tax credit, and direct investment in child care subsidies from the bill yesterday will significantly reduce child poverty and greatly increase parental employment and earnings, especially for African American families, Latinx families, single parents, and mothers younger than 25. The child tax credit expansion alone would benefit over 2.5 million children in Illinois, or 80% of the children under the age of 18. Research also shows that for families with children under the age of 5, receiving an extra $3,000 per year boosts children's adult earnings by 17%. Thus, this bill provides critical financial support to alleviate harm now and strengthen children's futures. Also, I am extremely proud that this bill invests substantially in financial assistance to help workers and families survive this health and economic crisis. The $1,400 checks will help tremendously. Further, the bill improves the tax system for low-income workers and working parents so they aren't taxed into poverty and can afford child care as our economy reopens. I am especially grateful for the expansion of the Earned Income Tax Credit to non-custodial parents and the lowering of the Earned Income Tax Credit eligibility age to 19 to help vulnerable young workers like foster youth, homeless youth, apprentices, and job training program graduates. The policies advanced in this package will dramatically reduce child poverty and strengthen the economic well-being of individuals and families. I strongly support this bill and urge my colleagues to vote in favor of it, and I yield back the balance of my time.
I thank the gentleman. Let me recognize the gentlelady from Alabama, Ms. Sewell, to strike the last word.
Thank you, Mr. Chairman. I rise today to support this very important subtitle. Today, we are considering legislation to dramatically reduce child poverty and improve the livelihoods of millions of low-income families. The expansion of the child tax credit and the earned income tax credit included in this bill will have life-changing effects on so many families hardest hit by the COVID-19 pandemic. I want to thank my colleagues, Susan Delbene, as well as Rosa DeLaura, who have worked tirelessly in their leadership on expanding these important tax tools that will help struggling families. We know that the child tax credit has historically excluded most of the children that need it most, those of low-income families or no income families, which are currently excluded from receiving the child tax credit. Black and Latino children face heightened rates of persistent poverty and disproportionately miss out on the full benefits of the child tax credit. In my district of Alabama, 53%, a majority of the kids in West Alabama, are currently excluded from the full benefits of the child tax credit. The American Rescue Plan will fix this inequity by lifting more than 4 million children out of poverty, reducing the child poverty rate by 40%. In Alabama, over 1 million children will benefit from this expansion. I am proud to support this proposal, which not only makes the child tax credit available to all children, but also expands the benefit levels to meet our current economic crisis caused by this global pandemic, and make these payments available to needy families on a monthly basis. This expansion of the child tax credit is a huge benefit to America's neediest families. The bill would make the full child tax credit available to children in families with low and no earnings at all. And it would also increase, as we've said, the credit to $3,000 per child and $600 more for children under 6. This will make a huge difference for individual families in my district. For example, a single woman of a toddler who currently earns $10,000 a year, providing in-home care to elderly people, now receives a child tax credit of $1,125. Under this bill, she'd receive $3,600. I want to remind my colleagues that it takes $13,600 to be considered below the poverty line. And I think that it's critically important that the difference between receiving $1,125 and $3,600 is a difference between being able to afford needed medicines for one's child, to be able to feed that child, and to pay one's mortgage or rent. Likewise, a single mother with a 4-year-old daughter and an 8-year-old son who is out of work for the year due to the health crisis now receives no child tax credit at all, adding to the family's financial insecurity. Under this bill, she will receive the full child tax credit of $3,600 for her daughter and $3,000 for her son, who is 8 years old. This will help tremendously for their children's expense and alleviate much of the financial burden that this family now faces. This is money, again, that they would not receive otherwise. People are hurting. We need to do something about it, and we need to do something about it now. I know that there are many in my district and in my state who are depending upon that $1,400 rebate stimulus check just to pay back bills that are already due. So many of those utility bills have stocked up because people were generous the first 3 or 4 months of this pandemic, and they allowed people to miss their utility payments. Now, those bills have come home to roost, and people must pay them. It is a difference between having one's lights on and one's lights off. I want us to remember that behind every dollar of this bill are needy, targeted Americans who need help now. Let us do the right thing and pass this bill. I think utilizing the tools of our tax code to help people is what we should be all about. I urge my colleagues to vote with me in passing this important legislation. Thank you.
Thank the gentlelady. Let me recognize the gentlelady from Wisconsin, Ms. Moore.
Well, thank you so much, Mr. Chairman. And I just want to associate myself with the comments of all of my colleagues, especially Representative Dale Benny, who's worked so hard on the child tax credit. And of course, this is a big subtitle, and it really reflects just years of work that these members have put in. You've heard them speak here this afternoon. And in the interest of time, I just will associate myself with their comments. What I want to do, though, is just lift up a couple of points. The economic impact payments, of course, are extremely important toward just helping people dig out of this ditch that they're in. Just as Ms. Sewell just indicated, a lot of people will just use it to dig themselves out and won't have a penny left after they pay some back bills. But I want us to remember the victims of domestic violence. We've been trying to work with the IRS to see if we could get replacement checks for victims of domestic violence whose abusers have taken all of the benefit and not shared any of it with them. And so often they are the custodians with children. We think from the taxpayer advocate that they can do this. We want to continue to work with you, Mr. Chairman, to make sure that we do that. I also want to talk about the child tax credit, which is just amazing. When I first got here, I was critical of it because it was not refundable. And it really didn't benefit a lot of poor women. So I appreciate that. And I also appreciate the fact that it's going to be paid monthly. I mean, that's going to make a really big difference to have a monthly income to help people deal with those recurring expenses. I'm the chief sponsor of another expansion of the Earned Income Tax Credit called the Worker Act, which would also utilize a monthly payment mechanism. As we both know, the child tax credit, earned income tax credit, go a long way in ameliorating poverty. And last, before my time runs out, I want to talk about the amazing work that's been done on paid family leave, sick and family leave. It is just so very, very important that we have this. There was a study that was just done Mr. Chairman, without objection, I'd like to place in the record a copy of the Wisconsin Examiner for January 29th, 2021. Report finds benefit for economy, health, and universal paid sick leave.
Without objection.
Without objection, thank you. What this report reveals is that we could cut down coronavirus infections by 10,000 people a month and save 75 people a month just by implementing a paid family and sick leave policy. And with that, I just want to say just what a wonderful subtitle this is. Glad to be associated with it. And with that, I would yield back my time.
I thank the gentlelady. Let me recognize the gentleman from Oregon, Mr. Blumenauer.
Thank you. Thank you very much, Mr. Chairman. I deeply appreciate what you and our team have put together as we related to these tax credits. This is the most substantial increase of benefit for people who need it the most. And as several of my colleagues have pointed out, the way that these tax credits are structured now, that for many poor families, they don't make enough to qualify for assistance. That's an outrage. And the proposals we have before us will remedy that and make a huge difference at just the time we need it, because this pandemic has exposed disparities in healthcare and has highlighted how vulnerable these families are. Millions of families. And this is a targeted approach to make a difference. I would differentiate that from what we've seen in the past. We've had a little revisionist history here from some of my colleagues. The ranking member likes to do some fact checking. Well, as a practical matter, the performance of the Trump economy was actually worse than, for example, in terms of job creation. The last 4 years of Obama was superior to what happened with the Trump administration, even after they lavished over $2 trillion on people who needed it the least. And I would point, in terms of being targeted, that the benefits of their tax program were temporary for ordinary people. Those for the most wealthy were made permanent. It just is a relatively stark contrast in terms of priorities, what matters, and what we're going to fight for. I would associate myself with comments from my friend, Mr. Doggett, who pointed out what happened when the Republicans were writing in the Senate provisions on the NOL that concentrated, again, in the most extreme fashion, benefits for folks who definitely didn't need it, the wealthiest among us. And it had absolutely nothing to do with the pandemic, but it was slipped in over $100 billion. And I think the proposals you have before us dealing with these tax credits is an opportunity to reset the priorities for people who need it the most and lead being able, I hope, for permanent changes in the future to make the tax code in all of its provisions more progressive, more fair, and more effective. And with that, Mr. Chairman, I would yield back.
I thank the gentleman. The chair is now prepared to proceed with amendments. Are there any amendments to the amendment in the nature of a substitute?
Mr. Chairman.
I would recognize the gentleman from South Carolina, Mr. Rice.
Mr. Chairman, I have an amendment at the desk.
The gentleman has an amendment at the desk. I'm going to recognize Mr. Byer, and then we will proceed.
Mr. Chairman, I reserve a point of order on the gentleman from South Carolina's amendment.
Mr. Byer is reserved a point of order, and as we pass out the amendment, we will then recognize Mr. Rice. Pardon? Good to go. The gentleman from South Carolina, Mr. Rice.
Thank you, Mr. Chairman. I think everybody on the panel agrees that the best way to recover from this pandemic economically is to get our economy up and running. And in order for our businesses to reopen and our employees to go back to work, we need to encourage safety. Nobody wants to reopen their business. Nobody wants employees back in, and employees don't want to come to work if they feel like they're in danger from the virus. So this is a common sense amendment that would allow for a new tax credit called the Healthy Workplaces Tax Credit. And what it does is for money spent for safely reopening, things like if you have a special ventilation system that you want to put in, if you want to put up dividers, if you want to put up signs to tell people to stay apart or buy PPE for your employees or anything like that, the business would be allowed a tax credit for 50% of the expenses of doing it, up to a maximum of $1,000 per employee for a business with less than 500 employees. It would drop to $750 for businesses with less than 1,000 employees, and then it would drop to $500 for businesses with over 1,000 employees. It's a common sense measure. It was actually included in early version of the Senate bill that we passed in December. It was struck at the last minute. But if we want our economy to be back up and running quickly, if we want our employers to feel safe in reopening and customers to feel safe, and if we want our employees protected, the workers protected, and for them to feel safe coming back to work, this is just a common sense measure that would encourage that, and that would allow us to get our economy back up and running quickly. And with that, I yield back.
Does the gentleman from Virginia reserve his point of order?
Mr. Chairman, I withdraw the point of order.
The gentleman has withdrawn his point of order. Is there anybody who wishes to be recognized on the amendment from the gentleman from South Carolina, Mr. Rice? We'll proceed to a vote. The question is on agreeing to the amendment offered by the gentleman from South Carolina, Mr. Rice. Members are reminded to unmute themselves for the voice vote. All those in favor signify by saying aye.
Aye.
Those opposed, no.
No.
In the opinion of the chair, the noes have it. A record vote.
On that, I would request recorded votes.
Mr. Brady has asked for a recorded vote. Members are reminded that your camera must be turned on in order to be recorded. Please mute yourself until the clerk calls on you and state your name when recording your vote. The clerk will please call the roll.
Mr. Doggett.
Doggett votes no.
Mr. Doggett votes no. Mr. Thompson.
Thompson votes no.
Mr. Thompson votes no. Mr. Larson. Mr. Larson. Mr. Blumenauer.
Blumenauer votes no.
Mr. Blumenauer votes no. Mr. Kine.
Kind, no.
Mr. Kine votes no. Mr. Pasquale.
Pascal votes no.
Mr. Pasquale votes no. Mr. Davis.
Davis votes no.
Mr. Davis votes no. Ms. Sanchez.
Sanchez votes no.
Ms. Sanchez votes no. Mr. Higgins.
Higgins votes no.
Mr. Higgins votes no. Ms. Sewell.
Sewell votes no.
Ms. Sewell votes no. Ms. Dalbene.
Dalbene votes no.
Ms. Dalbene votes no. Ms. Chu.
Chu votes no.
Ms. Chu votes no. Ms. Moore.
Moore votes no.
Ms. Moore votes no. Mr. Kildee.
Kildee votes no.
Mr. Kildee votes no. Mr. Boyle.
Boyle votes no.
Mr. Boyle votes no. Mr. Byer.
Byer votes no.
Mr. Byer votes no. Mr. Evans.
Evans votes no.
Mr. Evans votes no. Mr. Schneider.
Mr. Schneider votes no.
Mr. Schneider votes no. Mr. Swazi.
Swazi, no.
Mr. Swazi votes no. Mr. Panetta.
Panetta, no.
Mr. Panetta votes no. Ms. Murphy.
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez.
Gomez, no.
Mr. Gomez votes no. Mr. Horsford. Mr. Horsford. Ms. Plaskett.
Plaskett votes no.
Ms. Plaskett votes no. Mr. Brady.
Brady votes aye.
Mr. Brady votes aye. Mr. Nunez.
Nunes votes aye.
Mr. Nunez votes aye. Mr. Buchanan. Mr. Buchanan votes aye. Mr. Smith of Nebraska.
Smith of Nebraska votes aye.
Mr. Smith of Nebraska votes aye. Mr. Reed. Mr. Reed.
Reed votes aye.
Mr. Reed votes aye. Mr. Kelly.
Kelly votes aye.
Mr. Kelly votes aye. Mr. Smith of Missouri.
Smith of Missouri votes aye.
Mr. Smith of Missouri votes aye. Mr. Rice.
Aye. Mr. Rice votes aye.
Mr. Rice votes aye. Mr. Schweikert.
Schweikert votes yes.
Mr. Schweikert votes yes. Ms. Walorski.
Walorski votes aye.
Ms. Walorski votes aye. Mr. LaHood.
LaHood, yes.
Mr. LaHood votes yes. Dr. Wenstrup.
Wenstrup, yes.
Dr. Wenstrup votes yes. Mr. Arrington.
Arrington's a yes.
Mr. Arrington votes yes. Dr. Ferguson. Dr. Ferguson. Mr. Estes.
Estes votes yes.
Mr. Estes votes yes. Mr. Smucker.
Specker, aye.
Mr. Smucker votes aye. Mr. Hearn.
Mr. Hearn votes yes.
Mr. Hearn votes yes. Mrs. Miller. Mrs. Miller.
Aye.
Mrs. Miller votes aye. Mr. Larson.
Mr. Larson votes no.
Mr. Larson votes no. Mr. Horsford. Dr. Ferguson. Mr. Chairman. Mr. Chairman.
Do we recognize Dr. Ferguson yet?
He's on his way.
Oh. Chairman,
Dr.
the chairman votes no.
Mr. Chairman votes no. Dr. Ferguson.
There's been a sighting. We can see you. Would you unmute Dr. Ferguson?
Yes, I'm sorry. Vote yes.
Dr. Ferguson votes yes.
The clerk will report the tally.
Mr. Chairman, I have 24 noes, 18 yeas.
24 noes and 18 yeas. The amendment fails. Are there additional amendments to the amendment in the nature of a substitute? Yes. The gentleman from Pennsylvania.
Mr. Chairman, I have an amendment at the desk.
Let me call on Mr. Byer, and then we will proceed. Mr. Byer?
Mr. Chairman, I reserve a point of order on the amendment.
Gentleman has reserved a point of order. We will just await the amendment being passed out, Mr. Smucker, and then we will recognize you. Thank you. gentleman from Pennsylvania, Mr. Smucker, is recognized to speak on his amendment.
Thank you, Mr. Chairman. There's been a lot of talk over the past 2 days about the unemployment provisions in this bill that allow those who are on unemployment to receive more dollars than when they were employed. So let me just be clear about that. The majority members of this committee know that many on unemployment today are receiving more than if they returned to work, and they're okay with that. In fact, that's the way they think it should be, that someone on unemployment should receive more dollars than if they returned to work. I know they're okay with that, and that's the way they think it should be, because they want to increase the federal unemployment rate, ensuring that more people find themselves in that situation where they can better provide for their family by staying home and taking the federal dollars rather than going back to work. And I also know that they believe, the majority members, that this is the way it should be because they have repeatedly turned down Republican proposals to provide limits, common sense limits that ensure that employees are incentivized to return back to work. And I had a member on the other side yesterday say, it's insulting to talk about workers this way because they want to go back to work. And I agree that is the case. And there's dignity that comes with work. And this is very, very important today because there are millions of people out of work and the national unemployment rate remains at 6.3%. Now, I have heard all of us on both sides of the aisle say that it's important to rebuild this economy, and to do that, we have to ensure that jobs are available and that people are working once again. And as the Congressional Budget Office reported last week, they are not projecting that we return to the pre-pandemic labor market strength where unemployment was at record lows and wages were up at any time during the next decade. That's what CBO is projecting, that unemployment rates will stay higher than what they were before the pandemic hit. That's not acceptable. And I think the American worker deserves better. We should be finding ways to ensure that jobs are available and that people will be willing to take those jobs. This bill doesn't address that. This $2 trillion bill put forward by the Democrats does virtually nothing to shore up our labor market. In fact, the new minimum wage mandate in this bill, according to CBO, is expected to cause additional loss, not a gain, but a loss of 1.4 million jobs. This relief package should be forward-looking. It should include incentives to help those who want to re-enter the labor market, but who lack recent job experience, whose lack of recent job experience prevents them from getting hired. My amendment would help Americans get back to work. This tax credit that I'm proposing in this amendment would help businesses bring long-term unemployed workers off the sidelines and back into the workforce. Now, we know these types of tax incentives work. This is similar to the Work Opportunity Tax Credit, or WOTC, where we have data that shows businesses adjust their hiring and employment practices when incentivized through the tax code. Every party benefits under this amendment. The business who takes a chance on a qualified worker can boost productivity, workers can get back on their feet, and the government gets a return on the minimal investment. At the end of the day, we know that the most important stimulus check a family can get is a good paycheck. I urge adoption of this amendment, and I yield back, Mr. Chair.
Thank the gentleman. Let me speak briefly to the assertions that the gentleman made. There's not one Democrat on this committee who believes that we would rather have people sitting at home collecting unemployment insurance than working. Secondly, and most importantly, since this committee wrote most of the CARES Act, there's another very important reminder. If somebody said to me, Mr. Chairman, what was the most important thing in the CARES Act that saved the American economy, I would say it was the extension of unemployment insurance. It gave people confidence to get back into the workforce, which they will in the second half, maybe the third quarter of this year, maybe the fourth quarter. All economic indicators are positive for that. But I think what we've tried to do here is to buy some time on this. On the WOTC credit that the gentleman correctly described, I made sure that was included in the package that we did in December. I'm a big believer. So I think that a fair analysis of the legislation as it relates to unemployment insurance is to simultaneously create liquidity, then creates demand, but getting money into the hands of the people who need it most is our paramount consideration. And I would recognize Mr. Byer.
Will the gentleman yield for 1 second?
Please, yes.
For 30 seconds?
Yes.
Just to be clear, I did not say that Democrats would rather see individuals on unemployment rather than employed. What I did say, and what is true, that Democrats believe that those on unemployment should receive more than when they go back to work, or what they could earn when they're working.
Thank the gentleman. Let me recognize Mr. Byer.
Mr. Chairman, I just withdraw the point of order on the amendment.
The gentleman has withdrawn his point of order, and the Ways and Means Committee has been given a certain instruction as passed in the fiscal 21 budget resolution. This amendment would increase the score of the bill. I urge a no vote. Would the gentleman like a recorded vote?
Yes, I asked for a recorded vote.
The gentleman has asked for a recorded vote. The clerk will call the roll.
Mr. Doggett.
Doggett votes no.
Mr. Doggett votes no. Mr. Thompson.
Thompson votes no.
Mr. Thompson votes no. Mr. Larson.
Larson votes no.
Mr. Larson votes no. Mr. Blumenauer.
Blumenauer votes no.
Mr. Blumenauer votes no. Mr. Kine.
Kine, no.
Mr. Kine votes no. Mr. Pascal.
Pascal votes no.
Mr. Pascal votes no. Mr. Davis.
Davis votes no.
Mr. Davis votes no. Ms. Sanchez.
Sanchez votes no.
Ms. Sanchez votes no. Mr. Higgins.
Higgins, no.
Mr. Higgins votes no. Ms. Sewell. Ms. Sewell. Ms. Delbene.
Delbene votes no.
Ms. Delbene votes no. Ms. Chu.
Chu votes no.
Ms. Chu votes no. Ms. Moore.
Moore votes no.
Ms. Moore votes no. Mr. Kilby.
Kilby votes no.
Mr. Kilby votes no. Mr. Boyle.
Boyle votes no.
Mr. Boyle votes no. Mr. Byer.
Byer votes no.
Mr. Byer votes no. Mr. Evans.
Evans votes no.
Mr. Evans votes no. Mr. Schneider.
Schneider votes no.
Mr. Schneider votes no.
How did Sewell vote?
Ms. Sewell, you're not recorded.
No. Sewell votes no.
Ms. Sewell votes no.
Thank you.
Mr. Swazi.
Swazi, no.
Mr. Swazi votes no. Mr. Panetta.
Panetta, no.
Mr. Panetta votes no. Ms. Murphy.
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez.
Gomez, no.
Mr. Gomez votes no. Mr. Horsford. Ms. Plaskett.
Plaskett votes no.
Ms. Plaskett votes no. Mr. Brady.
Mr. Brady votes aye.
Mr. Brady votes aye. Mr. Nunez.
Nunes votes yes.
Mr. Nunez votes yes. Mr. Buchanan.
I like Bird.
Mr. Buchanan.
Votes aye.
Mr. Buchanan votes aye. Mr. Smith of Nebraska.
Smith of Nebraska. Smith of Nebraska votes aye.
Mr. Smith of Nebraska votes aye. Mr. Reed.
Reed votes aye.
Mr. Reed votes aye. Mr. Kelly.
Kelly votes aye.
Mr. Kelly votes aye. Mr. Smith of Missouri.
Mr. Smith of Missouri votes aye.
Mr. Smith of Missouri votes aye. Mr. Rice.
Rice votes aye.
Mr. Rice votes aye. Mr. Schweikert.
Schweikert, yes.
Mr. Schweikert votes yes. Ms. Walorski.
Walorski votes aye.
Ms. Walorski votes aye. Mr. LaHood.
LaHood, yes.
Mr. LaHood votes yes. Dr. Wenstrup.
Wenstrup, yes.
Dr. Wenstrup votes yes. Mr. Arrington.
Arrington's yes.
Mr. Arrington votes yes. Dr. Ferguson.
Ferguson votes yes.
Dr. Ferguson votes yes. Mr. Estes.
Estes votes yes.
Mr. Estes votes yes. Mr. Smucker.
Smucker, aye.
Mr. Smucker votes aye. Mr. Hearn.
Hearn, yes.
Mr. Hearn votes yes. Mrs. Miller.
Miller votes aye.
Mrs. Miller votes aye. Mr. Horsford. Mr. Chairman.
The chairman
Mr.
votes
Chairman?
no.
Chairman votes no. Mr. Chairman, I have 24 noes, 18 yeas.
There being 24 noes and 18 ayes, the amendment is not agreed to. Are there additional amendments in the nature of an amendment to the amendment?
Mr. Chairman, I have an amendment at the desk.
The ranking member is recognized. Mr. Brady, would you just, Mr. Byer?
Mr. Chairman, I reserve a point of order on the gentleman from Texas's amendment.
Mr. Byer has reserved a point of order, and we will pass out the amendment, and we will recognize Mr. Brady. The ranking member, Mr. Brady, is recognized to speak on his amendment.
Thank you, Mr. Chairman, and I thank you for clarifying the Democrats' position on unemployment. I want to make the Republican position abundantly clear. Despite repeated claims we've heard in this committee that Republicans don't support unemployment benefits for the jobless, that is simply not true, as evidenced by our strong support for the CARES package, for the additional COVID relief in December. We do strongly support unemployment benefits for those who've been hurt by the pandemic. We simply think no one should receive more than they get at work because our small businesses tell us how much it's affected their hiring. We also think that if we tied those benefits to the state formulas, it's a smarter way to help people and remove barriers to getting them back to work. So this amendment provides an extra stimulus check to the Joe jobless. These are those Americans who are losing their jobs due to the executive actions of President Biden or the federal minimum wage mandate. As you know, President Biden's top priority, besides crushing the virus, is rebuilding the economy, getting people back to work. But his actions in the first few weeks of his administration and the $15 minimum wage, which may be included in this bill, will cost hardworking Americans over 2 million jobs. So who are the Joe Jobless? They are the blue-collar workers, women, minorities, immigrants, and young workers, many of them not well educated and low income, who have lost or will lose their jobs or not be offered one at all due to his actions in the minimum wage. It's the 10,000 blue-collar union workers who are losing their jobs due to the cancellation of Keystone XL pipeline, 10,000 workers that the AFL-CIO is trying to defend. This president won't. I heard from Houston area energy company TC Energy, who are laying off 1,000 workers due to this. To Price Gregory in Houston and P-Ben, that will not be hiring 1,000 workers each because of the president's actions. The Joe Jobless are those who are losing their jobs, up to 1 million, when the ban on oil and gas leases and permits in federal lands are fully implemented and permanent, as everyone expects. These are workers who have good paying jobs, supporting families that rely upon this. I invited the president respectfully to come to Houston, to meet face to face with the Joe Jobless. Tell them why their jobs don't matter. Tell them why their families don't matter, and tell them where they can apply for all those new jobs they've been promised now, because their bills are due now. Their kids are going to college now. The Joe Jobless are those who, 1.4 million, who will lose their jobs or not have it offered by raising the federal minimum wage to $15. As the Congressional Budget Office says, these workers who will be hurt are young, predominantly. They are less educated. They're trying to get their foot in the door. It makes sense that they'd be hurt because in Texas, a small business with 10 workers will pay over $150,000 more each year because of this federal wage mandate. What that means, there'll be fewer workers, fewer hours, and my guess is fewer small businesses as they try to work their way out and survive from this pandemic. The CBO agrees. They believe that when fully implemented, the $15 minimum wage will cost the national deficit $54 billion for all the federal benefits we'll pay out to all these jobless. Seems to me the least we can do is try to help them survive, the Joe Jobless, survive not COVID. This isn't the result. They're not losing their job due to COVID in the economy. They're not losing it due to lockdowns. It's not what some said is boom or bust. Yes, Joe Biden laid down, he boomed them with his executive order, and their jobs are busted. But for all the money that we are spending, almost $2 trillion in this package, at least we can provide a little extra help to those who are damaged the most, whose families are hurt because of these executive actions. Mr. Chairman, I ask for an extra stimulus check to the millions of Joe Jobless in America. I yield back.
Thank the gentleman. Mr. Byer.
Mr. Chairman, I withdraw my point of order.
Mr. Byer has withdrawn his point of order, and the chair would rule that the Ways and Means Committee has been given an instruction as passed in fiscal 2021 through the budget resolution. This amendment would increase the score of the bill. I urge a no vote. Would like to speak? Yeah. Oh, okay. Well, why don't we recognize the gentleman from Missouri, Mr. Smith, who would like to speak on the amendment? We will do that.
Mr. Chairman.
Gentleman's recognized.
Thank you, Mr. Chairman. On his first day in office, with the stroke of his pen, President Biden fired thousands of American workers. He sent a clear message that he's not in office to support working class Americans. Rather, he's in office to cater to big corporations and socialist liberal. Fired Keystone workers have described the president's actions as a gut punch and a slap in the face. And who can blame them? In the midst of a pandemic, the President of the United States decided their job security was not as important as satisfying radical environmentalists. One worker, Valerie Knight, shared that both her and her husband were going to have the opportunity to work on the pipeline. This was going to be her first job going back since she had her son. Mindy Saylor, the wife of another worker, asked how they're supposed to pay for her daughter's college education now. And another worker lamented, how is it tough to make the plans when the Biden administration is trying to crush their future? These are Americans, and they're hurting. They played by the rules, had good paying jobs, and were providing for their families. And now, my colleagues on the other side of the aisle have proposed another gut punch, a job-destroying mandate on small businesses. In fact, a $15 Washington mandate would cast out hundreds of thousands of disabled Americans from the workplace. These individuals love going to work every day. To them, their jobs are not about a paycheck. Their jobs are about community, independence, building relationships, and gives them a sense of purpose. We cannot put at risk the jobs of disabled Americans working in sheltered workshops across our country. These are the very folks that we are supposed to be helping. Let's put policies which does just that. I support helping hardworking Americans, and I support this amendment. I yield back, Mr. Chairman.
Thank the gentleman. Is there anybody else who wishes to be heard on the amendment? We proceed to a vote. Would you like a vote, Mr. Brady?
Yes, sir.
The gentleman from Texas, the ranking member, has requested a vote on his amendment. Members are reminded to unmute themselves for a voice vote. All those in favor, please signify by saying aye.
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 Those opposed, no.
No.
No. In the opinion of the chair, the noes have it. A record vote has been requested. Members are reminded that your camera must be turned on in order to be recorded. Please mute yourself until the clerk calls on you and state your name when recording your vote. The clerk will call the roll.
Mr. Doggett.
Doggett votes no.
Mr. Doggett votes no. Mr. Thompson.
Thompson votes no.
Mr. Thompson votes no. Mr. Larson.
Larson votes no.
Mr. Larson votes no. Mr. Blumenauer. Mr. Blumenauer. Mr. Kine.
Kind, no.
Mr. Kine votes no. Mr. Pascal.
Pascal, no.
Mr. Pascal votes no. Mr. Davis.
Davis votes no.
Mr. Davis votes no. Ms. Sanchez.
Sanchez votes no.
Ms. Sanchez votes no. Mr. Higgins.
Higgins, no.
Mr. Higgins votes no. Ms. Sewell.
Sewell, no.
Ms. Sewell votes no. Ms. Del Bene.
Del Bene votes no.
Ms. Del Bene votes no. Ms. Chu.
Chu votes no.
Ms. Chu votes no. Ms. Moore. Ms. Moore. Mr. Kilby.
Kildee votes no.
Mr. Kilby votes no. Mr. Boyle.
Boyle, no.
Mr. Boyle votes no. Mr. Byer.
Byer votes no.
Mr. Byer votes no. Mr. Evans.
Evans votes no.
Mr. Evans votes no. Mr. Schneider.
Schneider votes no.
Mr. Schneider votes no. Mr. Swazi.
Swazi, no.
Mr. Swazi votes no. Mr. Panetta.
Panetta, no.
Mr. Panetta votes no. Ms. Murphy.
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez.
Gomez, no.
Mr. Gomez votes no. Mr. Horsford.
Horsford votes no.
Mr. Horsford votes no. Ms. Plaskett.
Plaskett votes no.
Plaskett votes no.
Mr. Chairman, this is Gwen Moore. How am I recorded?
Ms. Moore, you're not recorded?
I'd like to be recorded as no.
Ms. Moore votes no.
Blumenauer votes no.
Mr. Blumenauer votes no. Mr. Brady.
Brady votes aye.
Mr. Brady votes aye. Mr. Nunez.
Nunez votes aye.
Mr. Nunez votes aye. Mr. Buchanan.
Buchanan votes aye.
Mr. Buchanan votes aye. Mr. Smith of Nebraska.
Smith of Nebraska votes aye.
Mr. Smith of Nebraska votes aye. Mr. Reed.
Reed votes aye.
Mr. Reed votes aye. Mr. Kelly.
Kelly votes aye.
Mr. Kelly votes aye. Mr. Smith of Missouri.
Mr. Smith of Missouri votes aye.
Mr. Smith of Missouri votes aye. Mr. Rice.
Rice votes aye.
Mr. Rice votes aye. Mr. Schweikert.
Schweikert votes aye.
Mr. Schweikert votes aye. Ms. Walorski.
Walorski votes aye.
Ms. Walorski votes aye. Mr. LaHood. Dr. Wenstrup.
Wenstrup votes aye.
Dr. Wenstrup votes aye. Mr. Arrington.
Arrington's a yes.
Mr. Arrington votes yes. Dr. Ferguson.
Ferguson is a yes.
Dr. Ferguson votes yes. Mr. Estes.
Estes votes yes.
Mr. Estes votes yes. Mr. Smucker.
Smucker, aye.
Mr. Smucker votes aye. Mr. Hearn.
Who votes yes?
Mr. Hearn votes yes. Mrs. Miller.
Miller votes aye.
Mrs. Miller votes aye. Mr. Chairman.
Chairman votes no.
Chairman votes no. Mr. Chairman, I have 25 noes and 17 yeas.
Being 25 noes and 17 ayes, the amendment fails. Are there additional amendments to the amendment in the nature of a substitute? Chair would recognize Mr. Buchanan to offer his amendment. The chair would recognize Mr. Byer from Virginia.
Mr. Chairman, I reserve a point of order on Mr. Buchanan's amendment.
Mr. Byer has reserved a point of order on Mr. Buchanan's amendment, and as soon as the amendment is passed out, the gentleman from Florida will be recognized to speak on his amendment. Good. The gentleman from Florida is recognized to speak on his amendment. Mr. Buchanan. Would you unmute? We can see you, Mr. Buchanan, but we await hearing you.
Okay. According to the Small Business Administration, the SBA, small businesses account for 64% of all new jobs created in the United States. In Florida, small businesses are responsible for 3 million jobs and account for 99% of all employers. So 99% of all the employers in Florida are small businesses. Most small businesses are 25 employees and less. These job creators are the backbone of the economy. They need more help during these challenging times, and my amendment would help them. President Biden COVID-19 plan includes a proposal that the federal government mandate minimum wage on all employers, increasing the minimum wage from $7.25 to $15 an hour by 2025. One business guy made it very clear to me personally. He said, Vern, you put out there $15 an hour. It's kind of like the idea of buy 2 cups of coffee, and if you add that up, it doesn't cost you more than 2 cups of coffee. Maybe in a month you make a car payment. But the bottom line is, anybody knows that's in business, $15 an hour with benefits, insurance, matching FICA and other things is really $20 an hour. Times 40 hours a week, it's 100. Times 4 weeks, so it's where the ends up 3,500. And you look at the overall number, $40,000 a year. So we say $15. The small business guy, he understands it's going to cost him for an employee $40,000 when he gets to $15 an hour. That's the reality of what we're dealing with. The budget office released a report recently predicting that minimum wage increase will eliminate 1.4 million jobs in America. In this unprecedented global pandemic, we need to create more jobs to eliminate over 1 million jobs. My amendment creates refundable tax against payroll taxes equal to 100% of the difference in current wages and it's what a small business pays its workers and increase the federal minimum wage. The amendment targets its benefits to those businesses who need it most. Businesses 50 employees or less. And some other programs, we said 500 employees or less. This is 50 employees or less. It makes up the small business community across the country. Mine will help small businesses keep their workers on their payroll by offsetting extra costs associated with the Biden minimum wage mandate. My colleagues to support Main Street. They're hanging on by thread. And with that, I yield back the balance of my time.
Thank you. Mr. Buchanan, because there was a technical difficulty with your presentation, I would suggest that we include your statement in the record officially. So would you submit that through staff to make sure that that's accomplished? Without objection. Mr. Byer.
I will. Thank you.
Mr. Chairman, I withdraw my point of order.
The gentleman has withdrawn his point of order, and the chair would rule that the Ways and Means Committee has been given an instruction as passed in the fiscal 2021 budget resolution. This amendment would increase the score of the bill. I urge a no vote. The question is on agreeing to the amendment offered by the gentleman from Florida, Mr. Buchanan. Members are reminded to unmute themselves for the voice vote. All those in favor of Mr. Buchanan's amendment signify by saying aye.
Aye.
Those opposed, no.
No. No. No. No.
In the opinion of the chair, the noes have it.
I seek a record vote.
Mr. Brady has requested a recorded vote. Members are reminded that your camera. Members are reminded that your camera must be turned on in order to be recorded. Please mute yourself until the clerk calls on you and state your name when recording your vote. The clerk will now call the roll.
Mr. Doggett.
Mr. Doggett votes no.
Mr. Doggett votes no. Mr. Thompson.
Thompson votes no.
Mr. Thompson votes no. Mr. Larson.
Larson votes no.
Mr. Larson votes no. Mr. Blumenauer.
Blumenauer votes no.
Mr. Blumenauer votes no. Mr. Kine.
No.
Mr. Kine votes no. Mr. Pasquarello.
Pasquarello, no.
Mr. Pasquarello votes no. Mr. Davis.
Davis, no.
Mr. Davis votes no. Ms. Sanchez.
Sanchez votes no.
Ms. Sanchez votes no. Mr. Higgins.
Higgins, no.
Mr. Higgins votes no. Ms. Sewell.
Sewell votes no.
Ms. Sewell votes no. Ms. Del Bene.
Del Bene, no.
Ms. Del Bene votes no. Ms. Chu?
Chu votes no.
Ms. Chu votes no. Ms. Moore?
Moore votes no.
Ms. Moore votes no. Mr. Kildee?
Kildee votes no.
Mr. Kildee votes no. Mr. Boyle?
Boyle, no.
Mr. Boyle votes no. Mr. Byer?
Byer votes no.
Mr. Byer votes no. Mr. Evans?
Evans votes no.
Mr. Evans votes no. Mr. Schneider?
Schneider votes no.
Mr. Schneider votes no. Mr. Swazi? Mr. Swazi? Mr. Panetta?
Panetta, no.
Mr. Panetta votes no. Ms. Murphy?
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez?
Gomez, no.
Mr. Gomez votes no. Mr. Horsford?
Horsford votes no.
Mr. Horsford votes no. Ms. Plaskett?
Plaskett votes no.
Ms. Plaskett votes no. Mr. Brady?
Mr. Brady votes aye.
Mr. Brady votes aye. Mr. Nunez?
Nunes votes yes.
Mr. Nunez votes yes. Mr. Buchanan? Mr. Buchanan?
Buchanan votes aye.
Mr. Buchanan votes aye.
Buchanan votes aye.
Mr. Smith?
Buchanan votes aye.
I have you, Mr. Buchanan. I have you recorded as aye. Mr. Smith of Nebraska?
Smith of Nebraska votes aye.
Mr. Smith of Nebraska votes aye. Mr. Reed?
Reed, aye.
Mr. Reed votes aye. Mr. Kelly?
Kelly votes aye.
Mr. Kelly votes aye. Mr. Smith of Missouri?
Smith of Missouri votes aye.
Mr. Smith of Missouri votes aye. Mr. Rice?
Aye. Mr. Rice votes aye.
Mr. Rice votes aye. Mr. Schweikert?
Yes.
Mr. Schweikert votes yes. Ms. Walorski?
Walorski votes yes.
Ms. Walorski votes yes. Mr. LaHood? Dr. Winstrup?
Winthrop, yes.
Dr. Winstrup votes yes. Mr. Arrington? Mr. Arrington? Dr. Ferguson?
Ferguson is a yes.
Dr. Ferguson votes yes. Mr. Estes?
Estes votes yes.
Mr. Estes votes yes. Mr. Smucker?
Smucker, aye.
Mr. Smucker votes aye. Mr. Hearn?
Hearn votes yes.
Mr. Hearn votes yes. Ms. Miller?
Miller votes aye.
Mrs. Miller votes aye. Mr. Swazi?
Swazi is no.
Mr. Swazi votes no. Mr. LaHood? Mr. Arrington? Mr. Chairman?
The chairman votes no.
Mr. Chairman votes no.
The clerk will report the tally.
Mr. Chairman, I have 25 noes and 16 yeas.
There being 25 noes and 16 ayes, the amendment fails. Are there additional amendments to the amendment in the nature of a substitute?
Mr. Chairman?
Jason Smith? The gentleman from Missouri, Mr. Smith, is recognized. And if you'll hold off while I recognize Mr. Byer. Mr. Byer?
Mr. Chairman, I reserve a point of order on Mr. Smith's amendment.
Mr. Byer is reserved a point of order, and we'll just await the amendment being dispersed, and we will recognize the gentleman from Missouri. gentleman from Missouri, Mr. Smith, is recognized to speak on his amendment.
Thank you, Mr. Chairman. Before I begin, I'd like to submit into the record a Wall Street Journal article titled "The Teachers Union's Roll Over Biden." It details the embarrassment that is President Biden's school reopening plan.
Without objection.
Trump or their statements or ideas.
I'm offering this amendment today in the hopes of giving my friends on the other side of the aisle another chance to make the right choice and help families with unexpected education costs. It has been heartbreaking to hear the stories of school children hit hard by the pandemic and school closures. Most troubling is the impact on children in lower income households and in rural areas. The folks I represent are struggling with at-home learning, not just because of the strain it puts on working parents, but also because of the lack of access to classroom necessities like school supplies and broadband connections. They lack the technology to connect students with virtual classrooms, basic school supplies, and additional learning materials to help bridge the gap to ensure that our children don't fall behind our unexpected expenses. This week, parents were devastated to learn that President Biden will not keep his promise to reopen schools once again. The broken promise runs contrary to the science, and we here in Congress must act. If this administration won't step up, then we have to. Parents need resources to invest in their children's futures. This amendment would allow families to use 529 education savings accounts for K-12 tuition, books, and instructional materials, tutoring expenses, fees for exams related to college admissions, and educational therapy for students with disabilities. Parents, not Washington, know what is best for their children. Our role here today should be to make it easier for them to plan for their children's future and unique educational needs. I hope to see all of my colleagues support this amendment, a policy that has received bipartisan support in the past. Let's get bipartisan support today. If now is not the time to empower parents as educators, then I don't know when is. Let's expand 529s to help American families. Let's give children the tools they need to succeed. I urge adoption of this amendment. I yield back.
Thank the gentleman. Mr. Byer.
Mr. Chairman, I withdraw my point of order.
Mr. Byer has withdrawn his point of order. The Ways and Means Committee has been given an instruction as passed in the fiscal 2021 budget resolution. This amendment would increase the score of the bill. I urge a no vote. Mr. Brady has requested a roll call vote.
No, I would like to speak on the amendment.
I apologize.
That's okay.
The gentleman is recognized.
I understand that the Budget Committee, in their haste, gave the Ways and Means Committee a certain budget rule. I understand that explicitly. Let's talk about what that means in the real world. So right now in this bill, in the COVID package, we're spending $130 billion to give to public schools that aren't even open. We have money for states who refuse to make sure that their nursing home data is true and honest. We have healthcare money at work for those not legally allowed to work. We have plenty of money for taxpayer dollars for abortions and to pay more to those who are unemployed to not work than to help get them back to work. And we won't insist when people file for unemployment that we simply verify who they are and how much they work. Nor will we insist that money to reduce child poverty actually go to children who are in poverty. But there is not a dime, as we hear over and over, not a dime to help the millions of Joe Jobless who are losing their jobs, to small businesses who will likely either cut workers or go out of business because of the minimum wage. There is nothing, not a dime, for the Republican amendments to help businesses hire those who are the hardest to hire, who've looked the longest and have the biggest challenges, do it not a dime to help create incentives for a healthy workplace for workers and customers. And it just seems to me our priorities in this package are exactly wrong. There is nothing, and this has been proven in the last hour, those who support this bill are not putting a dime to helping Main Street businesses survive or help our jobless get back to work. I think that's a bipartisan issue. I believe while we disagree on policy, this is a committee that has always found common ground where we can on our priorities. I do believe we should slow this rush package down, sit down and find a way that we help those who need help right now, as well as find a way to help our Main Street businesses survive and help our jobless get to work. Without that bipartisan, reasonable effort, Republicans cannot and will not support this package. I yield back.
I thank the gentleman. Chair is prepared to call a vote. The question is on agreeing to the amendment offered by the gentleman from Missouri, Mr. Smith. Members are reminded to unmute themselves for a voice vote. All those in favor signify by saying aye.
Aye. Aye.
Those opposed, no.
Aye. No.
No.
And on that, I seek a recording.
In the opinion of the chair, the noes have it. A record vote has been requested. Members are reminded that your camera must be turned on in order to be recorded. Please mute yourself until the clerk calls on you and state your name when recording your vote. The clerk will please call the roll.
Mr. Doggett.
Doggett votes no.
Mr. Doggett votes no. Mr. Thompson.
Thompson votes no.
Mr. Thompson votes no. Mr. Larson.
Larson votes no.
Mr. Larson votes no. Mr. Blumenauer.
Blumenauer votes no.
Mr. Blumenauer votes no. Mr. Kind.
Kind, no.
Mr. Kind votes no. Mr. Pascal.
Pascal, no.
Mr. Pascal votes no. Mr. Davis.
Davis votes no.
Mr. Davis votes no. Ms. Sanchez.
Sanchez votes no.
Ms. Sanchez votes no. Mr. Higgins.
Higgins, no.
Mr. Higgins votes no. Ms. Sewell.
Sewell votes no.
Ms. Sewell votes no. Ms. Dalbene.
Dalbene votes no.
Ms. Dalbene votes no. Ms. Chu.
Chu votes no.
Ms. Chu votes no. Ms. Moore.
Moore votes no.
Ms. Moore votes no. Mr. Kildee.
Kildee votes no.
Mr. Kildee votes no. Mr. Boyle.
Boyle votes no.
Mr. Boyle votes no. Mr. Byer.
Byer, no.
Mr. Byer votes no. Mr. Evans.
Evans votes no.
Mr. Evans votes no. Mr. Schneider.
Schneider votes no.
Mr. Schneider votes no. Mr. Swazi.
Swazi votes no.
Mr. Swazi votes no. Mr. Panetta.
Panetta, no.
Mr. Panetta votes no. Ms. Murphy.
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez.
Gomez, no.
Mr. Gomez votes no. Mr. Horsford.
Horsford votes no.
Mr. Horsford votes no. Ms. Plaskett.
Plaskett votes no.
Ms. Plaskett votes no. Mr. Brady.
Mr. Brady votes aye.
Mr. Brady votes aye. Mr. Nunez.
Mr. Nunes votes aye.
Mr. Nunez votes aye. Mr. Buchanan.
Buchanan votes aye.
Mr. Buchanan votes aye. Mr. Smith of Nebraska.
Smith of Nebraska votes aye.
Mr. Smith of Nebraska votes aye. Mr. Reed.
Is this an accidental face?
Reed votes aye.
Yes.
Sorry. Reed votes aye.
Mr. Reed.
Reed votes aye.
Mr. Reed
Aye.
votes aye. Mr. Kelly.
Kelly votes aye.
Mr. Kelly votes aye. Mr. Smith of Missouri.
Mr. Smith of Missouri votes aye.
Mr. Smith of Missouri votes aye. Mr. Rice.
Rice votes aye.
Mr. Rice votes aye. Mr. Schweikert.
Schweikert, aye.
Mr. Schweikert votes aye. Ms. Walorski.
Walorski votes aye.
Ms. Walorski votes aye. Mr. LaHood. Dr. Wenstrup.
Wenstrup votes aye.
Dr. Wenstrup votes aye. Mr. Arrington.
Arrington's a yes.
Mr. Arrington votes yes. Dr. Ferguson.
Ferguson is a yes.
Dr. Ferguson votes yes. Mr. Estes.
Estes votes yes.
Mr. Estes votes yes. Mr. Smucker.
Smucker, aye.
Mr. Smucker votes aye. Mr. Hearn.
Hearn, aye.
Mr. Hearn votes aye. Ms. Miller. Mrs. Miller.
votes aye.
Mrs. Miller votes aye. Mr. LaHood. Mr. Chairman.
Chairman votes no.
Chairman votes no.
The clerk will report the tally.
Mr. Chairman, I have 25 noes, 17 yeas.
There being 25 noes and 17 ayes, the amendment is not agreed to. Are there additional amendments to the amendment in the nature of a substitute? Jason Smith is recognized, and as you prepare, Mr. Smith, I will recognize Mr. Byer of Virginia.
Mr. Chairman, I reserve a point of order on Mr. Smith's amendment.
Mr. Byer is reserved a point of order. We will await passing out Mr. Smith's amendment. The gentleman from Missouri, Mr. Smith, is recognized to speak on his amendment.
Thank you, Mr. Chairman. I share my colleagues' concerns regarding child poverty. In Southeast Missouri, back home, 24% of children live below the poverty line. That is why the child tax credit is such an important pro-family provision in our tax code, and why I was such a strong supporter of doubling the credit when this committee passed the Republican tax cuts. Unfortunately, my friends on the other side of the aisle opposed our efforts to support American working class families. I welcome the conversation about making the child tax credit even more family friendly. I'm here and ready to work, Mr. Chairman. But why stop at a 1 year plus up? If we want to deliver real aid to parents, let's give them certainty. I believe we should make the $2,000 child tax credit a permanent feature of the tax code to give families certainty for years to come. Without action, the current child tax credit will be cut in half in the coming years. Today, in this room, we have the opportunity to prevent that from happening. A vote against this amendment is yet another missed opportunity to help American families. Let's do the right thing. Let's Republicans and Democrats vote for this amendment. I know we've sat here, this being the second day of the markup, and we have yet to see merely, maybe not even one Democrat vote for any Republican amendment. This is the amendment that maybe just one Democrat will say that they support working class American families by making sure that the child tax credit is permanent. Guess what? You can do this in budget reconciliation. As a Republican leader of the Budget Committee, this will pass the Byrd test in the Senate. So don't make excuses. Do what's right for your constituents. Do what's right for the people. Let's have at least one Democrat on that side of the aisle support working families. Mr. Chairman, I yield back.
I thank the gentleman, and I believe him. Mr. Byer.
Mr. Chairman, I withdraw my point of order.
Mr. Byer has withdrawn his point of order, and the chair recognizes Ms. Del Bene to speak on the amendment.
Thank you, Mr. Chairman, and I want to thank the gentleman for bringing up this important issue. In fact, I have a bill to do this, the American Family Act, which would enhance the child tax credit and make it permanent, which I know is so important to addressing poverty throughout our country. So I hope the gentleman would be willing to work with us on that legislation. Unfortunately, this one violates the committee's instructions, but I would be excited to work with the gentleman going forward. And if he would withdraw his amendment and work with me, I'd appreciate that. I yield.
Does the gentlelady yield?
Yes, I yield.
I would love to work with you on making a permanent child tax credit, as long as you're willing to work with me. I know some of your colleagues aren't working with folks who may have not liked how we voted on objecting. So if you'll work with me on that, I'd be happy to work with you.
Well, please look at our bill. We just introduced the new version this year, this Congress. It's the American Family Act. So take a look at that, and
I definitely will.
I appreciate it. Thank you.
Thank you.
So I think the gentleman's sincere on this, and is he willing to withdraw the amendment?
No, Mr. Chairman, because this is right in order with the budget reconciliation.
All right. So I'm going to suggest then that we turn this down based on the Ways and Means Committee instructions on the 2021 budget resolution, and the amendment would increase the score of the bill, so I urge a no vote, but I do think that the offer from Ms. Del Bene was equally sincere. She's been on this forever, along with other members of the committee, and I think you can find an accommodation. But I am willing to give the gentleman from Missouri a vote on this measure if that's his desire.
It is, Mr.
Mr.
Chairman, and I would like a recorded vote.
That's fine. Okay. So, members are reminded to unmute themselves for the voice vote. All those in favor signify by saying aye.
Aye.
All those opposed, no.
No.
Okay. In the opinion of the chair, the noes have it. The gentleman from Texas, Mr. Brady, has requested a recorded vote. Members are reminded that your camera must be turned on in order to be recorded. Please mute yourself until the clerk calls on you and state your name when recording your vote. The clerk will now call the roll.
Mr. Doggett.
Doggett votes no.
Mr. Doggett votes no. Mr. Thompson.
Thompson votes no.
Mr. Thompson votes no. Mr. Larson.
Larson votes no.
Mr. Larson votes no. Mr. Blumenauer.
Blumenauer votes no.
Mr. Blumenauer votes no. Mr. Kine.
Kine, no.
Mr. Kine votes no. Mr. Pascrell.
Pascrell, no.
Mr. Pascrell votes no. Mr. Davis.
Davis votes no.
Mr. Davis votes no. Ms. Sanchez.
Sanchez votes no.
Ms. Sanchez votes no. Mr. Higgins.
Higgins, no.
Mr. Higgins votes no. Ms. Sewell.
Sewell votes no.
Ms. Sewell votes no. Ms. Delbene.
Delbene votes no.
Ms. Delbene votes no. Ms. Chu.
Chu votes no.
Ms. Chu votes no. Ms. Moore.
Moore votes no.
Ms. Moore votes no. Mr. Kildee.
Kildee votes no.
Mr. Kildee votes no. Mr. Boyle.
Boyle votes no.
Mr. Boyle votes no. Mr. Byer.
Byer votes no.
Mr. Byer votes no. Mr. Evans.
Evans votes no.
Mr. Evans votes no. Mr. Schneider.
Schneider votes no.
Mr. Schneider votes no. Mr. Swazi.
Swazi, no.
Mr. Swazi votes no. Mr. Panetta.
Another no.
Mr. Panetta votes no. Ms. Murphy.
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez.
Gomez, no.
Mr. Gomez votes no. Mr. Horsford.
Horsford votes no.
Mr. Horsford votes no.
Plaskett votes no.
Ms. Plaskett votes no. Mr. Brady.
Brady votes aye.
Mr. Brady votes aye. Mr. Nunez.
Notice votes aye.
Mr. Nunez votes aye. Mr. Buchanan.
Buchanan votes aye.
Mr. Buchanan votes aye. Mr. Smith of Nebraska.
Smith of Nebraska votes aye.
Mr. Smith of Nebraska votes aye. Mr. Reed.
Reed votes aye.
Mr. Reed votes aye. Mr. Kelly.
Kelly votes aye.
Mr. Kelly votes aye. Mr. Smith of Missouri.
Smith of Missouri votes aye.
Mr. Smith of Missouri votes aye. Mr. Rice.
Mr. Rice votes aye.
Mr. Rice votes aye. Mr. Schweikert.
Schweikert, yes.
Mr. Schweikert votes yes. Ms. Walorski.
Walorski votes aye.
Ms. Walorski votes aye. Mr. LaHood. Dr. Winstrup.
Winstrup votes aye.
Dr. Winstrup votes aye. Mr. Arrington.
Arrington's a yes.
Mr. Arrington votes yes. Dr. Ferguson.
Ferguson is yes.
Dr. Ferguson votes yes. Mr. Estes.
Estes votes yes.
Mr. Estes votes yes. Mr. Smucker.
Smucker, aye.
Mr. Smucker votes aye. Mr. Hearn.
Mr. Hearn votes aye.
Mr. Hearn votes aye. Mrs. Miller.
Miller votes aye.
Mrs. Miller votes aye. Mr. LaHood. Mr. Chairman.
Chairman votes no.
Chairman votes no.
The clerk will report the tally.
Mr. Chairman, I have 25 noes and 17 yeas.
There being 25 noes and 17 ayes, the amendment is not agreed to. Are there additional amendments to the amendment in the nature of a substitute? Schweikert. The gentleman from Arizona, Mr. Schweikert, is recognized to introduce his amendment, and Chair would recognize Mr. Byer.
Mr. Chairman, I reserve a point of order on Mr. Schweikert's amendment.
Mr. Byer has reserved a point of order on the Schweikert amendment, and we will take a moment to pass out the gentleman's amendment before he's recognized.
Thank you, Mr. Chairman. Mr. Chairman, it's now the moment I mentioned that here in Scottsdale, it's about 78 degrees outside.
We really appreciate that, Mr. Schweikert.
That's funny because it's about 7 to 8 degrees here in Michigan, too.
Yeah.
That's why so many of your constituents are my neighbors this time of year.
Are we good to go? Ready?
Pat and salt.
Not yet, just another moment. There are certain words that get people going.
It's always fun looking up and seeing everyone's different backgrounds as we do this remotely.
Well, you could wear sunglasses if you'd like, Mr. Schweikert.
I was considering it. Actually, I almost moved the computer out to the deck so you could see the bright sunshine, but I thought that would be particularly cruel.
Yeah, I don't think that would be welcoming to your amendment.